And then I'm hoping to goodness I get 7 error reports back, because I know those are gold. I know those are the things I really want to have to change. So the error reports are like feedback. And so this is the exploring mind on the right, because you can't explore anything if you keep on rejecting anything you get back from the world. If you say, oh, I know what's going on in this world, well, you're not exploring it. You're just walking around. If you go, I'm dying to know what's going on with it, you won't know unless you give it a go. So the prediction is a constant, busy process happening in seconds, presuming and giving everything a go. But if people don't want to give it a go, they then just reject what comes back. And so
just to dwell on that prediction and the error thing for just one more sec, and even at the most banal level of I'm sitting in a room, the door opens, I'm expecting to see my son, but it's not my son, it's you. That's at a day-to-day level, that would be an example of an error report. I might get, if I really didn't expect you, I'd get a big shock, and then I would perhaps, in a way, experience some sort of cognitive dissonance in a way, wouldn't I? Or is that right? Is that what you're saying?
Yes, that's a kind of error report that is expecting an event. Okay, but sometimes I might presume or have a first impression of you, and I've thought that, well, I just took a dislike, and then you provide me an error report that you're a good man, okay, or vice versa, which happens, right? So it's beliefs, it's anything, and grief works in there. This is a completely different topic, but there's I just can't think of the name, but it's can't think of the name. But anyway, this works. There's a model of grief. But going back to this quickly, what I want to show is that that the guys at the table, let's just say they're engineers, right? They really have a good education in engineering. So they are validly having a good confidence they know about engineering. But the 2 error reports is they need to know, and they're building a bridge, they want to know how wide the bridge is. Well, of course, they don't know that from their training. That's the bridge that's in front of them. And so they've mixed the world in a ratio of 8-2, 8 to all their knowledge and 2 how wide the bridge is, validly. This chap over here, he's stubborn. He doesn't want to know the error reports, or he's arrogant. He does not want any error reports. So there's an invalid overconfidence with the same score. Over here is obviously the curious and the children. If children had to do this, they wouldn't become useful adults if they do this. And I missed the little reference. Alison Gopnik's got a book called The Gardeners and the Carpenters. She wrote in 2016, and she talks about parenting. Now, I'm not wanting to get involved in a parenting thing, but her proposition is if we parent children too soon here, they don't develop. We have to parent them there in a very specific way. If we try and make them ready for life too soon, we're doing this, because life will come, but life will come when we have enough knowledge in that bubble we saw earlier. I'm really getting a little behind. Okay, so under the hood, here we go. Did you see how I expanded the executive function so we can have a look inside of it? Now, this is a fascinating idea of where do the predictions come from? That's what we're looking at, right? And the predictions, that's everybody, even good thinkers. That's our training education we saw earlier. And so what we have in the brain is that what it does is the previous error reports gave it a good view of the world, but it doesn't know what's going to happen next. So next it draws out of its knowledge options or guesses. So it says there are 4 possible guesses for what's going to happen next based on all the previous error reports I got in this loop. And these loops can happen incredibly quickly, intermittently, and they're completely unconscious. They just go for it, right? What happens is and then it runs them through, the technical term is a Bayesian inference device, but it's a probability precision ranking.
Mm.
And then what it does is it ranks those, and it ranks those guesses based on previous experience, also based on emotion. So it'll rank one based on a negative experience higher than one based on a positive experience. Anyway, we've known human brains are erratic. You're looking at a picture as to possibly why. And so it goes DCA and it gets A, and then of course A then defines the prediction.
And you mentioned unsupervised learning. That looks a lot like unsupervised learning
That
to me.
is definitely unsupervised learning, yes, in the AI term. And as I said, Turing knew about this, that the brain looked like this in the 1950s. He would not be surprised at this 70 years ago. So yes, that's how I designed AI. He just didn't tell the rest of the world because the rest of the world were very, very keen on behaviorism. They said that you can only understand the brain by behavior alone. And those of you will be surprised with this piece of information. From around the 50s into the early 90s, you could not get $1 in the Western world for research on consciousness. It was banned. They just wanted a black box. But now we don't have time and we can't go down rabbit hole.
Keep going.
So now we're going to have a look at the ADHD, and I've chosen 3 quite basic ideas: inattention, impulsivity, and hyperactivity. And honestly, this is an illustration. This is a bit of fun so that we can have a look at what those 3 things may look like in this model. For some of them, there's some good research, but I don't want to start a contentious discussion, and this one is bound to. So let's have this is really a good
no, let's
play. We're really playing now. This is our speculative fun. So
I'm up for a contentious discussion.
You're up for a contentious play.
Yeah.
Okay. Imprecise weighting. So this is what inattention is. Imprecise weighting, competing predictions. ADHD may be involved in assigning stable precision. And so what we're saying is that we think this probability and precision ranking may not get it perfectly right, and we have our guesses come through, and then our guesses are not differentiating, and they're very confusing. And so pretty much all of those are firing. They're getting caught there. We have a prediction. There's a low conviction in inattention because I'm not attending to anything, so I'm not confident about anything. I have uncertain behavior. I have inattention, and then I have a feedback. But there's nothing really in the feedback loop that I can catch on to until I can focus. So it sounds okay. Well, this looks pop and psych, but it's just fun. We're just having a look at the model. Next, we'll go quickly to
a preponderance of guesses and options is certainly what this ADHD brain feels like a lot of the time.
Yes, and it's not always visible on the outside, and then it looks like a whole lot of other things, and there's the judgment and all of that coming along. So yeah,
sure.
Impulsivity, we thought looks a bit like this. So there's a problem with the probability thing, and there's a problem with the guesses. And so they're all halfway through, they're incomplete. And all of a sudden, the brain decides it's going to just pick a random guess, even if it hasn't arrived. And it's going to shoot its way through a prediction. It's going to say, I'm damn sure about whatever I'm going to do, and I'm doing it to the best of my ability. And it's erratic behavior, sometimes inappropriate, impulsivity. And again, not much coming back of any sense because I'm so busy with my impulse, I didn't hear a thing. There we go. And hyperactivity, this one is a very hyperactive slide, which I quite enjoyed making. So there we get all 3 going along. Basically, the probability thing's turned off. It's not even working. So just look at the description of hyperactivity in this model. It's active sampling to reduce uncertainty. In other words, the brain is dying for an error report, but because it didn't get error reports properly. So it says, let me bounce my body around, because remember, 1,000 years ago, we didn't think like this. We thought with our bodies. We're completely embodied, and we were thinking with our bodies. We went and did something. We didn't read books or anything. So pretty much the brain is doing something. I'm just hoping to goodness I'm going to get an error report. So what happens is it gets there. There's no ranking. They all crowd there. Then, of course, it doesn't have one prediction. It has a whole lot. And then it has all the feedbacks of all the different predictions. But I was just having fun showing how busy and hyperactive my slide was. So it's all good.
And how hyperactive I am. I can promise you that as I'm sitting and doing all these presentations and so on, my two legs are.
Well, there you go. You should tell your legs that it's hopeless to expect any feedback by stamping your feet, because you're not a child.
Well, this is
Anyway, so let's just look at this. This is called, and I didn't even put a title on here, peeling back the veil. So everything we've shown you for the ordinary person for 200,000, well, 70,000 years, because we came up with language about 70,000 years ago. For 200, we were hanging around literally, okay? But about 70,000 years ago, we came up with language and emotion and empathy and all of that. Yuval Harari's Sapiens book has 4 very lovely categories on human development. It's really worth getting a summary of it. Anyway, so what we're going to do is just quickly have a look. I've only got a very small amount left. I can see we're a little over. And really it's saying, how do we access this machine? How do we get into it? Because there are people who don't want to get into it, and we should respect them, because it gives you cortisol doing this. I mean, there's the dopaminergic. Another model of all this is dopaminergic aspects of this whole system. This model doesn't discount that. It's just looking at a mechanism, and all models are wrong. Some are useful. We think this one's useful. So the first step we do is we peel back the veil in our first amount of reflection, and we start getting a close look at the world and see whether we can consciously see what signals the brain is going to get from the world. And we have a very good look at our behavior. Because if our behavior is counterproductive, we're just going to get lemons in the error report. Okay? So we've got to work on those two things, what the world is saying to us and what our behaviors are, and that we don't even have to look in our brains for that. That's that external base of reflection. The next aspect of reflection is to study how sure we are of ourselves, and to try and say, I'm just going to pause on that. I'm going to suspend my feeling that I must be right. A big challenge for ADHD people, granted, this is part of where the predictive stuff, because if you look at this picture and you put it over one of the ADHD pictures, you can see how hard it is when you've got 4 predictions coming out, or one that wasn't even evaluated. So we can get an idea how hard this reflection is for ADHD people. But nevertheless, this is the process. We're peeling back the veil. The next veil we can peel back is how to pay attention to our error reports, to really say there's gold in those things. Let's feel it. And this comes through the gut. The body sends this information. The brain sends information to the body, and then we feel the body. So it's back to front. We don't have an emotion first. We have something happening, then the brain makes us feel an emotion to tell us what's happening. Sounds a bit weird, but it's very cool. So pay attention to those error reports. They're gold. Lowering the conviction, upping the error reports makes us reflective and responsible. And then this is the highest level, and that's to start looking in and understanding the guesses. And I think I'm done.
That fantastic. Well done. That is. I'm sorry we ran so short of time with the
You
various
did give me an
issues
extra
we've
7
had.
minutes, which I'm grateful for.
Well, we actually now, I've literally been told by production I have to say goodbye within a minute. So Errol, thank you. What I'm going to say, I will say, is we will put your presentation up on the website, and we will have you on ADHD TV, because there is much gold in this work. And it's thank
I
you
hope
so much.
everybody enjoyed it. I know I speak fast, but if you can actually run the video on 0.75 speed, and then I can drag along if you like. Thanks, everyone. And
Thanks very much.
I never met anybody, but it was lovely to appear here. And thank you, Andrew, for the invite.
No worries. Thank you too.
And that's us taking over for ADHD Australia. Thank you, Andrew.
Great. Thanks, everybody. We're now going to cross over back to the UK.
Thank you, Andrew.
Thank you also for having attended our conference, and in particular, I really need to thank HCF and Melbourne Support Services for their fantastic sponsorship, which would, without which it would not have been possible to host this. We'll see you in ADHD Assist on our website, and also very soon on ADHD TV. Thanks for coming.
Thank you, Andrew. Almost looks like we were talking to each other. Right, we're into the crossover section between ADHD UK and ADHD Australia, where we're doing it together. We, as ADHD UK, are doing the streaming because we stream across all the social media platforms, but ADHD Australia are firmly in control. So, without further ado, I'm going to bring over Rob. Hello, Rob.
Hi, Henry. How are you?
I'm great, and congratulations on a fantastic session and fantastic conference so far.
We've had a great day. I think, have we passed the 24-hour mark, Henry?
Not quite. We passed out at 1 p.m. We're obviously overachieving, so we're more than 24 hours this conference.
Listen, Henry, this is our third or fourth year of doing this together. It's always been a privilege. It's always interesting. I've seen the speakers that you've had on in the last 12, 13 hours. We've had some terrific presenters. I think there's no other conference like this in the world, is there?
No, I think honestly, it's wonderful. It's a privilege to do it with all the wonderful people who come in. Right, you're emceeing this, but I think I've got the buttons. So
this is sorry.
Yeah, do you want to do the intro?
Yeah, this is the first session of I guess the next phase, the third phase. You wouldn't have seen me before if you're viewing in the UK or in the 124 other countries that are watching this telecast. My name is Rob Lowe. I am the Chief Marketing Officer of ADHD Australia. And Henry has kindly asked me to moderate this next session, which is something that we do every year now, where we bring together the heads of the peak bodies of a number of different countries to compare and contrast what is similar in the ADHD world and what is different. And with that, I'd like to introduce Henry, who is the CEO of ADHD UK, Mel Webster, who is the CEO of ADHD Australia, Moonlake Lee, who is in charge of Unlocking ADHD Singapore, and Darren Bull, who heads up ADHD New Zealand.
Kia ora.
Kia ora. So this section is called ADHD Without Borders, Understanding Global Variations and Cultural Insights. And we basically have three broad questions I'll ask each of you. Henry, as you're the person who is on, I'm going to ask you first. What was the leading issue or challenge that you've had the past year in the ADHD world that has consumed most of your time?
Man, it's been
only one, Henry.
Yeah, I mean, it's been pretty wild. I think the big achievement, the big thing, I know later we've got some slides, we're each talking about the assessment process in our countries to sort of compare and contrast and learn from. We have a very important access path called Right to Choose. So there's a national health service, but it's regionalized in organization. And that can lead to very big differences in how long you're seen. So in one area, we have over 6,000 people waiting, but for the year where we last have stats, they saw 3 people. So we have an effective wait time of over 2,000 years. And in another area, we've got wait times of 12, 16 weeks. There's a thing called right to choose, which is, to quote a commissioner, it's the National Health Service, the NHS, the National Health Service, not the Regional Health Service. And so there's a thing called right to choose, which enables you to be seen in another area. So if you're in Sheffield with 2,000 years to wait and got to learn how to mummify your body Egyptian style to last long enough to get to a assessment, you can instead go to the shorter place. They were going to put in a and if you're Sheffield, obviously you've decided to devalue ADHD, you don't want to pay for it. So if you use right to choose, your local area has to pay for it, but you get the service in another part of the NHS. There were very big moves to change that. They were done in a sort of backwater part of the NHS called the NHS payment system. There was a consultation that was to last 4 weeks, then there's 4 weeks and then it gets implemented. And that was going to place a restrictive cap saying that where roughly 25 to 30 people would be able per area would be able to use that. When you've got a wait of 6,000 people, then 25 people is nothing. We were able to put up a system for people to write to their MPs. We were notified of this happening about a week into the consultation. Week 2, we had a campaign writing for constituents to write to their MP. And in those last 14 days, we were successful in rallying the community to have 14,000 letters and emails written to their MP, many MPs getting over 100. We have 650 MPs, and defending what is a legal right, the right to choose. If you put this cap in, it's not there. And we were successful in getting the government to U-turn, but we knew we'd won the battle, but not the war. And at the end, Prime Minister Rishi Sunak, and before that, in senior roles in the Ministry of Health, and we also then have the ex-head of mental health care for the entirety of NHS England speaking about the fact that there are now new right to choose controls being put in place and what we're going to do about it. But so that's been the biggest battle, and that's because our estimate is roughly 80% of people right now in England, that's how they get their ADHD assessment. So it is the dominant path, and it's trying to be stopped, and that would be ruinous. Back to you.
Where do you think this will end up, Henry? Like, if you were to look 1 year forward, what do you think is going to happen?
I mean, we are in a really fragile political setup right now. Right. So you have Labour, Keir Starmer, his statistics are now that he's the most unpopular Prime Minister we've ever had since we've been collecting those statistics, which, considering that's now lower than Liz Truss, who was famously less successful than an iceberg lettuce in her Prime Minister ability. So for those that don't know, that she was considered to last such a short time. I think it was the Daily Star put a live video on an iceberg lettuce and said this lettuce will last longer than Liz Truss, and it did. No, like, and we have Reform, who have made some quite aggressive statements around neurodivergence, and there's a viewpoint that people getting an assessment means they then go on benefits, which is not what we see at all. We see people getting an assessment to thrive in life, but that view is one that's being held by people, and so that could make things much worse. We're not expecting an election for many years for the nation, but Wales has one next year, and Reform are currently polled to win it. So there's a lot of jostling, and we're seeing a lot of statements around support for mental health and it creating a benefit cost rather than being a support. But then you say to people, like, what's happening is people are struggling because they're not getting support, and making that argument. We are going to fight tooth and nail, Rob, but I honestly, it's hard to say what we expect to happen.
There are bigger systemic problems by the sound of it. Blimey. Darren, better or worse in New Zealand?
It's going to be significantly better. Over last year, the government have announced significant changes to the way ADHD is diagnosed and prescribed, which comes into effect 1st of Feb. It also, already in effect, removed the barriers to accessing ADHD medication once you've been diagnosed. So in terms of our focus, it's on getting ready for 1st of Feb. The main issue we have now are medication shortages, and Pharmac, which is our medicine body, have been great with the communication and looking for alternatives. So this change has been a long time coming. It's the biggest change in ADHD for 30 years in the New Zealand medical system. So yeah, better.
Very good. Very good. Moonlight, what's your take on things?
Thank you. Things are also looking better in Singapore. There's still not sufficient awareness about what ADHD is and the impact on people's life throughout the lifespan. But organizationally, for Unlocking ADHD, we turned 4 years old this month. So we really are the new kid on the block. And what is special this year, about 6 months ago, we received this status called the IPC status, the Institution of a Public Character. So what this means for a charity like ours is that donations to us are tax deductible now. Prior to this, they were not. And in Singapore, the law is 2.5 times the donation amount. So you can imagine when a donor has a choice between a charity that can give the tax deductibility and one that cannot, which would they favor? So this was a significant breakthrough because we are the only charity that's focusing on ADHD in Singapore that now has that status, and that actually has helped a lot. That's the first thing organizationally. The second thing that I'm really excited to announce just happened a couple of days ago, so it's breaking news. There's a very well-established regional conglomerate called Jardine Matheson that has its own charity arm called Mindset that promotes mental health. They have come on board alongside Unlocking ADHD with a Singapore $1 million pledge over a 3-year period to support us to establish for the first time accessible ADHD informed counseling services and other services. So
your lobbying efforts are starting to pay off, Moonlight.
Yeah, but it's been pretty hairy, okay, to say the least. But we're so grateful because it's such a significant move because this is a very well-established regional corporation that has multiple business units, including, like, say, Starbucks here, and pharmacies and real estate, and they have come alongside us because they recognize the importance of supporting not just on the mental health, but a very often overlooked condition. So we've already got 3 counselors on board, and we're sort of ramping things up, and I still hope to attract more funding support because we're hoping to roll out executive function coaching and ADHD coaching next year. So that's the big thing as well. And we are launching a book next week, and it's called Differently Wired Minds. And this year, Singapore turns 60 years old. So to commemorate this, we call it SG60. We thought it would be meaningful to have a book featuring 60 Singapore ADHDers sharing their journey from all walks of life and all ages, all ethnic groups. But being ADHDers, sometimes we overdo things. So I didn't get 60, I had 63. But we also are going to be launching a video, the first public awareness video on ADHD called Focus on Us. And the reason why it's so exciting for the book and the video is created by ADHDers, featuring ADHDers, not just for ADHD community, but also for others to help understand us better and also show that there are ways that we can thrive. So for the book itself, even though there's going to be limited copies, hardcover available as a fundraising gift for those who donate to us of a certain amount, we're also making sure they're available on our website so that anyone and everyone can access the journeys, the strategies, so that no one is having a lack of access in terms of being able to get tools to thrive. So some things that are keeping us organizationally busy, but in Singapore overall,
is that it?
because the government now is updating the clinical practice guidelines on ADHD. So I'm on that team, And for the first time, adult ADHD is going to be included. So we hope to release all these things, hopefully by end of next year. We'll update by then. Thank you.
That's
Wow.
awesome. It's an epochal year for you. That's
Awesome.
extraordinary.
Yeah.
Awesome.
Yeah, congratulations.
Thank
Like
you.
that's, I think we all know how much work you like that involves and how much you put in, and actually how extraordinary you are in your abilities to connect with people and get stuff happening. Right, I'm going to be needing to take some lessons. You're amazing.
I'm learning from everyone.
We're overdue for a trip to Singapore, so that sounds like a very good idea.
Yeah.
Now, yeah. Now I
Yeah,
might
look,
stop you, and then I'll get you to double up on the next question too, which is
no,
what do you think's
not a
gonna
problem at all. Look, I suppose what's really interesting is probably for this the first time ever in Australia, we have seen significant changes this year. If you asked me this question, Rob, back in January this year, I would have said to you one of the most difficult challenges for us was affordable ADHD diagnosis, treatment. We had long waiting times, out-of-pocket costs, medication shortages and regulation delays, stigma continuing. We still have that significantly across the states. But what I would say is, for the first time ever, we've seen significant changes across different states, and we're hoping to see across all states of Australia. One of the biggest is the New South Wales ADHD reform. Government now is allowing trained GPs to prescribe ongoing ADHD medication for patients. This is a significant impact positively to individuals. Trained individuals being able to do this means that it reduces the resilience and the overload on individuals as a whole. It also means that now more people are going to be able to access prescribed medication in a way that they need to. The next stage is phase 2. It's the GP diagnostic pathway, which is super exciting because what it's going to allow us to do in some states, and again, ADHD pushing Australia hard for it to happen across Australia, but is basically for us to be able to look at initiating ADHD diagnosis for GPs, those specially trained to do so. That's really important. It isn't all GPs, it's those specially trained to do so. But this reform is going to change significantly for what we're trying to achieve here in Australia. Also, the expansion of telehealth in Australia has been huge. I think some of that is COVID related, but it continues to be fantastic in driving that, not just from a COVID space, but ongoing as we move forward. Schools also across Australia and also community are really starting to take that inclusive approach to strategies. We've had some amazing talks throughout the day from educators, whether that be universities, but also across schools, where schools are really wanting to and commit to making that change for individuals with ADHD and the community as a whole. So for the first time ever, Rob, I think, and you're here based in Australia, in Sydney, I think it's fair to say that it's a very exciting time for us. We've got a lot still to do, but at the same time, I think it's a significant shift to this time last year when I was speaking to you, Henry, and Moon Lake, and Darren and I didn't have the opportunity last year, but I think just being in New Zealand, you can hear and probably more aware of some of the changes we've had here in Australia.
Great news, isn't it? Being a resident of New South Wales and having family members that have ADHD, it was with excitement that we greeted that news. So yeah, very much so. Darren, changes coming forward in the next year, positive or negative, that you think that you'll be dealing with?
Positive. So the big change, very similar to Australia, because the Royal Colleges go across Australasia, and we're very much here building on the work with APTA, which is across both countries. It's positive because New Zealand will go to trained GPs diagnosing and prescribing from the 1st of Feb. And that will do a number of things that will reduce the wait times. We've got the wait times according to the surveys we do. It's somewhere between 3 to 6 months where you live, depending where you live in New Zealand, for both public and private. So we're expecting a few hundred trained GPs over the next next few years to sort of come through. So it's going to have a real positive impact. The other aspect to it, they will charge. It will be estimated, still to be confirmed, $400 to $500. To go private, it's $2,000 to $3,000. And I've even heard of someone being charged $5,000. So that's the really big change. The challenge is now is to ensure enough GPs are trained. So the Royal College of GPs is doing a great job bringing that through, along with the University of Auckland School of Medicine. We're really, I just want to call this out, with this is the 10 years of work to get this far, but the work that APTA did in Australia, we're really standing on their shoulders, and we're using the Australian guidelines here, which is fantastic, and also the NICE guidelines from the UK. And I can't overstate how important it is to have quality guidelines, obviously, but to be able to bring on two pieces of really strong work from Australia and the UK means New Zealand doesn't have to build our own guidelines. There is the intention to do that, but we're in a strong place to do that. Yeah.
Excellent. Moonlight.
Yeah, I also echo the learnings from each other, and I think it really helps to shortcut the process, but also show the best practices. In Singapore, I think there are some movements as well, and I'm hopeful. One of the things that's recently launched is the Institute of Mental Health is doing a large population study for children within a certain age group, I think 9 to 16, and they're specifically trying to assess the prevalence for ADHD, ASD, anxiety, and depression. There really hasn't been any study of ADHD since I think 2014. So this is something big, and I think from what I understand, if there is some diagnosis, there will be further support given on the next level. So to me, this is very encouraging, and it's important because when there's more data, then people can measure it, then they know in terms of planning on how to address it. So that's important. And then from the mental health side, the Singapore Prime Minister, the Singapore government is very much focused on mental health. There's even special committee set up. So we're adopting a tiered care model for mental health. So tier 1 being community. So there's lots of effort here trying to get more people in the community to be upskilled, to understand mental health, to have the tools to support each other, so peer support, but also having a next level step up, the basic care, and then further on, so that at least the tertiary complex cases are sort of not creating, we're not having bottlenecks where they should not be. So I'm hoping that, in terms of how we want to roll out coaching next year and subsequently, we can also show that we're very much in line with this approach. So these are the two main things that we're looking at.
Awesome. Henry, in terms of what you think is going to happen over the next 12 months, we may have covered that, unless there's something you'd like to add. Otherwise, we might move on to the diagnosis pathway. What would you like to do there?
I think, there's too much happening all at the same time. Certainly, I think some of the lessons from what's happening in your territories, the GPs taking a bigger role is really important. We're seeing that conversation happen. We have, they're called the Royal Colleges, who take the lead on that. We unfortunately are dealing with a very large industrial dispute with GPs. So there is a standard contract with GP practices. The current government has essentially foisted that on GPs. They were looking to negotiate for change. As a part of that, their union, the British Medical Association, listed 122 different things they could do industrial dispute on. They chose, the predominant GPs have chosen 3 of those, and guess who's one of them? And so we are finding GPs aren't actually doing the reverse of taking over. We've had a thing called shared care, where you get assessed by a specialist and the GP takes over your monthly reviews, and many GPs are now refusing to do that. And that's particularly significant if you've been seen privately, because then privately you have to pay the retail price of medication, so 100, 140, 160 pounds every month, versus an NHS standard prescription of £9.90. It's a huge difference, as well as not needing to go and see that specialist, some of whom will charge. And Darren spoke really well to the problem that we have really high price variability. So I know some places are charging £50 for that monthly meeting, and others paying 250. I mean, so then that's 250 plus 160, right? It's a huge amount every month. GPs are not only not accepting new shared care, but in some areas they're dropping their patients entirely. And then you're dropping to a service that has a wait times of years. So it's a absolutely massive problem. I would like to say in most cases where that's happened, we have seen the central service. Well, we get mixed messages on it, but it seems to be getting better at making sure people continue with medication. But what that then is doing is it means that those local services, instead of seeing new people, have to use their capacity to see current people. And so it's making the backlog even worse. So it's great hearing the GP initiatives that are happening in your areas, but we are clearly playing a completely different game. We're having to just play defense and try and stop an erosion, whereas you're talking about progress, which right now honestly seems far away.
It's
but we are
interesting
definitely
because
fighting, and we definitely have a big community. 14,000 people.
It's clearly
right into MP.
You know, in a lot of the territories for GPs to take on these roles and responsibilities. I think in most instances it's paid for, and we'll talk about that in detail in a second. I can't imagine it's any less of a vote winner in the people's hearts back in the UK. It's just whether the system allows that to come to the forefront. Is that a fair comment?
Yes, and we actually in every single party have found support, and that's important to say, because there are, you know how this works. We've got this ADHD is we're everywhere, and people impacted by neurodivergence are everywhere, and so you find allies in unexpected places, and so it's definitely not clear cut. And what's being said at one level is not reflected at others. So I think we are definitely going to make it a political thing. I think we showed ourselves as a political force when 14,000 people wrote in 14 days to their MP. We need to do more of that, and I think with that we can get change. But it's definitely it's definitely a plan.
Mel, I might swing back to you in terms of the diagnosis pathway and the costs and what's involved. I mean, it's fair to say that whilst initiatives like GPs being trained will reduce the waiting time to get seen and assessed, it's still a reasonable waiting time, and they're still not inconsiderable costs. Is that a fair comment?
That is, yes, absolutely. And I've just put a little bit of a PowerPoint presentation up, Rob, because I think it's quite good just to, if we can bring that in, talk about some of the, and I don't know if you can bring that in, but talk about some of the differences that we have, which is the public pathway and the private pathway here in Australia. And one of the things I think just to call out here is our two pathways. But
Mel,
yes,
Mel, could you just hit, could you put slide presenter, that little button next to the slidey button? That'll enlarge it for us.
Yeah.
Slideshow presenter mode.
Oops.
Yeah.
Sorry, slideshow from the beginning. Sorry. Is that better?
Henry, if you can call up the...
I don't think we're quite there yet. I think we can share it.
Is that better? I've done it now, so you should be able to see, hopefully. Yes. Oh, okay. Is that better or not?
You might need to share a different screen, the one that's
okay.
Big. But...
Okay, I'll try sharing again. Bear with me a second. 2 seconds, because I know we're stuck for time, so I don't want to be taking all the time on the showing of this. I can definitely talk to it, so I'll try one more time, but if not, I'm going to talk to it and just go with that. But basically, we have two, we have basically the private and the public. And look, we're still faced with significant challenges. So, you know, the diagnostic access is really still quite problematic. So it's via GP referral. Generally, getting GPs to make a referral, people can get in to see the GP, but the difficulty is public psychiatrist or paediatrician. The wait times can be between 6 to 18 months. So it's quite significant. The private pathway, there's direct access to private specialists, but there's still significant wait time. And while some people can get in between 2 to 8 weeks, the cost of that is quite significant. And in some cases, the private pathway, people are actually having to, or choosing to, should I say, travel from one state to another to actually get that diagnosis. So cost is more, and the actual ability to get to people is quite significant. The cost of diagnosis ranges. So whilst the public pathway, GP visits are covered under, we have a Medicare scheme for those that, are able to access Medicare. Everyone can access Medicare, but those that choose to do so through the Medicare scheme. And then basically it's referred to a public psychiatrist or pediatrician. The assessment may be free in some cases for younger people or at low cost, but the wait times is significant. So again, it's the wait times, and here we're looking still at 6 to 18 months. In some cases, it's even longer. So people are not actually getting what they need when they need it. The cost to go private is absolutely, I'm going to say, ridiculous in some cases, particularly for those individuals from low social economical background. We're talking between $600, roughly about £300, to basically $3,000, £1,500. Sorry, I don't know that in Singapore translation, so please excuse me. So I'm not that, I don't have the ability to do that, but it's a high cost. And in some cases, I've known people to pay up to $9,000 to actually get a good diagnosis and actually to go with some of the leading psychologists. Treatment options are still limited. So limited due to clinician availability. Clinician availability is significantly challenged, particularly as well in rural and remote regions. So in Australia, we are so spread out. The travel that people have to do to actually get access to a clinician is quite significant. And in some cases, if you're rural and remote, you might have to travel 3-4 hours to come into a metro area. The medication is available through pharmaceutical benefit scheme, but as we know, we've got challenges with access to medication at the moment. So it is subsidised under the pharmaceutical benefit scheme, but access to things, medication is just, is a real challenge for us here in Australia, and I know globally. We've got problems where people are saying that they're trying to go to their prescribing doctor to look for alternatives. They sometimes need different strategies as well to implement, because medication is just not able, they can't access it, having to drive far and field. So in the private pathway, it's the same. There's medication via the pharmaceutical benefit scheme, and also some people pay private. The advantages for the private pathway, it's affordable, it's regulated, and it's integrated with the public health. But the cost of that and the waiting of that and access to that is, I'm going to say in some cases, near on impossible for some people. And sadly, the private pathway, unless you're somebody that has the ability to do so financially, yes, it is more flexible and it's tailored to individual needs, but the ability to access that is still challenging, but financially for many is not possible. So the advantages,
I think we've got about another 10 or 12 minutes. So we might, if you don't mind, Mel, I'll move on to Darren, and then we'll move on to Moonlake. All right.
So in terms of diagnosis in New Zealand, effectively, if Melissa could put up a slide, it's exactly the same with a different cost structure. I get suspicious when I see things like that because I wonder how the colleges really work together. But as I mentioned before, the pathway moving forward is a GP, if they're unable or haven't had special interest GP, and they will start that process from there and do the diagnosis. There's one thing I feel I have to mention. This is where all our media conversations about. It's not a 15-minute meeting. So they'll have a prescribed process, might be a couple of 1 hour or 2 hour meetings. So that's really important. It's not that quick 15-minute interview, which is good. The second aspect I should mention is the GPs will have a supervisory psychiatrist as well. The way I've been describing ADHD is like your typical bell-shaped curve, where there'll be some that won't need help or medication. There'll be some in the middle who could go with the GPs, and there'll be some who are quite complicated and who present with a range of comorbidities, and they're the ones that can be referred to a psychiatrist. Now, the big advantage of the change that is being made is we're freeing up a lot of psychiatrist time. So we're hopeful that for those that need to see a psychiatrist, we'll be able to get much quicker access. Typically in the public sector is those who have mental health issues as well. I should also mention that one of the big issues in New Zealand is our mental health sector is under pressure, like in many places, and even freeing up their time from doing diagnosis for those with ADHD, been pushing that to GPs will free them up for other things as well. The one thing I didn't mention, a change which is already in effect, is about the prescription of medication. So in New Zealand, up to a few months ago, if you got prescribed ADHD medication from a psychiatrist, every 2 years you had to go back and prove you still had ADHD. I can't say that with a straight face. It's particularly frustrating if you're a child or a teenager with ADHD, because you'll find when you go back, they'll suddenly say, hey, you're an adult, so you have to go start the process again. That's what's been removed as well. And the other aspect that I should mention, that there are safeguards built in terms of the checking of clinical notes by clinicians, and also the the checking of blood pressure and things like that are built into the system as well. Will our GPs be able to quote? Like everywhere, they are under pressure, so it will take a while to build it up, but we're really excited about the change. One thing I didn't note that as nurse practitioners also will have the green light to be able to diagnose and treat ADHD under supervision, which again is a big step forward. Many of our nurse practitioners here are more experienced with neurodiversity and ADHD than some of the doctors. This is where I think, oh, who's watching? But I think that's an important first step. The other change amongst all of this is how we're talking about ADHD, and that it's a health issue. And when I reflect back of 5-6 years ago, it wasn't talked about as a health issue. So, it's been really positive few years.
Awesome.
I have to admit, one change we did get through is, we got this through a change of government from a left-leaning Labour government to a right-leaning national government who weren't too sure what ADHD was. So all credit to the respective governments as well.
It's encouraging to hear, Darren. Terrific. Moonlight, bring us home.
Thank you. I actually prepared a slide, but I won't share it because I think Melissa did a great job. And her slides pretty much, as Darren said, covered very similar. So we know that at least these 3 countries have very similar pathways. So I'll just add the more localized information. So in terms of the subsidized route, which goes through the government polyclinic before the specialist hospitals, at a subsidized fee, it could be as low as Singapore $45 for the consultation, which I think is about similar with Australia. The currency exchange, UK maybe 1.7, but I should have checked before I went online on the air. But for the private side, and the good thing about the public hospitals is that there are 2 routes, a subsidized route, and also you could see someone in the public hospital as a private patient. That means you pay a little bit more, but you can choose who you see, and it's a shorter waiting time. So I call it a bit of a hybrid kind of mode, and I'm actually seeing my psychiatrist that way. The other way is the purely private clinic pathway, which is a much shorter waiting time, sometimes as early as the next few days or next week or so, depending on availability. However, of course, fees will be different. So let's say, for example, a psychiatrist's fees would be probably about 300 Singapore to 350 for a session. For the psychological assessment and testing, it could go up to about 3,000 in some cases. So that's still going to be a bit of a reach for many families, particularly if there's more than one person in the family that needs to be assessed. Medication also is still
And it's likely that there is, isn't it?
yeah.
Yeah.
So what we're trying to do about this is that early on when Unlocking ADHD first started, and we were actually in regular meetings with the different ministries and also the public institutions, we learned very early that there aren't enough psychiatrists in Singapore for the population needs, not let alone those who are familiar with ADHD. So it's really no point complaining about structural issues that you can't change in the next few years. So I did ask at that time, what can we do? And the answer was ADHD literacy, or rather psychoeducation. So that's what Unlocking ADHD has been focused on, because people still need support while waiting for the appointment or in between visits. But alongside from that, with the Singapore government's move towards supporting mental health, they've actually targeted by the year 2030 to increase the number or the percentage of psychologists by 40% and the percentage of psychiatrists by 30%. And there's also a graduate diploma in mental health for general practitioners. So all these are moving. I still think it probably more needs to be done, but at least again, we're starting to move somewhere. So I hope that there'll be more done. And I would love to speak separately with Darren about this nurse practitioner idea. I want to find out more. And definitely with Melissa and Darren about the side as well. Yeah.
It's precisely why we have these forums.
Yeah, and one more thing to add, sorry, Rob. So what we've done is that we've incorporated on our website in our Restart Starter Kit for adults, that's free download, the WHO Adult ADHD rating scale. So that for those who are not able to access a formal diagnosis, at least they could do so-called a self-assessment first, and at least know after that to seek maybe the non-medication type support, strategies while waiting, so that you don't have to be left without support.
Very good.
Yeah.
Very good. Well, I'll leave it to you, Henry, to bring us home. Hopefully we're close to time as well.
No, we're doing a great job. Right. I took my homework to
Very
create
good.
a slide. And I think the thing that's immediately obvious compared to you all talking how Melissa's model, all very similar for each of you and relatively straightforward. And then there's ours.
That's why I moved from the UK, Henry.
No rest for the
Challenges.
We don't have time to start that discussion. I mean, it's absolutely chaos. So we've got two sort of core, either go NHS, go privately. We've talked about in private pathways, you self-refer, you don't need the GP. So different for, I think, in the cases you talked about. Sometimes you're screened. So we know one very large ADHD assessment provider, they'll do a screening before they take your money. And they actually will say, say around 75% of people, they don't find meet the initial criteria, they don't take the money, they don't assess them. When we're talking about that dialogue of people going, the challenge on people self-assessing online, going, I think this is me having read stuff. Like, there's a huge benefit to that because people recognize ADHD themselves and come forward. But there is also the problem that some of those conversations aren't saying how serious ADHD, the level that's needed, and so people self-diagnosing incorrectly. And it's a very, very difficult conversation. Okay, then you get assessment. You guys talked. So we have already expanded in the UK. So you can be seen. You can be seen by a psychiatrist, a clinical psychologist can diagnose. We also have nurse practitioners, so they're nurses who've got taken additional training to become prescribers. We also have that for pharmacists, so pharmacist prescribers. But if you're a GP, you can't assess. There is a new course that's been developed by the Royal College of GPs. My understanding is no one's done it yet. And so you've got this sort of messy. It has to be a specialist, but it's a wide group. When we've talked to the people who actually wrote the NICE guidelines, who put in that criteria, specialist, but didn't specify, they say they did that on purpose because they knew that the level of psychiatry isn't substantive enough, is already worked with the work that's there, and that there different options were going to be needed. And so they built that into the NICE guidelines. And then you've got, if you go down the NHS pathway, you have to have the GP referral. I talked previously before about right to choose option versus local. The local, though, does something else often. It triages. I was invited to go to a select committee in Parliament, and when I spoke about triage, I just said the thing about triage, because people hear is, oh, we just segment on need. We see those in, if this is an ER, the people who have got their leg chopped off, we see them first, and the one going, I've got a sniffle, we see them last. But everyone gets seen. But that's not what happens here. Because of the overwhelm of the system, and the system's not fit for purpose, if you're not triaged into that top group, you're not getting seen. And that means you're not getting supportive medication. You're not. And what that really means is you can only get seen once you hit crisis. Are you at risk of suicide? Are you at risk of harm to yourself or others? Or are you at risk of having your family breaking up in family court? That list is the actual triage list for an area of Yorkshire. Risk of suicide, harm to others, family court. And even despite that, it took them a year to see the first people on that list. And we're seeing more of that come in. Then you've got a 12 to 2,000 year wait assessment by all the different providers. Sometimes we see a second medication wait. We see that quite often in the local system. And that can be like a person in my family had to wait 3 years. So they got assessed in their first year of university and didn't get seen till the last year, didn't get medication till the last year. Entire life trajectory changed. And then we've talked about the industrial dispute. Yeah, I think I've covered it, but we covered a lot of it before. I'm obviously aware of time. I don't want to muck your MCing up.
Well, I'm glad we don't have those challenges. But we all do have our challenges as well. I think it's terrific that we can share this information as well. I think it's also fair to say, Henry, in the next week or two, a lot of the presentations that have been done yesterday and today will be up on websites and available for people to review. And I would invite viewers from all countries to be able to access those sites and watch these videos again. Is that fair?
That is, and they're all on. They'll all be on YouTube, as you all know, 'cause I've been here before. We segment them up and put them up onto YouTube afterwards, so people can go back and see them. It's a delight having everyone here. Like it's our annual get together.
Yes, it is.
Another one day, right? In person. I met Melissa, right, last year. So and I hope the rest of you. Next year. So hope to see you.
Yeah. Henry, it's so good of you to host us. It's wonderful to be part of this.
We host it together, as you know. I think it's a wonderful collaboration, and it's a big deal. This conference is very special, and actually we can take a moment to celebrate it because we all come together and contribute in our different ways. And obviously, Australia and UK taking the streaming lead, and we get extraordinary people giving their time for free, and allow us to get information to people and to celebrate ADHD Awareness Month in a really positive way, in a way that helps change people's lives. This is now the 4th year. It keeps getting bigger and bigger and bigger, and it's wonderful. Like genuinely, it's wonderful. Yesterday, you'd expect me to be exhausted, and I was just so happy. I'm looking forward to today. Ask me what I think.
Yeah. The interesting thing, Henry, when we first did this, and I remember 3 years ago, we met, and there was a couple of weeks to pull it all together for the UK, for the Australian team, should I say, because we obviously wasn't part of it then. And in true ADHD style, we went, okay, we can do it. And 2 weeks later, we've got this big Global conference. And then from then, Rob said to me, right, what we're going to be doing now is we're going to be making sure that we're more planned. And then last year, what was really interesting was a little bit more planned, but we still did somewhat procrastinate. And then this year, Rob was like, no, we're getting this in order. And for the first year ever, thank you to Rob. And this is why we celebrate diversity and need people that are neurotypical in our team, because if everything was left to true ADHD Melissa, it'd be procrastinating right until the last week and the global conference would come out. But thanks to Rob and the team, it's helped us to be able to bring it all together. And, you know, Henry, as always, the amazing presentations by the UK team, and fantastic. And it's just great to get to see everybody again. Moon Lake, definitely we're going to get to meet again in person. It was great when we got to catch up in the States, and one day we'll get to see yourself, Darren and Henry, and I'm sure we'll be talking all things ADHD and comparing countries. And I'm hoping by then, Henry, the UK's come on a little bit more.
I mean, it's going to be exciting times. Genuinely,
weird.
like the next few months are going to be a big deal. We're about to kick off a really big legal push, which we're talking about in the last hour of our segment. And if we're successful in that, we'll have changed everything. But I can tell you the government will not want us to be successful because it has knock-on impacts for their metrics. But I think the big issue, which I think we all have to fight, which is defeating the issue, that the idea that ADHD people are just an expense, that we're broken, and in fact that we can be amazing and do extraordinary things. But an assessment, the understanding that brings, the medication intervention for those that want it, are game changing. And but certainly in the UK, you know, we've got wait times. We've obviously got that one at 2,000 years, but over 10 years is not uncommon. And we have other problems that when you turn 18, you get past the adult services and you get dropped, and you get put to the back of the queue. We snatch. And actually, that's what is happening right now. We're snatching victory. We're snatching, I'll get it the wrong way around, snatching defeat from the jaws of victory. We're actually progressing here, but it's being reversed. It's listening to you is wonderful, hearing the positive side. And hopefully next year we can join you in saying we've had progress.
Well, we'll be here and we'll have that conversation.
Right, who's going to do the sign out from Australia? It's time.
Well,
so who wants to do the goodbye? Melissa?
Yes, look, I just want to say absolute huge thank you to everybody across the globe that today has listened and participated in. For those individuals that will be after as well, because I know some have been sleeping during the period of time, I want to say a huge thank you to you, Henry, the dedicated hours that you've given to ADHD Australia to make this happen. And Moon Lake, Darren, it is absolutely amazing to hear your stories in your countries and hear a bit more about what's happening and actually how similar we are over here in Australia. So, but look, to finalise, I just want to do a call out to the ADHD volunteer team. This conference would not happen without you, Rob. Your dedicated hours upon hours of every single moment of, you know, what you have given to ADHD Australia. We also have Matt Cameron behind the scenes. People have not seen him, but he's been tech all day and, you know, constantly working exceptionally hard. Andrew, that you've got to see at various different points, and many others. But this is a real team effort, and it could not have happened without all of our volunteers. We've had exceptional speakers, and I want to just do big shout out to every single professional today, whether that be a carer, a person with ADHD, a professional, all of our medics, our researchers, everybody that's come in to do the conference for us and to educate the globe. So thank you so much. We are really excited for next year. Maybe we need a bit of sleep before then, but we will be here again next year, and hopefully we'll have some more countries join us as well. So thank you, everybody.
That's us signing out. For Australia and UK officially taking over. Thank you, Darren. Thank you, Moon Lake. You guys are amazing. Wonderful to see, and congratulations on what you've been doing. Melissa and Rob, ADHD Australia and UK, we do this together. We do each other's respective nights and operate in the days, and it's absolutely wonderful. Like, the reason this has this energy is this ridiculous idea that we just live stream for, it was 24 hours, now I think it's 28 hours. And we're ruminating on making it even longer next year.
We'll have to clone a few people, but yes.
And it gives it an energy that brings people in and has and is wonderful. So thank you for, well, it's great. I love doing this with you. So brilliant. And time for us to take over. So goodbye, Australia.
Yeah, bye.
So that's us. So that was the co-part with ADHD UK and Australia together taking the reins. We doing the technology bit and broadcasting across social media with them being the MC. They've done our night. We're taking over for this entire day. And yesterday was wonderful. And today is going to be like equally great. I can't say greater because it was wonderful. And there are wonderful people there. It's not a competition. Next up, we've got Laura Lacey, and she's an ADHD voice in government. We're absolutely thrilled about that. Followed up by psychological roles in the workplace, and then practical tools and tech for ADHD minds. So all things we're just really looking forward to. Before I bring that on, we're just going to hear from an ambassador, and then we'll take it from there. Please welcome to ADHD Ambassador Kieran Jennings.
Hello everyone, my name's Kieran Jennings and I'm one of the newest ambassadors for ADHD UK. I've got a bit of a favour to ask. At the end of this video, if you could have your phone ready, unless you're watching this on your phone, that would be great. Now, I was privately diagnosed with ADHD in 2024 at the age of 36, and I know what you're thinking, is he only 37? Once my GP had suggested that I was tested for ADHD, I gave it a lot of thought, and the diagnosis in the end didn't really come as a surprise. I've always had a very active mind, I've always been very fidgety, but then digging through old school reports for the assessment, they all said the same thing. Has difficulty paying attention, can usually be found staring out the classroom window, needs to apply himself more. So the diagnosis just became a great excuse for the thoroughly underwhelming GCSE results I got. But all jokes aside, the ADHD medication journey, for want of a better phrase, hit a bit of a roadblock earlier this year. I paid that small fortune for a private diagnosis, for the extortionate prescription costs, and then the NHS GP gave the blanket refusal for shared care. But it didn't take as long to realise it's not just me. This affects thousands of people across the country, but that includes children. I've said this so many times over the last 9 months. I know this isn't life-saving medication, but it's life-changing medication. And to refuse access to that to kids is just utterly disgusting. I became an ambassador because I want to stand up for myself for a change, and to be able to stand up for thousands of other people. But you do need strength in numbers. The mission is to force a parliamentary debate on the issue. I've launched a UK petition to do it. I'm really proud to have become an ADHD UK ambassador, and they support the work that I'm doing with the petition so far. But this is where I need your help. So if you agree that ADHD care should be fair, please scan the QR code that's about to pop on your screen once I've stopped rambling on. You don't need to be a British citizen or even be in the UK to sign it. So please share it with friends, family, colleagues, anyone. As I've said, I can't do this alone. There's power in unity and there's power in numbers. So anything you can do to help bring about this change that's so desperately needed, I'd really appreciate it. Thanks for listening and enjoy the rest of the conference.
Fantastic. And and obviously he's a fantastic ambassador for ADHD UK. He's got a petition going. I hope you got the barcode. We'll put Yeah, we'll put a link up or show that barcode later as well. Right, I have got the wonderful counsellor Laura Lacey. She's not only she's a counsellor, but important to us. She's an ADHD UK ambassador. She's an autism and neurodiversity champion for the Gwent region. She's cabinet member for social services. She's genuinely a passionate advocate for those with lived experience of ADHD, autism, dyslexia. She's going to talk about neurodivergent people, why it's important they get heard, why it's important they lead. She's going to share her journey on elected as an elected representative. Good morning, Laura.
Morning, Henry. How are you?
I am fantastic. I'm buzzing for the second day of the conference and all that it contains. I'm thrilled to be kicking off the ADHD UK segment and day with you. We've talked over a number of months. To say that you're a passionate advocate and it's to underplay significantly what you're doing is pioneering and absolutely fantastic. You've got slides. I need to hand over to you.
Thank you. And I think, on that, I'm a passionate advocate. I think if what I'm going to speak about in this presentation, if we can get more people with ADHD or other neurodivergence into government, I think there would be a wave. I think it's the passion that comes from a lot of different people. So thank you. So yeah, my segment here is leading with lived experience and about how we get ADHD and neurodivergent voices into government and how change really happens. So who am I? So I'm, as Henry introduced me, a counsellor for Newport in Wales, social services cabinet member. I also have a full-time job as well with I work for Orange, the telecoms company, and I'm a fraud and data analytics manager, also an ADHD ambassador, parent of 2 neurodivergent children, and I myself have a diagnosis of ADHD, autism and dyslexia. So I wear a number of different hats. So for me, my lived experience is every part of my being, really. So what brought me into politics? It wasn't. I never set out to become a politician. Watched the news when I was in my teens. Maybe didn't understand. Had no interest in politics. But I'm sure this would perhaps resonate with a lot of other people on this call or watching this conference. I was always chasing something, and this is previous to my diagnosis. So I should roll back a little. My diagnosis for ADHD and autism came in my mid-40s. Dyslexia was in my early 40s. So again, I didn't know what was going on. I just thought I was always chasing something, getting new qualifications, how many hobbies. That my cupboards are full of those piles of ex hobbies. I qualified myself as a naturopath. I've got Prince 2 qualifications. There was something that I was always chasing. And when my children started mainstream education, school, I joined the PTA, and then I became the chair of the PTA, and then I joined the school governing body. So you can see there's this little build up starting to happen, and we've always been members of a political party locally, and we were helping with the Senate elections with a good friend of mine, who's Jane Bryant, who's actually a member, Senate member for Newport. And I was approached to say, would I consider possibly running as a local councillor, because there was an election coming up in 2017. Of course, it was another challenge for me. It was something else that I was going to keep driving forward. Bearing in mind at this point, I guess I had two young children and a full-time job, but this just adds on to it. But when I got into politics, and when I got into the council, I got elected. You suddenly saw what you could do and how you could help. And I think I had a diagnosis. There was always this passionate drive with me that something wasn't right for somebody. If they were coming to me to help, I have to help them, and I can't stop helping them until I've seen this through to fruition. So I think, and that is very much a characteristic of people with ADHD, people with autism, that is that real keen sense of social justice that gives you this unstoppable drive to push forward. And I think this is where, so for me, it's, well, gosh, I've been there for 8 years, and I've worked my way through. So I've obviously a backbench cabinet member. I've chaired the scrutiny panel. I was then made, I was a cabinet member for infrastructure and assets. And then in the last 2 years, I've been the cabinet member for social services. And that to me is just, it's almost like I found my place. You know, I'm helping people with really, really complex need, but I get to have a voice. On regional partnership boards, I get to have a voice within council. People listen to me, and that's really powerful. That's really powerful to be in that position. So I think, as I said, I found my space, and I found somewhere where that unstoppable ADHD drive is a force for something really good. So that's where I am. So as I said, why politics? So now I understand. So when I'm not just consulted, we're not just consulted as part of the survey. We're actually there. We're actually defining policy. I'm saying this isn't right. This isn't going to work. You know, oh yeah, you know, we want X, Y, Z, or officers, or you know, higher politicians say, right, we're going to change this now. How does this? That's what we need to do. We've taken the average person, and now I'm a voice within that room saying, no, we have to stop here. This isn't going to help. This might help 90% of the population, but there's 10% of that population that this is going to detriment, not just not help, but actually going to go into detriment. So I think I stand there now as that stopping post and that voice that is able to be listened to, with a really supportive team, political team that, you know, I work with, a group, and a cabinet group as well. So this matters, of course it does. And I think, as I said, just alluded to, without us, policies miss real need. They're designed for that. You know, let's have a look at the education system, for example, is a prime example of, you know, it's made for the masses, but it's really, really detrimental to some children that are going through that education system, and it's so bad. So when we're there, we can now say, stop, let's shift, let's have a look what's happening. You know, this isn't right for us, and there needs to be another way, or you know, how do we make changes? So my big one, I guess, is why I'm sitting here as well, is that I think it was two or 3 months ago, we put a motion into Newport City Council to make Newport City a neurodivergent friendly city. There are two video clips embedded into this, but I don't think they'll play, so I'm not going to worry too much about that. But just to give you a sort of perspective on how this works. So basically, a really good friend of mine and colleague and councillor, Stephen Marshall, dropped me an email and said, you know, how about we push this motion forward? Let's work on this together. So what we did here was we wrote the motion based on how do you make a city neurodivergent friendly, but not just how do you make the city neurodivergent friendly, but how do you make it so it's not a token gesture, that it is actually workable. It's doable. So we're not just saying, right, this is everything that we need, this is our big wish list, this is what we have to do to make the city neurodivergent friendly. So we spent a lot of time writing the motion that you can see on the screen now. Again, apologies, it's a little bit blurred if you can't see that, but I'm more than happy to provide the documents afterwards if that's a possibility for me. But basically, what it does say, there's a big element in there of needing all council staff to be trained on neurodivergent, so autism, ADHD, of course, dyslexia. And the real important line in there for me was that training line, because what I'd seen from my lived experience then through my children was that you've got these amazing ALNCOs or additional learning needs coordinators in their education setting, and you've got a core of teachers that are very, very they're savvy. They know how to help these children when they're in the classroom. I'm particularly talking about mainstream students with ADHD. But there are an element of people that come into the education setting, and it tends to be perhaps through supply or cover, that don't understand the neurodivergent and don't understand the behaviour sometimes, especially for ADHD, and it's because they're dysregulated. And the first thing that they would do is take that child out of that classroom and send them into an isolation setting or a detention setting. And this is when we start to see these children falling through the gaps, because they become very dysregulated. It carries on throughout the day, and then it goes into the next day, because you get that rejection sensitive dysphoria, that they think it's going to be held a grudge against, and when they go into school the next day, it's going to happen again. And then you get this downward spiral of behaviours on our children, and I'm saying that as through experience, that this was happening to my daughter, and it was always happening when there was a supply teacher, or it was always happening when there was a cover teacher who didn't know her. And I thought, right, what do we do to help these children when it's through no fault of their own? Don't get me wrong, they can still, some of these children can actually just be playing the teacher up, and I'm acutely aware of that, but there are, most of the time it was through dysregulation. And one way we thought that we could do that, as a governor, you have to have mandatory safeguarding training, you have to have mandatory training in a number of different things. And what we wanted, the big part of this is, if what we wanted is mandatory training on neurodivergence for all staff again, and that will run through the council as well. And obviously you can't be an in-depth training, but it can be quite a high-level training of how to spot dysregulation, why people, if you've got a child that's not making eye contact, it doesn't mean that they're being disrespectful. Just a lot of little things that could be shown to governors, people that work in the council, of just little things that could really make a big difference to help. And then, so that was one part of the motion that was really important for us. Another part of it then was making the pathway to being elected member more accessible, because the more people that we get into politics, the more neurodivergent minds we get into politics, this is when we start to see change happen. Because I've been given a seat at that table with my passion and with my drive, and I know my other colleague, as I mentioned, Stephen Marshall, is exactly the same, that passion and that drive, and we sit there. This is when you see the change happen. So as I said, and that impact of representation. So when we presented that motion to council, I had to read the motion out, which, I laughed to myself, because I wrote the longest political motion, and I'm dyslexic, and I had to read that motion out word for word in the chamber whilst it was being live streamed, and then followed that up with my backing of that motion, which was in the video, but like I said, I don't think that's actually going to play. And I had so many emails and contacts afterwards saying, wow, you speak for me. I didn't realise, and they you understand me, you understand my life. And I know a number of other colleagues of mine also had the same thing. So that importance, really, as I said, in this impact of representation, is that families feel seen, because sometimes it can be so isolating, when you can't get any answers, when you're trying to get help. And we're often demonised, I guess, in politics, that they don't understand, they sit up there, they make these policies. And I think for the members, some who watched that live streamed or some who watched it after, actually saw there are a number of people that are sat in that chamber that absolutely understand what I'm going through, how it hurts, how hard it can be, the battles that we have to go through, and they're there and they're speaking on my behalf. And actually, now they get me and they understand me. And I think, again, families feel, children feel that they belong. There is nothing more powerful than fighting for your own child and fighting for other children, because they see that then as they're growing up, that it's almost the behavior that is expected of them. You know, my daughter and both my daughters see that the battles that I go into for them, or the battles that I go into for other people when something is unjust and something isn't right, and having that platform to stand there and fight those battles on behalf of the children of Newport, for them to be seen and for them to be heard and for them to get given the right to education, the right to adjustment, you know, is really, really powerful. And then, you know, it has this ripple effect. So the vision on all this, where does this go? So I spoke at the beginning of the summit in the House of Lords. It wasn't particularly on neurodivergence, but it was to do with children that were leaving care. But I got a seat at that table, and I got a seat at that table with some very, very powerful people that I can then network with, I can then speak to, and it allows you get that foot in. And this is where these laws are made. This is where the high level policies happen. And so I think what I want to do is by making the government sector more accessible to neurodivergent people, ADHD people particularly, you know, that passion, that drive that we have, that insatiable engine that just keeps going, really happen. Not just being consulted on, but actually making the policy. Because don't you find, so, you know, it's when the decision-making processes are accessible, and when the consultations, you know, they get to the people that really need it, you know, this is, like I said, this is when change happens, because it's about the people who are shaping and implementing the policy, not the people that are being listened to. Because what happens is, you know, you can be consulted, you can say, yeah, this is what is needed for ADHD people to thrive. And then once you've done your consultation, you take a step back, and the people that are implementing that policy then might just think, oh, well, you know, there was only 1 in 10 people that said that this is what we needed. We don't need that now. We'll leave that out in so we can get that policy through a little bit quicker or a little bit more cost effective. When we're there, and I know this of myself, and I know this of Stephen, and I know this of a number of other of my colleagues, you can't drop that, because we're still there saying, yeah, but you've missed this part. Hang on, that needs to go back in. Stop. This is how this needs to do. And we're actually then telling them, you know, you can't. You have to follow it through. So that, I think that therein is the power. It's brilliant consulting. Of course we have to do consultation. Of course we have to listen to lived experience voices. I don't profess to be the voice of every person that has ADHD or autism or has children in that case. But what we do is almost like we push it, we keep it until it's finished, and we keep on. And I think having people like us, ADHD people at all those levels of government, that, as I said, that is really when we start to see the change happen. Just waiting for my slide. Oh. Sorry, I can't see to see if I find that my final slide decks are loading. Just bear with me a second. No, it's okay. Okay, so what I'll carry on though. So how do we get more people? How do we get these voices into government? And for me, I think it's we start at that bottom level, and you start at that bottom level. You get involved in the communities. You get involved in classroom council sessions. You know, you get involved in youth councils. You get involved in, start with your PTA, understand that science of organisation, and then you can move up slightly again. And you know, there are elections coming shortly, which is both really frightening and also really powerful. I think, you know, there's a chance that we can step into place. And I just think everybody's voice matters, of course it does, but get your feet under that table. And another good friend of mine who also, she runs a number of community groups, Jolene, said and shared my post when I was saying that this motion was coming forward. And she said, you know, this is what happens when you get neurodivergent people at that table, the table where people are not just listening to, but the table where people are actually pushing forward for policy change and moving forward. And I just think it's a bit of a, for me, it'll be a call to action. You know, if you know, I would say I can't recommend politics. It's a scary place at the moment because it's very, very toxic out there, and you also have to have a really thick skin. You know, your rejection sensitive dysphoria, when you hear things about you online or people say these things about you, it took me a long time to let that go over my head and let people, you know, for me to realize that actually these people don't really know me on a personal level. So what they're saying is out of perhaps frustration or different things. So that I will put that as a little warning sign that if you do get into politics, please just ignore anything that's said about you on social media or, you know, actually in the media or anything, because they don't know you, and actually ignore that, because the things that you can do to push forward are so much better. But really, it's a funny one, isn't it? I cannot recommend getting into politics enough for ADHD people, because we've got that fire in our belly and that push forward, and we can do so many different things at the same time. You know, I can work full time, I can do this almost full time, and I would not be able to do what I'm doing, or I wouldn't have that drive, that physical drive and that mental drive, if it was not for my ADHD. And don't get me wrong, you know, there have been a number of years previous to me being like this now that, you know, it was very hard. And I never want to dismiss, you know, the struggles that people with ADHD go through. But actually, when you get to that point and when you find that thing, politics being my thing, the changes that you can implement and the policy that you can help shape at a really deep level is very powerful. And Henry's of course got my contact details, and they can be shared, and I'm on LinkedIn and Instagram. If anybody ever wants to contact me and ask me how to do this, how do we get into politics, you know, how can I help, anything, I'm absolutely more than welcome to speak to anybody or contact. You know, this is a very important place for us to be at right now. And as I said, not just consulted, making those changes, implementing those policies. Let's get us into every level of government, from local government, national government. Let's get us in. Let's get us into that, onto those red seats in the House of Lords, because we deserve to be there. Our representation matters, and we've got our lived experience is powerful in terms of helping so many other people coming up behind us, that I think it's just, you know, hopefully you can see that the passion that I speak with in this area. And it's for me, as I said, it saved me, I guess. Politics saved me, but then how can I go forward and help save so many other people by doing what I'm doing? And that insatiable drive I wake up to every morning thinking, right, what today? I'm exhausted, but who am I going to help today? How can I help this person? And you don't ever let it go. You don't ever let it go. And I think that's the other positive about ADHD and neurodivergent people as well, is that once you've been given that problem, trying to help somebody, we never let it go until that solution is fixed. And it can be absolutely frustrating. But, you know, we keep fighting for those people, don't we? When those, when it's unfair or unjust, you know, let me at them. Let's see what we can do today. And I think that's it from me. So thank you everybody that listened. I guess I'll just wait for Henry to come back in.
Here, as if by magic, also with an apology, because it was me in the background sorting out slides, and I mucked yours up, so it's all on me. The wonder of life, doing things live. Laura, you're amazing, and you're an absolute testament to what getting involved can achieve, and how fulfilling it is. I think it is a place where neurodivergent people, their voice is incredibly important, and you talking about it's not just about the initiative, it's about all the other times when you go, this is missing, we've not considered this aspect for neurodivergent people. And it's the changes in the detail that cumulatively make a huge difference. That's, I think, famously done by the Olympic Team GB cycling team, which said, we make these small changes incrementally, they make a big difference. And you're talking about both. It's the big changes, things like the neurodivergent friendly initiative, and it's the small changes, the little changes that go throughout. Now, I think you're an absolute pioneer. I think you're wonderful, and I think what you're doing is leading the way as a shining light. I'm excited for it. Thank you.
Thank you for having me today.
But politics is brutal, right? Like, you're there to make a difference, you're making a difference, but the political, and so Wales has elections coming up. Like, what are your views on that and the choice for Wales coming up?
It's frightening. I think it's scary because, we are looking like there's going to be a change, or however that change is going to be. But it does frighten me because obviously in Wales, we're going through that neurodivergent improvement plan phase as well, where there's currently money going into looking at what we're doing. And, will these initiatives get stopped? We don't know. When there's a change of government, whoever it might be, whatever the work that's currently happening, how do we know that that's going to continue? But it is frightening. And I have a number of people that come up to me saying, well, what are we going to do? How are we going to sort this? But I just think it's the lack of unknowing as to what the year after. So from the Welsh point of view, then the year after, we go through our local government elections as well. And it's just hard to.
So 2026 is the 2026 is the elections for the
Senate,
Wales, the Senate, and then Senate, and then council elections 2027.
Yeah, and that's a scary thing. So we're trying to push through as much as we can now of the new friendly, get these in now so they're already embedded, and because we don't know what's going to happen. I don't know. Oh my goodness, what happens if I don't have politics to do when I've after 27? I don't know what I'm going to do.
Well, I'd push for you in that. You mentioned the House of Lords. Like, yeah, let's make that a campaign. You're fantastic. I've got to move on. We've got to hit our times. Thank you so much, and thank you for all you're doing. Thank you for being part of this. You're incredible, and thank you for kicking off the ADHD UK second segment.
Thank you. Speak to you soon. Thanks. Bye.
Right. Next up, we've got Jodie Hill. So very excited, and talking through psychosocial risks in the workplace. Then we have from Parole the practical tech and tools for ADHD minds and building your own toolkit. I'm extremely excited about that. It's an area of passion for me. And then a segment on ADHD and autism together from Dr. Shai Mashru and colleague. It's an important section. This section from Jodie, which she introduced to me, I thought was extremely exciting and interesting. And I'm so pleased she's happy to come to talk to us about it. So, without further ado, welcome, Jodie.
Thank you. Thanks so much for having me, Henry. And amazing to hear just what we've heard from Laura there. It's amazing to hear all the work that she's doing. What a powerhouse, right?
Yeah, she's genuinely amazing. Like, the first time I met her, just like, what you're doing is extraordinary. And I'm obviously, I'm fortunate to be privileged to know some of the stuff she's working on. And it's potentially ground-changing stuff. And much of it, in terms of providing information for change and putting in the infrastructure of change, I think would be game changing. I'm so excited. Right, I need to hand over to you. Because like the very first year, I thought it was a little bit amusing that the ADHD conference didn't quite run on time, and then I started to hit people's hard deadlines, and it was not funny at all. So over to you, and your slides will come up shortly.
Perfect, thank you. Well, whilst the slides are coming up, I'm just going to do a little introduction. So to give you context, I'm going to be talking about psychosocial hazards, and you're probably thinking, what the hell is Sean about? Well, I'm going to give you a bit of a story about my background first and how I got to this point. So I'm a solicitor. I launched Thrive 8 years ago, almost. The year before that, I had a mental breakdown and I left my job and quite frankly didn't know what to do, but only really knew how to be a solicitor. So I decided to change the environment and change the way that we worked, and worked self-employed part-time for a number of different firms. And quite quickly, I realized that actually I was a good solicitor, but my mental health was exacerbated by the poor working conditions. And I was also at that point undiagnosed ADHD and dyslexic. So imagine having ADHD, dyslexia, PTSD and anxiety, not knowing about the neurodivergence and being in an environment that's really not conducive to positive mental health. It's fair to say it was catastrophic. And I was quite fortunate that I still had my profession, in the sense of that gave me a lot of fulfillment when I got the right environment. So I decided to set up my own law firm, which is obviously what you do after you've had a mental breakdown. But actually what I wanted to do was create a firm where neurodivergence, mental health and ED&I was at the core of everything that we do. So as an employment law specialist, I'm an expert in the law, but I also have my own business and the lived experience. I wanted to blend all of that in one place, but obviously setting up a law firm wasn't enough. So I also started to petition the government to change the law, because I felt as though, yes, I could create my workplace and I could advise other organisations, but actually what I felt was that there was a huge gap in the law. So today I'm just going to briefly talk to you about what we're planning. And for the past 7 years, I've been campaigning. And literally 2 weeks ago, we reissued our petition because, as you know, there's been a lot of change in government. So the previous MPs we were working with have now gone. So effectively, what we're now looking for, which actually aligns with the Labour manifesto, is parity when it comes to mental and physical health in the workplace. And what I mean by that is when we think about physical health and safety. Now, I'm not a health and safety lawyer, by the way, but this is the area that I think needs to change, and I'm going to explain why in a second. But essentially, when we think about how we look after our physical health at work, there's lots of, desk assessments, fire risk assessments, COSH hazard risk assessments. There's all these secondary pieces of legislation that support how we look after our physical health. But there's nothing for mental health. And when I did this review for Parliament I think it was last summer, and I presented to a roundtable about what the legal gaps were, I myself was actually quite shocked, because we've been campaigning for the change, but because this wasn't my area of law, I hadn't fully appreciated how lacking the legislation was in terms of support. And the legislation was brought in 1974. So if we go back to 1974, what was the workplace like? Well, we didn't have the laptops working from home, the emails on our phones. It was very much a physical workplace. And so the legislation also doesn't fit the workplaces that we now all know really well. So I'm on a mission to change the law, and I want to just talk to you about the business case for that today and how you can get involved. So next slide, please, Henry. If anyone does want to get involved as well, we've created a landing page. The petition is going live. However, I didn't realise it takes ages to be approved by the parliamentary committee. So what we've done is created a landing page with information on there so that you can write to your MP and start talking about this online. You can also sign up to a newsletter. So once the petition link is live, I can send that to you. It's kind of indefinitely not live at the moment because I've submitted it on the Parliament website, but they've said it's being reviewed. So I thought it might have been released by the time we came today, because it's been several weeks. But if you want to get involved, please do contact me or scan the QR code and just let me know if there's any way that you want to support. Next slide, please, Henry. So when we think about why is change needed, we've got all these statistics on the slides, which I think most of us are aware of. But the other thing I wanted to raise around the need is actually the link to neurodivergence. So we know that neurodivergent individuals struggle more with their mental health than neurotypical people, and particularly people with ADHD and autism are much higher propensity to suicidal ideation and mental ill health. So we know that this law change will have a ripple effect for those with disabilities and those with neurodivergence. And we know that at the moment, it's one of the biggest issues in the workplace. So I helped to co-author the guidance on neurodiversity for ACAS in the UK. And I also helped them with their reasonable adjustments guidance for mental health the year before. And what we've realised through the research that we've done with ACAS is that actually employers have three key things that they're really worried about at the moment, equally split pretty much. The first is the Employment Rights Bill and all the changes, like what will that mean to them? The second was how we deal with conflict, and the third was mental health, and they all had around an equal percentage. And then there was a couple of smaller things that came up. But mental health is such a huge part of an organisation when it comes to thinking about how we manage our people, how we prevent mental ill health, and also how we support those people who are struggling with reasonable adjustments. So the business case is strong, and we're seeing suicide going up and up and up, and we've seen the suicide prevention white paper come out, which this will all align with. But actually, what we need to do is focus much earlier than at the point where someone is suicidal. What I'm trying to look at is where when we think about mental health, everybody has mental health. And so how can we support everybody, not just those with a disability or not just those who meet the definition within the Equality Act for reasonable adjustment? So it's a much wider piece of legislation on the basis that we want to support everybody and create workplaces that are psychologically safe. Next slide, please. So we know that there's a number of different reasons for the case for parity, but one of the biggest reasons for me is actually that we see so many people go off, and obviously I left my job because the workplace, it was caused by the culture that I was working in, and quite frankly, I nearly left my profession and I nearly took my own life. And that was all because of how the workplace managed me and the environment that I was in. So if we can create workplaces that are psychologically safe, and we have this awareness at a much more preventative stage rather than a reactive stage of how we support people with their mental health and how we create those inclusive environments that are psychologically safe, we'll also see people obviously not going off on long-term sick, not leaving their jobs, but also seeing an increase in the return on investment on those individuals. So for those people who don't care about mental health, because I'm not being funny, but there are employers out there that unfortunately fall in that category, it's a business case. There is a financial return on investment to investing in your people's mental health. But for those employers who are the nice ones, who actually care about their staff, they'll actually really support that individual in their personal life and beyond if they've got a fulfilled, psychologically safe place to work. So we know that there'll be a huge positive correlation, both economically, systemically, and within the workplace, as well as in people's personal lives. So it's a bit of a no-brainer, right? But for some reason, it's still not happened. So this is why we're really pushing for the change, hopefully within the next few years. Next slide, please. So I mentioned about the legal gap being related to the Health and Safety Act. So that's the HSWA there. Now, what we have within that act is it mentions specifically that you have to look after people's well-being, but it doesn't say anything about mental health. And then there's no secondary legislation telling us how to do that. So all we've got is some guidance from HSE around management standards, and we've got a bit of a rubbish risk assessment. And the reality is it doesn't mandate employers to do anything. Therefore, it doesn't give the same level of importance to physical health. So what we have here is almost like a two-tiered approach. It's like we have to look after mental health, but it's if you want to do the mental health bit, then you can if you want to. And that's what we want to change. We want to make it as important, but also what's really important for me is creating proper guidance that helps people to understand exactly how they do that. So as an organisation, most people actually do care about mental health, but they don't really know where to start. They maybe don't have the resources to pay a consultant to come in. They can't pay for legal advice. So what can we do to create some really, really helpful guidance and frameworks that organisations can use for free as part of this legal change? So for me, I don't want to just change the law and make it more complicated for people. I want to change the law by creating a really strong framework and guidance for employers to know exactly what data they need to be looking at what stage, and then understanding what the outcomes are of those risk assessments. So that's what I'm looking to do, is to bring in some secondary legislation that will help with that, with some guidance co-occurrence as well. And we know that, I mean, I'm an employment solicitor. I specialise in the Equality Act. So the Equality Act does provide a level of support, but only for people who meet the definition of disability and only in respect of what's reasonable in terms of reasonable adjustments. So what I'm looking at is beyond adjusting the role. It's actually looking at what are the other psychosocial hazards within the workplace that we can monitor and that we can discuss with the individual. So when I talk about that, what I mean is, you know, if conflict arises, how is that dealt with? Does the person know what their job actually is? Is it clearly defined? If there's discrimination that happens, how is that dealt with? So looking at the whole landscape of that employment relationship rather than just that person's role, which is what the reasonable adjustments look at. So I do feel that there's a huge legal gap, and I actually don't think it would fit within employment law. It's likely to fit more in the health and safety space, but then potentially link into employment law so that we're linking health and safety, HR and ED&I all together, and it's not dealt with in silos. Next slide, please. So yeah, I think I've already mentioned that I'll always jump ahead on this because I'm so passionate about this topic. But essentially, this, in summary, this is the proposed legal reform. So amending the Act or creating secondary legislation that sits underneath it to include mental health provisions. Then thinking about how we enforce that. So whether that will be HSE investigating, whether it might be insurers or even tribunals that could enforce through the employment tribunal, perhaps. We don't know yet. We're at the very early stages, but if anyone wants to read more in terms of the research and the reasons why we've thought about these different mechanisms for change, there is a report on the QR code that you can download with all of the research and lots more detail into how we got to this space and why we think this particular route is the best option. Next slide, please. So I know that there's some people on from Australia. So this is actually following the changes that have already happened in Australia. So these countries that you can see on the slides have already moved to a similar model. We are aligning it with the international standard for psychosocial hazards as well. So I know that Australia already moved there. I think it was 2024. Canada have recently created something that's similar. And then we know that Brazil are also moving towards that. So we're seeing a global shift towards this more preventative approach. And we can see from the Australian model that it is working. And the research does show that it has a tangible benefit to mental health in the workplace. So bravo to Australia for doing it first. And it's really great to see that other countries are leading the way and making that change. So I don't want the UK to fall behind, because historically we've been really good with mental health. And I do feel like we've dropped in terms of our credibility in this space. So I think in order for us not to fall behind, we really need to think about implementing this new legislation sooner rather than later. Next slide, please. So for me, benefits of action, we absolutely need more clarity for employers. I, as an employment lawyer, do a lot of advice in this area. So even though it's not law yet, it's still best practice. And what I find time and time again is employers just don't know where to start. They don't know what to do. They feel they can't say things or do things because it's unclear as to what their obligations are. And that's really because the law isn't very clear, and there's no guidance on it that's clear enough for them to see what they are actually supposed to do. There's guidance in terms of, here's areas that you should look at, but then it's the actions that they often struggle with. So we want to really support organisations, and in turn that should have a positive benefit on the impact that we're seeing on the NHS and organisations. We know that there's huge waiting lists for mental health and ADHD support within the UK. So if we can support people in the workplace, keep them in meaningful employment, then we're much less likely to need as much resource from the NHS. Next slide, please. So there's quite a few issues that I think we're going to face. Well, first of all, my petition link's not live, so that's one. But we do think that there is likely to be some delays in the reform. It can take years, 3 to 5 years, and that's if someone runs with it. So our plan is to get the petition live, get some MPs involved. I'm going to Parliament in a few weeks to speak at a round table, and hopefully I can get some MPs on board. So if there's any MPs on here that would like to help, let me know. But the reality is we just want as many people as possible to start talking about this change. When I petitioned a few years ago for a similar change, it picked up a lot of traction online, and that helped us to get a debate in Parliament. So I think the important thing is if you can help, then please do reach out to me. We do think that the delays will be quite evident from, we've seen this government promise quite a lot of things from the Employment Rights Bill, for example, and there's huge delays there. And I'm involved in those consultations. So I think that's going to be one of the biggest challenges, but it doesn't mean that we can't start making some of these changes internally in our organisations. So if you want to know more about how to do that, then just contact me. I think the challenge that a lot of when we've consulted on this, a lot of people have been saying is actually, will there be lots of claims as a result, and is that going to make it harder for employers? So we want to make sure that it's not just a tick box and loads of claims will then just happen, because that's not really the purpose of it. So that's something that we'll be addressing as part of the enforcement changes, which obviously helps us make sure that we're really transparent about that right from the outset. And we want to make sure that we have a really strong framework. So one of the things that often is challenged is when you bring new law in and then it's kind of the and what, it's like, what are we supposed to now do? Because often it's not very clear. So that's something that we're going to have to spend quite a lot of time on with some experts to help us make sure that we've got the right preventative framework in place. Next slide, please. So there's the plan. I know I've only got a minute or so left, but essentially the plan is get that petition live. We want to, if anyone is able to support with that, get in touch. We've got our cross-sector coalition. We've got loads of organisations already signed up to support us. So we'll be doing an open letter to Parliament. We've done a draft of the legislation already. So we need to get that in front of the roundtables that we want to set up. And then obviously when we get to that next stage, we'll be looking at what the codes of practice and the guidance should be as well. Next slide, please. So that's me. Oh, look at that, just on time. So if anyone would like to support, please scan the QR code, get in touch with me. I'm on LinkedIn, Instagram, TikTok. It's I am Jodie Hill on those. I'd love to hear from you. And thank you so much, Henry, for giving me this platform to share. This is the first time I've shared it publicly as well. So it's an exclusive. So thank you so much, and have an amazing rest of the conference.
You're amazing, Jodie. I think it's a huge deal. And when you introduced it to me, I thought it was very, very important. And when we talk about psychosocial, the idea that we don't look at the mental health risks around a job that we do by routine for the physical risks. And you do see in some industries, as we talked about, that this is a part of normal process. So, for example, the one that immediately came to mind when we talked about it was the tube drivers. So if occasionally people will look to take their own life, and they do it by stepping in front of a train, and it's an awful thing, and it's an awful thing for the driver, and it's an awful thing for everyone involved. And for the driver, there is a process. They stop driving immediately. They're given time off. They're given counselling. Their mental health is supported immediately, and that process is in place. And it's not in place for, or often properly considered for any other profession. And I'm in London. We've made a huge sewer. We're excited about it. It's called the Thames Tideway, and it's absolutely massive, and it captures stormwater and waste as it hits the Thames. And my understanding is that there was only one significant accident, and it involved a wall collapsing, an old Victorian wall collapsing that they were joining to. Two people involved, and actually the damage has been to their mental health. They now have trauma from it and are struggling. And there would have been, I can only imagine how long the health and safety and the risk assessment was for that entire huge multi-billion project, but mental health not considered. And probably, we don't know, can't see it, but and yet that's the most, it's a testament that they've had no physical issues, but they have left people with serious mental issues and may well have not considered that, and certainly it's not done routinely, which is what you're looking for. And so I just thought there was evidence of it in those two stories, show evidence in a workplace where there's a path and a plan, and another where there isn't, and we've seen damage. So I think it's wonderful what you're doing. I think it's really, really interesting. What do you, considering the current government, what do you think?
I'd like to get it through in this current government, because I'm a bit worried about what's next, to be honest. And I do hope that there is a want and need to make a positive change before the end of their term. I think they probably could do with that. So let's see if it's taken up by one of the MPs. I mean, it's a pre-made, ready-made plan for someone to make their name if they want to take it, so they can have it and run with it, because we've done all the work. We just need someone to really own it in Parliament now. And I'm sure in the Labour Party there must be someone who cares enough about mental health to want this change.
No, obviously I hope so. It feels heavy weather, certainly for ADHD. I've just had a meeting with people across the globe and the changing ADHD situation in all of those countries. There's progress. And for us, we feel very much like we're playing a defensive game, that people are trying to make it harder, not support. Right, I need to let you go. You're amazing. Thank you very much. And thank you for this initiative. I think it's extraordinary. So thank you.
Thank you. Bye.
Bye, Jodie. Right, over to our next segment. Extremely excited about it, and we've got Parul Singh coming on. She is talking about practical technology, and it's here's our transfer slide. So practical technology around tech and tools for ADHD Mind, building your own toolkit. She's the director of Parallel Minds and part of the a neurodiversity consultant. She's an ADHD UK ambassador. She's a sought-after keynote speaker. She's bringing together her own lived experience and professional expertise to drive meaningful inclusion. And I am just talking about strategies to reduce flow, reduce friction, increase flow, help you make your own toolkit, and absolutely thrilled. Parul Singh, welcome.
Hello, good morning, Henry. How are you doing?
I am doing great. I can hear you loud and clear, see you fantastically. And I know how hard you've worked on this, and it's a absolute passion. As it is for me. I think it's one of the most important segments of the conference. This is of the real life stuff of putting things in your life to make change. And honestly, I think you'll take away more than one thing from this for the people watching. But even if you take only one away, it's a good chance it changes every single day of your life. These things, when we talk about strategies and we talk about changes to you, we're often talking about putting something into your life that you'll use every day or so regularly, and it makes every day better. That's so worth it. And so this is wonderful. Parul, I'm going to hand over to you. Thank you so much.
Brilliant. Thank you so much. Could I get the slides on the screen? Perfect. Thank you. I mean, Henry's done a pretty brilliant introduction to my talk. So I'm going to tell you a little bit more about myself. So hello, I'm Parul. My pronouns are she, her, and I became a founder rather abruptly when I left my last job in January last year at 28 years old. I'm doing it all by myself. I don't have any support. I don't have any funding, and I'm still managing to keep the lights on somehow. And doing that whilst being neurodivergent, I am autistic, I have ADHD and also complex PTSD. I also have chronic migraines, so that is a bit of a horrible mix to make life very, very difficult. So anyone who is also chronically ill will know the feeling. And unfortunately, I also do love all of the side quests. I've never known a day of peace in my life. I like to keep busy because when I'm left alone with my own thoughts, that is not good for me. I am mum to Dory the corgi, who you'll see here. She's incredibly cute. I always have to put her in my sides. I do crochet. I play piano. I run an online community. I just don't like having any sort of like quiet. So I'm constantly juggling a lot of things, some of them of my own accord, and I love everything that I do, but it's particularly difficult having ADHD. And I didn't know that I had ADHD until 25 years old. So going through school, university, and part of my career, struggling with keeping on top of things, remembering things, my focus, my attention, all of those things. I didn't know all of the stuff that could actually help me, which is labeled as like ADHD strategies. But because I grew up in the age of technology, I kind of loved fiddling with tech and figuring out how I can actually use it to make my life a little bit less overwhelming. And I know that for a lot of you watching this, you probably do feel overwhelmed quite a lot. You feel like you never get to the end of your to-do list and you're feeling, quite burnt out. So I hope that the things that I'm going to share with you today will help in some way or another. And just as Henry said, I'm covering a lot of tools in this, by the way, and I will be sharing the slides and all of the list of tools, so just keep that in mind. But even if you just find one that you think is going to help you, then I've done my job well. So what I'm going to cover, I have 4 groups of tools which are tied to areas of life or ADHD traits and challenges like organisation, working memory, time management, etc. And they are for both personal life and also work life. I'm also going to show you demos and examples of the tools, so with like screenshots and videos to show you how they actually work. And then I'm also going to highlight the most ADHD friendly features, because there's a lot of tools and apps out there. Like if you just go and Google now, like productivity apps or productivity techniques, you just get so much. But the reality is that a lot of those don't necessarily work with people for ADHD. It's not the same for everyone, but like, for example, I really struggle with like the Pomodoro technique. It's just a little bit too rigid for me, and like that's absolutely fine. So I'm going to show you things that are maybe a bit more likely to work for you. And as I go through this, I want you to think about, which of those barriers do you relate to the most? Which are the tools that pique your interest? Not everything will, and that's okay, because you also don't want to overwhelm yourself by trying to go into everything. Jot down a few things that you want to look into after. And also don't worry if you are not a pro in technology. I have used my mum as a guinea pig for this talk, and she is probably the biggest technophobe I know. She actually, until a few weeks ago, was writing down her passwords on her notes app in her phone. I was like, oh my God, Mum, no, this is such a bad thing. I should have had to use the passwords app. So definitely pass the mum test. And also my slot was shortened slightly, so I'm unlikely to be able to take questions, but you can still put them into the chat and I can see if I can adjust those in my newsletter. Now, before I go into the actual tools, I'm going to share with you 3 things that will make your tools work better for ADHD brains. And those are automations, widgets, and integrations. I'm going to explain what these are in a moment, as I'm going to be mentioning these throughout the talk as ways to level up the tools that you use to make them easier for your brain. So they're a way of like layering on top of things. They're not things that exist on their own. So automations, as it probably suggests, are things that happen automatically. They're an action that, it links to a time. It happens at a certain time or when you're at a place or a different trigger. And automations are great because they cut out remembering fiddly steps and therefore reduces the manual load. Some tools that I mentioned and other tools just have their own automations and workflows, but they're also automation apps. So for example, in iPhone, it's called Shortcuts. There's one called Automations in Android. And this is an example of an automation which I have on my app, and it's also shared in the toolkit at the end. This is an ETA, so estimated time of arrival automation. So when I'm connected to my car Bluetooth, but I'm not at home, it figures out where I am, how long it's going to take me to drive home, and then it WhatsApps my partner, and I literally don't have to click anything. So cool. Widgets are mini apps on your phone or desktop, and they help keep important information visible, because we know that as ADHDers, we struggle with the whole out of sight, out of mind thing. So having that quick access, having it visible, it's fewer steps and it's less friction. So one example of a widget which I use on my desktop is I have this brain dump note on my notes app, but I probably will just forget that it exists, typical ADHD. So I just added the widget to my desktop, and this acts as a quick drop zone for my thoughts. So when I get a thought, I don't know whether it's like, oh, that's a content idea, or that's like a personal task, or that's a work task, but I need to do it next week, or it's this kind of like category. There's no kind of like filtering process. I can just get it out. And then also because it's visible, it stops me from forgetting that it exists and I do need to sort them out. So you can have these on your phone wallpaper, on your like home screen on your phone. You can have them on your laptop, on your smartwatch, etc. if you've got one of those. And then finally, integration. So an integration is something which connects apps so they talk to each other. This helps reduce steps and switching, helps avoid the mental blockers like open this, copy paste. So, you know, if you've like generated a transcript from something and you need to open a different app and you need to email it, or you're going between Teams and something else, and integration helps bring those things together very easily to reduce the context switching. Okay, so now you've got these 3 ways to layer on top of your tools to help make them better. Now let's get into the tools. And I started with one of the things which is possibly the hardest thing for people with ADHD, which is keeping organized. There are just so many things and it's so hard to keep hold of them. It's kind of like you're holding a bunch of like marbles and they're all kind of like dropping on the floor. You know, inevitably you're going to keep some and you're going to drop some, and you know, it's not great. Forgetting birthdays, forgetting to pay bills, forgetting to do things which everybody feels like they can do with ease. And it is basically just impossible and exhausting for ADHD brains. Every now and then I meet somebody and they're like, I don't have to write down things to remember them. Like, I don't need to do that. And I'm like, what is inside your brain? Like, I could never, if it's not written down, you know, it doesn't exist. So having something to keep myself organized is very key, because I have a lot of things to juggle. I'm sure you probably do as well. And this is why tools really matter. Though there is no perfect fix, the right tools will reduce the load, but the wrong tools will add to it. So what the goal should be is to make your life easier, not more complicated. And where people go wrong when trying to find like an app or a tool to manage their tasks, etc., is they're getting confused between project apps and task apps. So project apps are built for teams' workflows. So these are apps like ClickUp, Asana, Trello. You might have heard of some of those. Might possibly use them in work, and they're really good for work projects. I use ClickUp for work personally, and it's very, very robust. However, this is far too complex for most ADHDers' personal use. I will show you what it looks like actually on this one. So this is my ClickUp. You look at that and you go, oh my God, what is going on? There's so many things. If you were using that for your personal life, you're going to set it up and you're probably never going to look at it again. So that's why you need to differentiate between what's a project app and what's a task app, because a task app is a lot simpler. It's easier to use, helps you keep track of like your life admin, kids stuff, shopping lists, appointments, etc. And these are designed for individuals. And the things that make task apps ADHD friendly. First one is visual clarity. So you want something which has a clean, uncluttered interface. It should have high contrast. It should have simple lists, maybe just a bit of like color coding so your eyes know where to look at, and not having those big walls of text like in my ClickUp that I just kind of showed you there. That's my ClickUp home screen, which is like, and everything is on one screen. You also want to have frictionless task capture. By this, I mean you should be able to add a task with 2 steps or less. You should have multiple ways to be able to add a task. So maybe by like voice input or like dictation. It's a bonus if there's a bit of like gamification or rewarding. So maybe when you complete a task, it goes, woo, bit of confetti. Or actually some like proper gamification or some streaks if you do like that sort of thing. And then also an info dump zone. So is there an easier way for you to just dump something into an inbox and then actually sort it out later? Similar to what I just said with the brain dump thing. With ADHD, the more steps that it takes to do something, the less likely you are to do it. So having a way to pop something in, dump it, leave it until later to sort it without being able to organise on the spot is a massive bonus for our brains. And there are so many task apps out there to choose from, and it's a very, very personal choice. But by using these things, you can help find one that works for you. But I am going to give you a recommendation of one which I have been using for, I think, over 5 years now, which is possibly the longest that I've ever stuck to anything. And it's called Todoist. And this is great because it's simple but functional task management that works really well for ADHD brains. You can see on the right here, this is what the home screen looks like. It's super simple, just a few lists. It has a free version, which honestly I think is really comprehensive, and you don't actually need, like the paid version, and only a few people need it. But even with the paid version, it's I think only like $4.99 a month, and then cheaper if you sort of like pay for the year. So few features, there are loads of features for this, but there are a few which are perfect for ADHD brains. And the first one is these really simple task lists. So you've got a few different view options, but it's like color coded by priority. You can sort by that. You can sort by the due date. It's just very visually uncluttered, but it sorts them in the right level of kind of like sorting that, not everything is kind of like in one list. And then they also have this quick add feature, which they say, which the sort of tagline is, capture tasks at the speed of thoughts. Again, there's a theme here. So you need to make it as easy to add the tasks or do things as possible. So the quick add feature, if you press a combination of keys, you can also customize the shortcut. It doesn't matter. You don't need to have Todoist open. If you press this combination of keys, this window will pop up. This window is a quick add window. So let's say you're on a meeting and you've got an action. You can press this, and I'm going to type in my task, and without having to click anything, I can type Tom 9 a.m. and it sets the due date for tomorrow 9 a.m. I can type P1 and it sets the priority. I can do an @ and it adds a label. So all of this is really clever and it's really quick, and you can do that and then you can just close it. You can add the task and you can close it. So it reduces the number of clicks to need to add something, and it makes it a lot easier because you can just pop it up from anywhere. They also have location-based reminders, which I've actually not seen in any other apps. So if you need to do something when you are at a certain location, so let's say like I need to go buy Lemsip when I go to Boots next time, which I don't know when that's going to be. Instead of reminding me at a certain time, it's going to remind me when I arrive at the location. This is great for those things where you're like, oh, I need to buy that next time I go there. And then like you always forget, and then you end up going back, and then you end up buying more things. So this is really helpful, and it's very, very clever. And the last one, of course, there are lots of other features that you can explore, is the ramble feature. So we know that with ADHD, sometimes the written processing can be a bit of a mental block. When you sit down and you go to like write something and you're like, brain not working, but you can probably verbalize it and speak it. If you click the ramble function, you can just speak. So here I said, I need to finish cleaning downstairs tonight, maybe about like 6 o'clock, and then I'll go and get some groceries tomorrow at 9 a.m. And it just types it like magic, which is amazing. Just dump the task, verbal dump. Now, leveling up with the layers that we mentioned, you can also use widgets with Todoist and probably most other task apps as well. So up here, I have got a list of just 3 tasks. So again, this is great because it's not overwhelming. You've only got 3. And then here you've also got ramble. So when I think of something, I can really, really quickly click the ramble and then just add it in there. It also has loads of integration. So if you end up using it for like work, you can integrate it with Slack. So you can add a task just literally from like a Slack message or a Teams message. You can add a task straight from an email. So again, reducing the number of steps really helps to actually add the tasks and reduce that sort of like executive functioning and overwhelm. So there are other apps out there. I have tried a lot of them, and some of them people might love. If you've got a particular task app that you love, feel free to pop it into the chat to share it with other people. Have shared us some alternatives with the resources, but a lot of people don't like that I speak to don't actually use this one, and it's really surprising considering that like there's a free version and it does quite a lot. But when you're trying to find something to keep you organized, keep it simple. Do not go for something which is actually meant for like work project management. Ensure you've got something that makes it as easy to add tasks as possible, because that's what's going to help your ADHD brain. Leverage all of the right features in there. So you might get like the app, but are you actually exploring the different features which might work for you? And then where possible, see if you can level it up with, you know, the integrations and the widgets and the automations. Okay, so now going on to focus tools. So, I mean, it'd be hard to find somebody out there with ADHD who doesn't struggle with their focus, and it really gets in the way sometimes. So I'm going to share a few easy things that you can do to help with your focus. A lot of them are going to be to do with the phone, unsurprisingly. And the first one, and possibly the most simple one, is focus modes. So we all know about, I mean, most people will know about the do not disturb focus mode, but a lot of people actually don't leverage the other focus modes which exist, like driving and sleep. But you can also create your own custom focus modes. This is available on both Android and iPhone, and you can use them to have different levels of filtering for apps and people that it allow the notifications through. You can put them on a schedule. So again, rather than me remembering to put on my work focus mode at 8 a.m, it'll just do it automatically from 8 to 4 p.m, Monday to Friday. And this is free. It already exists in your phone. You don't have to sign up to anything. You don't have to pay for anything. It is just there. And it's very logical, and it really helps people with ADHD because our brains are hypersensitive to pings and alerts. A single notification can always lead to a full derail. And we know that it can be so hard to get into that focus mode. So then being pulled out of it and trying to get back into it, and then we just really struggle to actually get things done. So this really quick fix of actually leveraging those different focus modes really helps cut the noise and to protect your flow. So they help filter notifications. I want to talk about the phone a little bit more. Now, I am guilty of having a lot of screen time, okay? I love TikTok. I love my phone. It's my comfort place. And a lot of like telling somebody with ADHD to just use your phone less, just put it in a different room, is honestly just really pointless, because phones are like dopamine slot machines. There are so many apps, so many distractions, short form content, TikTok, which again, look, I love, but if it's hindering your life and your distractions in being able to, you know, kind of like do your work, there is something that can help with that, but it's not going to be your screen time limit, unfortunately, for most people. So screen time limit, they have it on like iPhone, I think Android as well. And you can set it for apps. So you could go, okay, my daily limit for Instagram is 30 minutes. And then this pops up, and then I just go, ignore for today. And I just carry on doom scrolling. So that is like basically as useful as a chocolate teapot. So what can actually help with that? Distraction blockers. They can help you reduce that mindless scrolling. And I was recommended one called Opal, OPAL, which is linked in the resources. But I was shook when I saw that the paid version is £20 per month. And I was like, it's not even that like fancy. So I was looking around for cheap alternatives, of course. And I found this one called One Sec. And honestly, it's changed my life. I still have an affinity. I'm still drawn to my phone. Like, I have ADHD. It gives me that kind of like dopamine. That's never going to go away. Stupid little slot machine. But I do have a far better relationship with it, and a little bit more that kind of like intentional use. And both Opal and One Sec and other things, they do have free versions, but One Sec is a lot more affordable for the paid version. But again, you might not need it. It's only £3.99 per month. And it is available on both iPhone and Android. So let me show you how One Sec works in practice as a distraction blocker. So I am going to open TikTok. So I don't know whether you could hear that, but that guy is going, "You sure about that? You sure about that?" I think it was a meme, apparently. So that comes up. It says, "Do you want to open TikTok?" I go, "Yeah." It then asks me, "How long do you want to use it for?" I go, 15 minutes. And then when it hits that 15 minutes or 30 minutes, whatever it is, it does it again. And you can completely customize this for like different apps, different schedules. Like, for example, like I do want to indulge in a bit of TikTok over lunchtime. So it doesn't run between like 12 and 2 p.m. So, you know, it is actually really, really handy. It's a very clever app. But again, there is a way that you can level this up as well if you want to take it a step further for people who like making things even more efficient. So this will probably take you like a few minutes to set up, but you can combine focus modes on your phone with automations and then also one sec to get your ultimate focus combination. So an example of how I've done this. So when I arrive at the gym, this is my automation trigger. It sets my gym focus mode. So that bit is like super simple. You can do that. It knows where I am. It sets my gym focus mode. But then I've changed the behavior of one sec so it behaves differently when I'm in that focus mode. And it limits my notifications even more because I want less distractions. But it also stops me from being able to open email and LinkedIn. I go to the gym over lunch quite a lot, and this is a problem for me because I can't switch off my brain because I've been working for like 3-4 hours, and then I go to the gym and my brain is still in work mode, but I really don't want to have those distractions. But then by all of this happening automatically without me not having to press a single thing, I'm able to have a really good workout, get a little bit of like a mental break with less distractions. So I'm going to link all of these tools and also some of the guides to be able to set this up in the resources at the end. So that's distraction blockers. Now we're going on to the final tool for our focus section. And I want to talk about task initiation and task completion. So we struggle with getting started with things. I'll tell you, one time I was supposed to get set up on this portal to get paid for a new client for an invoice. And I put it off for 4 weeks. This is to get paid, by the way. I put it off for 4 weeks. You know how long it took me? 3 minutes. 3 minutes. There's no logic behind it. But yes, we do procrastinate things, even if we know that we need to do them, even if sometimes we like enjoy doing them, or even if we can get started with them, we maybe struggle to finish them. So, you know, maybe like we start something off and it's like, woo, novelty, dopamine, etc. But then when that runs out or we have so many distractions, then we just end up having like a million things which are half finished and, you know, we don't kind of really know where to go. And that's quite difficult for a lot of people, struggling to get started and struggling to get things finished. One of the things which a lot of ADHD people say works very well for them is this concept of body doubling. So if you haven't heard of body doubling, it's where you work alongside someone, either like in person or virtual, to help boost your focus, reduce overwhelm, and help you stay accountable for starting and finishing the thing that you said that you're going to do. And some of you might do this without even realizing that you do it. So if you've ever sat next to your partner or your family member at home on the sofa and you've gone, right, I'm going to do my life admin, or I'm going to do my tax return or something, and you just sat with them. They're not hovering over you, making sure that you finish. You know, but the act of sitting next to them, like that is body doubling basically. And it would be great if that works for you, to have somebody who can sit next to you permanently and make you feel accountable, but that might not always be possible. And that is where some I've gone the wrong way. That is where some online platforms can actually come in handy now. So there's one which is a really popular one, particularly with ADHDers, but otherwise. It's called Flown, and they have a variety of sessions. They have 1 hour focus sessions, 2 hour deep dive sessions, and I'll show you what it looks like in a second, but you can choose to share your intentions in the chat. So they'll be like, what are you going to work on in the session? So you can do it in the chat, or you can opt to go into a small breakout room with like 2-3 people and talk to them in the beginning, and then at the end you'll get put into the same breakout room and then kind of like share sort of like how you did. And honestly, it works like magic. And they, again, have a free version, but the session's a little bit more limited. And this one is £20 per month, but I've been paying for this out of my own pocket for like well over a year now, because it's like absolutely worth it for me, because it actually means that I get things done. I think I did about 4 sessions this week working on these slides, and it really, really helped. And one thing which I really respect about them, this is like kind of side note, is you don't need card details to sign up for the free trial. It's almost like they know their audience. They know that a lot of people got ADHD, and we know that we forget to cancel subscriptions. So you can do your free trial with no repercussions. And this is what it basically looks like. Like it is a Zoom effectively. But I have this open on my laptop, and then I do my work on my monitor. And here I've put my intentions in the chat, and it's just really, really nice. And it really helps you kind of like stick to what you are doing. So that's one to look into. There are a few other like alternatives, but like Flown has been working really, really well for me. And again, a way that you can level this up is just like it's a really simple integration. So if you're thinking like, how am I going to remember to book my sessions, or like, how do I make it easier for myself? If you go to this kind of like, it's a little feature in there, and you personalize your calendar. So here you'll basically tick all the sessions that you might do. Obviously, like I'm not going to do 1 to 2 a.m. But these are the sessions that I might do. And then it creates a calendar feed. So here is my calendar for today. So this is my diary. Obviously, I've got nothing except for the conference. Very important. But on the right here, you'll see the Flown sessions. So what I can do is I can just cross-check. Oh, I've got like a free afternoon. And I just click it and then I book it. So it makes it like, it actually just makes it super easy to like do it around my schedule and around my meetings. So, summary of the focus tools. The focus modes that you already have are a really easy way to help cut the noise. You can use distraction blockers like 1sec to help break those doom scrolling loops. Doing things like body doubling, either in person or using an online platform like Flown, can really help that accountability and help you do those tasks which you really, really don't like doing, but you kind of have to do because adulting is hard. And also, there are ways across all of those that you can level those up with automations and integrations. Fabulous. So, time blindness tools, time blindness. Do you ever just feel like time melts away? You start the day, you start the week, and you're like, where has the time gone? I've run out of hours. I just wish I had more hours in the day. Having ADHD, it's very common to have a difference in the perception of time. It doesn't pass the same as it does for like other people. And this can result in hyper focusing to the point where you are like so absorbed in something, you are like dead to the world. You might struggle with underestimating how long something is going to take, or spending longer on one thing when you really should have been doing other things. And that can cause a lot of challenges. So finding a few things to help you with that time management really helps. And the first one is visual time management. So there's an app called Timo, that's Tiimo, which is built for ADHD brains, and it helps you see the time and not track it. And it is fab. It's got a free version, or £6 a month, or £36 a year, I think. And just also as a side note, this one and a few other tools which I have mentioned and will mention in this talk are actually covered by Access to Work. And you can also ask for some as reasonable adjustments. So that's, again, something to think about, is that you might not have to pay for these things yourself. So 2 things in Timo which are very ADHD friendly is they have this magic breakdown. So I put in a task into it and I go clean my house. And then I press the little magic wand button and it adds these subtasks, which are actually really accurate. Like some of the things which you like break down tasks with AI, and they're like actually really stupid, but actually really good. And then it estimates the time as well. And it puts a little emoji. So when it's in my list, it's like all nicely organised. I don't have to do anything. That's amazing. Less work for us. And then the actual visual time of it. So when I start a task, you can see this thing here, the purple bit, that will go up. So I have you can also create recurring tasks. You can also create different profiles. So you can do one for work, you do one for personal, different things. And every day I want to practice piano for 30 minutes a day. So I just start this and I just put my phone there so that I can just remember, because sometimes if I'm playing stuff that I really like and I just kind of get absorbed in it and I sort of lose track of time and I should be doing something else. Or when I'm cleaning and I'm doing a lot of cleaning and I'm like, I'm not even halfway through and I've got like 15 minutes left, so I'm going to have to start wrapping up. So it really helps with the time blindness. But if you are a little bit old school like me with some things, this isn't technically a tool, but I just thought it deserves an honorary mention because I even have it on my visual timer. I have it on right now to make sure that I keep to time for this talk. So I have the time in my presenter notes window of when I started. I've got the clock in the right hand corner. I've got the clock on. I've got the clock everywhere, but I don't know why. This visual timer is amazing. It's supposedly for children, but like, you know, I'm allowed. But it really helps me like physically see like the passage of time. I use it for when I'm doing work tasks. I use it for when I'm like getting ready, because sometimes I'm like jamming a little bit too much to my songs and then I end up being late for something. And I think it's about like £13 on Amazon. So like, if you don't want to use your phone for everything, this is actually amazing. And speaking of time management, are you somebody who is always late to meetings? Do you get absorbed in what you're doing and you're like, oh, I was supposed to be in a meeting 5 minutes ago. Oh, no. And you might get notifications and then you just ignore them, or you just don't see them, or you just like snooze them and you're like, oh, I've still got 10 minutes. And then you end up being late. There are 2 tools for this, and I'm really sorry. They are unfortunately both only for Mac. I tried my best to find Windows like equivalents, but there was nothing that really existed. There was one that had really bad reviews. So I won't go into these in detail, but I'll share them if you want to have a look at them. This one is called Next Meeting, and it is completely free. And you don't have to set up an account or install anything or do anything. You literally just have to install the app, select whichever calendars you want it to work for. And then what it'll do is here, it will show you, so in the bottom left here, it'll say this meeting in 54 minutes. Or if you click it, it will show you a little thing about your calendar. How nice is that? And it's free. So if you've got a Mac, go and download this one. It's amazing. But if you are somebody that even that will not do the job, there is another app, which is £1.99 a month, and it's called In Your Face. And just as it kind of describes, it is a little bit more in your face. So at a set time before a meeting, it will go full screen and it'll go, you have this meeting in 1 minute. Click here to join. So you basically can't avoid it. So that is for people who just need something a little bit more in your face. Fabulous. So time blindness tools, Timo, or there are other alternatives, are great for that visual time management and being able to see, like, you know, how long is something going to take and helping you break things down. And you can avoid being late for meetings with the apps which I mentioned. Now, going into the final section of the talk, these are work tools. I do have personal use cases as well. So if you're somebody who came to this for kind of like your personal life, don't switch your brain off right now. But also, on the other hand, a lot of the things which I've mentioned might be more for personal use, but can definitely always be used for work. But I've got a few ones in this section which I'm going to share with you before we get wrapped up. And the first one is Goblin Tools. This is quite popular in the neurodivergent community. It is a collection of free neurodivergent friendly tools. You can see there's some on here. There's lots of different ones. They got one called Chef, so you can put in all the sad ingredients rotting in the bottom of your fridge vegetable drawer. You know what I'm talking about. And you're like, what can I make with this? And it's cute. But anyway, I don't think that's the best one. And there are 2 tools which I think are incredibly helpful for work. And the first one is the formalizer. So when you click on the formalizer, it'll pop up with this thing and you can put in what you want to say, basically. So this happens to me on a weekly basis where somebody cancels a meeting last minute or they just don't turn up and I feel really dysregulated and I'm quite pissed off, to be honest. Happens a lot. So what I want to say is you didn't turn up and you cancel last minute, you're really rude, and it's a waste of my time and you should learn some manners. But a lot of the time that's actually apparently not really acceptable to say to people, and, you know, having a bit of that kind of like that filter, and you're like, I should not have said that. So that emotional dysregulation when you're really upset or angry at something, combined with the lack of impulse control from ADHD, can mean that sometimes we send or say things that we maybe really didn't want to say it in that way. So you just pop into the formalizer. You can click make it more professional, make it less waffle, make it more polite. And then it'll give you the output. And you can click these 3 little chilies here, and you can choose the level of spiciness. So if you're like, this is really bad, I need you to do a lot of work to make this more professional, you can put it up to like 5 chilies. If it only needs a little tweak, you can put it on 1. And now their email now says, I noticed you were unable to attend. I would appreciate if you could confirm times in advance to ensure better communication and mutual respect. Thank you. Much better. This is much better. Much less likely to get somebody pissed off at me. Much less likely to get me fired from work. Very good. And then there's one which is kind of like the other way around. So, I mean, how many times do you get like an email or like a message and you're like, oh my God, they absolutely hate me. I'm going to get fired. What's going on? And you just spiral over it. And that's because of the rejection sensitive dysphoria, right? So let's say I get this email and it says, I was expecting an update from you on this project. We can't progress without this update. There's a lot of disruption. Can you let me know what's going to happen? And I'm like, oh my God, I've messed up. This is so bad. So I copy and paste it. I put it into the judge and it says a load of things, but it says overall the text comes across as professional, yet concerned, that communicates urgency, aiming to prompt action while maintaining politeness and respect. And what that does is it helps nip RSD in the bud. And it can even suggest a response as well. So I love these 2 tools from Goblin Tools because I think they kind of act like neurodivergent neurotypical translators. So a lot of neurotypical people just don't really like say what they mean or like mean what they say. And there's always like a bit of a hidden meaning behind it. So you can't blame us for thinking that maybe it does mean something else. Or sometimes, again, you just want to type how you sort of like feel and, you know, maybe you don't want to do it that way. And you might be thinking, if you've got, well, if you use, why don't you just use ChatGPT for these things, right? And basically everything else that Goblin Tools does, ChatGPT can absolutely do. But the challenge with ChatGPT is that when you open it, you have a blank screen. Like, where is the prompt? You need to think of the prompt and you need to write it. Whereas this is built specifically for this purpose and it helps reduce that mental block. So that is Goblin Tools. Now, 30% is the average working hours somebody spends in meetings a week. For some of you, it might be more. For some of you, it might be a little bit less. And we all know that the majority of those meetings could have been an email. So what's happening in those meetings is you all sat there trying to look like you pay attention, trying to listen to what other people are saying, but you're actually just associating. So that verbal processing is really difficult. And like paying attention is like quite hard for us. But then when you have a lot of meetings and you need to take notes, you need to take like the actions, but you can't remember anything, that is very difficult. And that's where transcription tools can help. So these are apps that transcribe meetings and calls in real time so that you can stay present in the moment and review the details later. And there are lots of great options for transcription tools out there. This is probably the only one where I'm like, you know, there are actually quite a few like really good options, and it just depends on what kind of features you need and your budget. One of the ones which I love is called Tactic, and they have, I think, the best free version. So the free version doesn't limit you on the number of meetings, on the number of like minutes or like how long in the meeting. But what you can do is just literally just go for that one. So unless you need more than like 10 meetings per month, oh, sorry, I've gone back a little bit. And yeah, sorry, I just seen a message in the chat having the list of the tools. You're going to have all of the tools that I've mentioned, as well as some extra ones that I could only give him honorary mention, and then also how to actually like use them. So just wanted to give you that. You don't need to write everything down, and the slides, of course. So Tactic, very, very good. What does it look like? So this is me in a meeting by myself wearing some fabulous, it's a filter, obviously. And I really like this one because it's the only transcription tool that doesn't join the meeting as a participant, which might be a personal thing, but I just find it feels like a little bit intrusive when like this like otter as like a person, and it just kind of like has this toolbar on the side. So if we zoom in on that a little bit, this is the live transcription on the side of the window. And I can click, so this bit here, I can click on any part of the live transcript as it's writing it during the meeting to highlight it, so you don't need to make the notes. Or if you hover over it, you can click one of the emojis to either log it as a key point or an action or an idea. So, which is really helpful that you don't have to like write any of these things down, because it's just there and it's actually very accurate. My last team, a lot of Scottish people, very strong Scottish accents, and it did pick up the majority of what they said, which is great. And also mine, I have a Scouse accent, still very good. What it also has at the bottom is this notes window. So this for ADHD is absolutely genius, because how many times are you in a meeting and you have a thought or you have a question, but it is not your turn to speak? And sometimes that impulse control means you just blurt it out because you don't want to forget about it. And then people think that you're being rude, which is understandable. But if you have this little notes window in the actual meeting screen, you can write down a key point that you don't want to lose, but you can write down a question that you want to ask later while you wait for your turn. It's amazing. It's so easy to use. The free version is absolutely amazing, so I definitely recommend giving this a go. And one of the ways which you can also use this, and this is like the AI within this, is you can use the AI to generate summaries. So obviously a transcription tool is great, but what's the point if you need to like go through it and like look through all of your notes and things? So if you just click this, you can get like a detailed summary, or you can get like a summary with like action items. But what you can also do is you can write your own personalized prompt. So for my use case, I do a lot of client meetings and I do like proposal meetings. So I write this custom prompt, which is aligned to how I write a proposal or a follow-up email. And I say, write a proposal based on this meeting using the following sections. What are the main objectives? Also, what are the challenges that are neurodiversity specific? What are their objectives? What services did we discuss and how would they help? And the output is structured just like I would put into a proposal. And then it's a ready to send draft. I just have to do a few tweaks. That saves me hours at a time. Like, honestly, it's so much easier to use. And not even just for kind of like work life, but also like personal life. So I have a friend and he's doing piano lessons and he uses Otter because Otter does have a mobile app, whereas Tactic doesn't. And he puts Otter to transcribe on his phone on top of the piano during his lessons, and it captures the teacher's instructions in detail. And then he doesn't have to either waste time in the very expensive piano lessons writing things down, but then he also doesn't forget what to practice in between his sessions. So it's a great time saver. So maybe have a think, is there a way that a transcription tool could help me outside of work? And of course, you know what's coming up next. How do we level these things up? So you can use Tactic with its inbuilt automations with workflows and their integrations to, again, make things easier and less manual. So you can create a workflow in Tactic, which is triggered by a thing. I can't think of my words now. So in this case, it's triggered by the participant's email. So anytime that I have a meeting with Nicole, it triggers the workflow. And I have this prompt because every time I have a meeting with Nicole, I need to have a detailed summary with key updates, project focus, and like top 3 actions for us, for this month. So this is the same every single time. And then what it does is it generates that, it adds it to the transcription at the top, and then it exports it to my chosen integration. So in my case, it's Notion, because that's where I keep my meeting notes. It's a no-code platform, but you can also share it to Google Docs. You can also share it to HubSpot. You can also share it to Asana or whatever you have with work. And again, this whole automated process means I don't have to do a single thing. And then when I need to find those actions or that summary, I know exactly where to find it. Okay, this is the last one. So we're going to wrap up after this and should be more or less on time. But workflows, slide decks. If you are somebody who makes a lot of slide decks, but you really don't love how fiddly they are, you're going to love this one. So there's a super funky tool called Gamma, and you can make professional looking slides with ease, with a lot less fiddling and a lot less formatting. So what you do is you basically put in what you want to put into the slides, and it uses AI to create slides with the right kind of layouts depending on like what you've actually written. And what you could also do is, if you use ChatGPT you basically dump some thoughts into ChatGPT and then ask it to format it in the right format for Gamma. It knows how to do that. So it will give it in this formatting with the line breaks with this. It knows that this is a different slide. It's so clever and it's so quick. And then it will create the slides with the nice kind of formatting and things. And or you can paste like a big thing of text and ask it to summarize it and then put it into the slides. Like, oh my God, it's so easy. And again, the free version is really good. I've never paid for Gamma. I've never needed to do it. But just an example of like slides which it has made. So I wanted to do like an outreach project for higher education, and I've never done it before. I didn't know if it's going to work. So I didn't know whether is this going to be a good use of my time? So I just used Gamma to do it, and it made these funky looking slides. I appreciate they might be a little bit dark, but it's put these little, stats and boxes and the source and stuff. And then it's done these things. So I've got a little icon and the text and stuff. And it just took me maybe about 30 minutes. But if I needed to do that by myself, it'd take a day. And I didn't know this existed until earlier this year. And now I use this to make, not this slide deck though, because I wanted to make it really pretty for you. I used Canva for that. But most slide decks which I make using Gamma. So our work tool summary: Goblin tools, neurodivergent, neurotypical translator, but there's other kind of tools in there. So if you want to be am I getting the vibe right? Or how do I make this a little bit more kind of concise? Just put it in there. It's a lot easier. I think less mental block than ChatGPT. Look into transcription tools if you do a lot of meetings and you really want to stay present, you don't want to miss things. If you make a lot of slide decks, use something like Gamma to make them a lot easier. And once again, think about what are the features? Am I using all of the right features for me to make it easier? Am I automating things with the workflows? Am I using the integrations which are available to me to make this even better? So as a summary, as we're wrapping up now, how to make the tools and apps work for your ADHD brain. And the first one is, do not over-engineer it, okay? I know I have shared a lot of things today because I wanted it to be really varied and guarantee that everybody will take at least one thing from it. But I did make a mistake of introducing too many things at once, and then I couldn't figure out what was actually working for me and what actually wasn't. So maybe just pick a few things that you want to try and don't overcomplicate it. And if you can find a tool that does more than one thing, I really like Notion because it does everything. And when you have those tools, make sure you do explore the features, automations, integrations, and widgets which are available there for you as well. You also don't have to spend a lot of money. So everything that I've mentioned has a free version. A lot of those free versions are absolutely sufficient for the majority of people. You do not need to spend a lot of money. There are also a lot of predatory apps out there. Obviously I talk about ADHD a lot. So on my Instagram, I get adverts for apps that are specifically target people with ADHD, but they're very, very predatory and manipulative. And they'll give you time discounts and stuff. So it's if you check out in 10 minutes, you'll get this discount. And I'm you're not made for people with ADHD. I know this. So please, please, please don't feel like you need to spend a lot of money to make your life easier. You do not. And finally, accept that this will be a revolving toolkit. And by that, I mean, it is natural for something to work for you for a while, and then it might stop working. That's okay, because ADHD brains needs that variety and needs that novelty. That doesn't mean that you are broken. It does not mean that the tool is broken. Maybe just change it up a little bit. Maybe tweak how you use it. Maybe try something else for a little bit. That is absolutely okay. And if that's one thing that you take from this, please make it that one. So I'll leave you with some food for thought. Which areas of life does your ADHD impact the most? And then to address those, how can you leverage the tools that you already have? But then if they don't help, which of the tools that I've mentioned today could help with those? And I'm not going to go through these, but this is going to be on the slides and it'll be in the recording description. But I've listed all of the tools I've mentioned with the guides, with some additional tools for you. So this will all be available for you to go through. But you can also find this in my neurodiversity resource bank. So if you scan that QR code there, that'll take you to my link tree. Please do connect with me on LinkedIn as well. I really hope I've helped. I'm sorry I'm not able to take any questions due to the time slot, but please feel free to connect and reach out if you have any questions on anything. The Neurodiversity Resource Bank will have all of those. And of course, I'm also a neurodiversity consultant, and my specialism is making systems work better for everybody, including neurodivergent people in the workplace. So if your organisation wants any training, consulting or workshops, then you can get in touch with me or check out my website. And thank you so much for coming. I hope it's helped and I hope you enjoyed the rest of your conference.
Amazing. I thought that was brilliant. Thank you so much.
Thank you so much.
And it's so clear that the lived experience aspect, the fact that these things you've tried and tested and worked out, so these are really and recognizing the fallibility of people and us, like it just that there isn't this perfect solution, that things will change. That I thought that was just wonderful. I know this is an area of massive passion for you. You know, you're an extraordinary person. I have to thank you and say goodbye, sadly, because as you know, we're against the clock. You've done a great job of sticking to it.
Thank you. That's the visual timer. Everyone needs to get one of these.
Nice.
So I knew when I was running out of time and I sped up a bit. So yeah, thank you so much. And I hope you enjoyed the next speakers, everybody.
Thank you very much.
Thank you. Bye-bye.
Bye, Pearl. That was extraordinary. I thought that was extraordinary. Like that's the nuts and bolts of things that can help and make a difference. And even if you took one away, that's going to improve your life every day. And so looking at them and listening and understanding that's a big deal. So I'm very excited. We've got our next session coming up. So we've got Dr. Shai Mashru, Dr. Sai Achuthan, and they're talking about ADHD and autism together. We've then got ADHD and Wales, which is a discussion about what's happening in Wales with Sari Reid, who's an incredible advocate in Wales. And then an extraordinary session with Bill Morgan about political advocacy to make a difference. He's previously a number 10 advisor. As we look to try and make change and fight the battle for positivity for ADHD, it's obviously incredibly important. Before we jump over, we're going to just have a couple of ADHD ambassador videos talking about them being an ADHD UK ambassador and what that involves. First, over to Nick Gray.
Hi everyone, I'm Nick Gray, and I'm an ADHD coach and ambassador for ADHD UK. Now, being an ambassador means a lot to me. I found out April last year that I may have ADHD, and being a virtual assistant and business support, I decided to delve in deeper and find out how entrepreneurs are managing with ADHD and neurodivergence in general. And January this year, I started to train to become an ADHD coach because I really want to help and advocate others. Now, being an ambassador really means the world because it means that I can advocate for people that are on the long waiting lists. I can raise awareness for right to choose and also raise awareness for what ADHD actually is and what it isn't. Finally, to anyone who has been diagnosed or undiagnosed, all this time, you haven't been too sensitive, you are enough, and you're not alone.
Hi, my name is Carleen Bantic. I'm an ADHD coach, specialised in supporting adults, children and families. And in my full-time job, I'm a senior mental health social worker. The reason why I decided to become an ambassador for the ADHD UK charity is to raise awareness about ADHD in my local community. Working within various mental health trusts and local authorities, I noticed that many clients who are either undiagnosed or diagnosed ADHD all express their frustrations with the lack of support for ADHD. Many clients, when I was the deputy manager for the crisis team, all expressed that they felt very isolated and alone, and this exacerbated their mental health. Many of them felt alone, and unfortunately, many wanted to end their lives. And this really did fuel me to want to make a difference and to make a change. And that is why I set up the Bedford ADHD support group. The support group has been running since February, and it is growing from strength to strength each month. I'm very, very proud of it. And the group didn't cost much to set up. I was very fortunate to be offered a free space to host the group. The group grows so much, we've now moved into a larger venue. Some of the members have reported this has been a lifeline for them. Some clients haven't left the house in months. Some clients who have come to the groups have made some friends, made some real connections. Because being diagnosed myself, I really did feel alone. I didn't have many people who got me. So this allows people a safe space to share their experiences, to unmask, and to connect with people who actually truly get it. So if you're watching this, why don't you set up a support group in your local area? It doesn't have to be huge. You can set up a meeting in your local cafe. These groups can make such a difference. Because if you're like me, a social butterfly, these groups can be really beneficial and can make such a difference to your day, week, year, life. So yeah, that's my story.
Thank you to our ADHD UK ambassadors, and welcome Dr. Sai and Dr. Shai. I'm thrilled to have you both here. Many will recognise Dr. Shai Mashu from the Deep Dive series that he and I do together. There are podcasts looking into one topic as deep as we want. I think one ended up being over 3 individual sessions, so that the aim is to do a topic so that we know absolutely everything to do with it, and it shows his depth of knowledge as well. He's a consultant psychiatrist. He's the founder of ADHD Health Clinic, and Dr. Achyutan is also a consultant psychiatrist specialising in neurodevelopmental psychiatry, and works with Shai in the ADHD Health Clinic, and they're going to be talking about ADHD and autism. And I'm going to welcome both of you.
Hi guys.
Great. Nice to see you too. We can see you clearly, and we can hear you loudly, so perfect. I'm going to hand straight over to you, and your slides will be popping up shortly. Welcome and thank you.
Thanks. Right. Okay, perfect. So today's talk, we're going to talk about ADHD, which I'm sure a lot of the viewers who are very au fait with with this terminology. We're going to try and understand autism and ADHD and how it can present together, and recognizing the sort of emerging recognition of dual neurodivergence. So Henry's already introduced me, but my name's Dr. Shaimal Mashru. I'm a consultant psychiatrist. I work in an NHS ADHD service that I used to be the medical lead for. And I also am the founder of the ADHD Health Clinic, which is a private CQC registered clinic. We do online ADHD assessments as well as autism assessments for adults, and in the next month for children as well. I will leave Dr. Sai to introduce himself.
Hi there, I'm Dr. Sai Achyutan. I'm a consultant psychiatrist working alongside Shai as well. I'm also an author. 3 of my books will be published over the span of October this year and November. It's Unmasking Autism, Guidance to ADHD, and my personal autobiography. Background-wise, general adult consultant with numerous decades of leaderships and senior management kind of a concept over here across the private sector. And alongside that, I specialize very focused on substance misuse, personality disorder, and neurodevelopmental disorders at the moment now, right? And
just one other unique thing that Dr. Sai does, I think you have an involvement in the Royal College of Psychiatrists as well.
Yes. Yeah, I thought I'm just going to introduce everything later on as I move on. So yeah, I'm also the chair of the Royal College of Psychiatrists in the Southwest, part of England. Alongside that, I'm also the chair of the Mental Health Approval Panel for Midlands and East of England as well over here. Yeah.
Yeah, Dr. Sai is a very, very modest man. And one thing that's very unique that he does in our service is a combined online autism and ADHD assessment. So that's very unique indeed. Okay, so I mean, there's a long agenda here, but we are going to go into ADHD in quite a bit of detail. So I'm gonna move on from this slide. Over to you, Sai.
Yeah, perfect. Thank you, Shai. So I'm going to start off by saying this disclosure statement, right? All ADHD is not a recognized formal diagnosis under the DSM-5 and the ICD-11. We need to be very, very clear about that. But there's a but over here. A lot of senior consultants, do agree, and the neurodivergent community as well, do agree on the statement of all ADHD over here. A combination or an overlap between ADHD and ASD over here. So this is more of a clinical emergence where we start looking for things a little bit more differently and how the stereotype, when we talk about autism and we talk about ADHD. So this is something which we need to be very, very mindful. While all ADHD is clinically observed and now it's researched at the moment now. And I remember Shai used to tell me this, it's now in an infancy stage at the moment now, Shai, this the part of it that we are hoping, with a lots of experience of our research as well, we are hoping there'll be a future change in terms of the diagnostic criteria as the DSM-6 or the ICD-12, emphasizing lots on the all ADHD over here. Back to you, Shai.
So in terms of learning objectives, we want you to try and understand the definition and origins of ADHD, recognize the clinical presentation patterns, and grasp the challenges in diagnosing co-occurring autism and ADHD. We also want to explore the gender differences in ADHD, how it can manifest differently between males and females. And there's an emphasis, which I'm sure many people have heard of, on female masking. And we're going to review briefly the UK and global prevalence data and trends. And then we also want to learn about diagnostic assessment strategies, medication considerations in this particular population of patients, including contraindications, and the importance of early childhood developmental evaluation.
Now, the next part of it, let's talk about the historical context. Pre-DSM-5, what we've realized is that it was very focused on the male gender, right, and on the Western backgrounds as well, rather than the entire population of the world. I know we have the ICD-10 as well, alongside the ICD-11 and the DSM-5 TR as well. But one thing we need to be very, very mindful of pre-DSM-5, you could see the rate of autism or ADHD diagnosed was much, much lower. The reason why this happens is because it was very, very strict. The criteria was very strict and was following throughout years and years of unrecognized ADHD and ASD. Then the DSM-5 broke through. We started seeing a little bit more number of people getting diagnosed with ADHD and ASD at this point of time. Alongside that, a lot of us might think, oh my God, am I actually overdiagnosed? Am I underdiagnosed? What's going on here? No, let's take it back. Let's take it a notch back over here. What we are trying to do is trying to keep people aware. That's the reasons why we have lots of this kind of forums, conference, so that people become much more aware of the struggles they've been having for years and years. And this is what happens after the DSM-5. Hopefully, fingers crossed, me and Shai was having lots of discussions about this in terms of the DSM-6 and the ICD-12. There'll be much more of a breakthrough. Now we start understanding all ADHD much better at this point of time as well. Now, we look at the clinical observations. Those days, what we tend to do, lots of it was clinical observations. Now we come up with standardized tools, we come up with objective tools, we come up with screening diagnosis. But all of these things, there is something which we are lacking very, very clearly. One, gender, the differences. The other one is the cultural context. here as well. So these are the things we need to think about in the near future. The other part of it, if you can see, the community of the neurodivergence is growing. This is what we need to support. We need to help, grow. And a lot of people, when I was reading through the chat box earlier, there's a lot of people were saying, I think humans are evolving towards the all ADHD kind of a concept. I was reading through the whole chat box from the morning itself, and it was really good to see, these interactions between all of us over here. So it's wonderful to see here, Shah. That's one thing I'm always passionate about. You can go to the next slide then.
So over to you to explain this.
So the all ADHD part, as I mentioned earlier, it's not a formal recognition. I don't want anyone to get confused over here. It's not a formal recognition. It's not a formal diagnosis by the DSM-5 ICD-10 and 11, but it's agreed upon by consultant psychiatrists. It's agreed upon various MDTs alongside neurodivergent communities as well, reflecting the experience of each other, right? Now, we'll discuss a little bit about the clinical recognition, the clinical utilities concept here. All ADHD presents a very significant challenge here. I'm going to give you a very clear example, right? So what happens is that when you go for an ADHD assessment, what happens is that you'll discuss with the consultant very, very focused in regards to the ADHD, and you will try to present so much more in regards to ADHD, but forgetting all the other parts of the autism you are actually struggling with. So I always mention the differential diagnosis must be there in terms, any captures, anything, the consultant sees that it might reflect autism. That's something which we need to look into very, very clearly as well. And the other part, language use, which is very, very important over here. Identity, the first language. What we say, being autistic and having ADHD creates a unique challenge. The terms, when we discuss with people as well, we discuss with people around us, our neurodivergent communities and everything of those, we need to emphasize the importance. ADHDers, keep things a little bit more mellow. Autism kind of a concept, just keep things mellow. You don't have to identify someone to an extent in such a way and label them. It's just more of a language used to help each individual sustain the growth. Then we move on to the next one. We're going to talk a little bit more about the global prevalence of all ADHD. This is a combination ADHD and ASD, which there's lots of research has been completed. ADHD co-occurs nearly 1/3 of the autistic kids and remain undiagnosed in girls in a very significant amount. Now, if you look on the slide over here, you can see 32.8% ADHD in autism. Now you see a sub-threshold of ADHD in autism. Then you see autism in ADHD. Do you know how it's now reversing things? In the sense that, if you go for a clinical presentation of ADHD, how many of them get picked up with the autism component over here? If you go for an autistic presentation, how many of them get picked up in the ADHD component here? It's very, very important to understand this, especially as research grows in regards to all ADHD over here. Next slide, Sean. Now, this is the interesting part. We're all based in the UK, and one of the major things, we wanted to discuss a little bit more about, the chair of the Royal College in the Southwest position over here. We need to make sure that there are sufficient support in regards to all of this prevalence as well. We need to verify this data. We need to understand what's been going on over here. If you look into this, right, ADHD rose from 4.7% to 6.4% in learning disability groups and 0.4% to 0.6% in general population. I know there's a huge cry all over, Instagram, social media. Me and Shai have discussions almost every single day at night, about 9 to 10 o'clock, just reading through a lot of Instagram, social media, Twitters, and how else we can help them as well. Are we being overdiagnosed? No, that's not. Number one, I told you very earlier, right, is the awareness. We become much more aware of ourselves. We become much more aware of our surroundings. We become much more compassionate and understanding towards other people who actually struggles, if the word they want to use struggles, or, have all ADHD or ASD and ADHD combination together. Then we look into the other part of it, right, the increase from 18.4% to 24.8% in autism in learning disability groups. And the prevalence of autism remains stagnant. There's something very surprising over here. Why is it remaining stagnant? What's been going on? The criteria has been relaxed a little bit more. We have more understanding, more awareness. The thing that the stigma is still there. People are worried to get the diagnosis. It's not, I'm not saying it sounds fancy, but it sounds, oh my God, I've got autistic spectrum disorder. It's much more difficult to appreciate and understand. But don't be just worried about the label. We are here to support every single individual. Next one, slide.
So I'm just going to talk about the co-occurrence statistics. Around 3 in 10 autistic adults also meet the diagnostic criteria for ADHD. And estimates indicate that between 20 to 50%, so up to half of adults diagnosed with ADHD also meet the criteria for autism or present with significant autistic traits that might be sub-threshold as well. So there's a lot of underdiagnosis challenges. Only 15.8% of those with co-occurring autism and ADHD have been previously diagnosed. So that highlights significant gaps in identification and clinical recognition, at least across the UK healthcare systems. There's also a lot of service demand. So ADHD-related NHS online resources were the second most viewed in 2023, with 4.3 million visits. That reflects an increased public awareness and that there's a growing demand for diagnosis and support services. But there are marked disparities in diagnosis rates and waiting times across England's regions, with some areas experiencing delays that are beyond acceptable standards. Over to you, sir.
Now, you see, the UK diagnostic trends, there's growing diagnosis rate reflecting on the improved awareness, as I mentioned earlier, and the service demand. We are placing a huge service demand at this point of time, which is actually quite taxing for the entire country as well. But it still remains undiagnosed. It still remains significantly undiagnosed, especially for the adults above the age of 50. I'm going to give you an example over here, right? The reason lots of us above the age of 50 kind of have this feeling, you know what, I've lived my life through the entire struggles, so you know what, I'm not going to do anything much about it. This is my life now. No, that's not the way to think. The way to think is that, what are my struggles in the past? Does it reflect any mental health disorder? Does it reflect autism? Does it reflect ADHD, or maybe a combination of both? That validation is extremely important. And you say 50 is very, very young. I would say 50 is young. If not, I'll be looking very old after that. So I just want to make sure 50 is very young for everyone. We need to progress. We need to understand at 50 years old, even though you're going to be diagnosed now, how are you changing your environments? How are you changing yourself? How are things going to improve for you? We need everyone to come on a level playing field rather than giving a particular person a better playing field comparatively to the other. Support needs to be there for everyone who requires it at this point of time. Over to you, Sean.
So this is a very interesting concept around masking. And we've used the term high IQ, and I know that might sound a bit controversial, but when we say high IQ, we're talking in a medical sense here, right? So the paradox of high IQ masking. So individuals with high IQ often develop sophisticated coping strategies that hide neurodivergent traits. And that masking actually delays the recognition of ADHD symptoms. That complicates diagnosis and it delays access to support. And that I've seen, well, Sai has seen as well, is probably more common in women than men. High cognitive ability means that you use problem solving and social mimicry to navigate challenging situations. But those compensation strategies, whilst they might be temporarily adaptive, they lead to exhaustion and overlooked difficulties. That eventually leads to emotional overwhelm and burnout. And particularly, as Sai mentioned, when you reach a certain age where you're going towards perimenopause and menopause, there's an interplay with sex hormones in females. And that makes that emotional overwhelm a lot more pronounced. There's a concept called the twice exceptional concept. That refers to gifted individuals who are also neurodivergent. They exhibit both advanced intellectual strengths and ADHD-related challenges that need a tailored assessment and intervention approaches. The AQ50 and the AQ10, which are common autism screening tools, might be less useful in patients, particularly female with high IQ, potentially. And ADOS does not capture cultural differences, which is what Sy had mentioned earlier. So this type of assessment needs a lot of clinical experience and expertise. Masking what do we mean by masking? So masking involves consciously or unconsciously suppressing your neurodivergent behaviors to conform to social norms, to try and avoid stigma or exclusion. That causes social camouflaging. So individuals use learned social behaviors and mimicry to appear neurotypical, hiding traits such as inattentiveness or social awkwardness in everyday interaction. There's a level of cognitive compensation. So high intelligence allows the development of coping strategies that mask your challenges, such as using advanced problem solving to manage your attention difficulties. And then over time, that just depletes your energy. Sustained marking it requires so much mental effort, it leads to exhaustion, burnout, and delayed recognition of your needs. And I hear so many patients come to me saying they feel completely overwhelmed and burnt out. Over to you, Sam.
And now let's talk about gender and masking in female presentation. Internalization is one of the most things which affects females over here with all ADHD, exhibiting, emotional dysregulation traits, inattentiveness, anxiety rather than overt hyperactiveness, making symptoms always less visible. This is the other part where the cross-cultural context comes into the picture as well. Having worked in two different continents, and this is what we tend to look into much more when we take it into the fact of the Asian community kind of a concept over here. What happens is that we tend to have lots of somatic symptoms, which basically means headache, giddiness, nausea, kind of a consistent effects rather than the inattentive component over here. Alongside that as well, looking into someone in the eyes, kind of a concept over here in an Asian community, is completely different. It's extremely different. It's much more rude to look into someone in the eye, especially someone who's older to you as well. And you always place your head down and you bow yourself and you walk. Different contexts, different cultures, Japanese, the Asians, in terms of the Chinese and the Indians, and you've got lots of different variations of cultural difference. So we need to be very, very mindful about this as well. And then, in the British culture as well, in the entire population of the Western culture, lots of things have been internalized very, very clearly. Social mimicry, what happens is that, when you're younger, you always feel the fact that, oh my God, I'm looking at someone else at the moment now. I'm trying to observe their behaviors and I'm trying to make sure that, everything works out well so that I make friends with other people. So you are employing things like you are imitating other people, masking all of those things as well. Then we look into perfectionism and pressure. Just imagine this, right? In your mind, you want to do every single thing in a very particular order or in a perfect condition, but you're unable to do it. There's so many things rushing through your mind at one point of time, and you automatically struggle to articulate your thoughts. You think, it's better to give up at times. Then burnout comes into the picture. Lots of this we need to discuss very, very clearly. Then the delayed diagnosis. We have kept this so long, so far, and it masks us a lot. The ADHD component, one of the differential diagnoses is bipolar. Right, the ASD component, the different diagnoses can be anxiety, depression as well. Lots of personality disorder comes into the ASD component as well. So all of this needs to be understood very clearly, and that's why you need very thorough history and someone who's on a specialist level to do this for you as well. And back over to you.
So what are the consequences of masking? So Well, as you mentioned, immediate exhaustion, so constantly suppressing natural behaviors that consumes immense energy, leads to chronic fatigue. So you get patients that get diagnosed with chronic fatigue syndrome, emotional depletion, confusion of your sort of identity in some sense. So prolonged masking blurs self-perception, causes uncertainty about what your true authentic identity is, and that increases psychological distress. Because you're masking, you might delay access to support, so that can result in either late diagnoses or, in some ways, even worse, misdiagnoses, in my opinion, which might even lead to the wrong intervention, let alone delay intervention. Um, and then the long-term impact is that eventually, if you're feeling burnt out for long periods of time and anxious, etc., you become depressed. That can have impacts on your relationships because of due to sustained emotional strain and feeling isolated even within a relationship because the other person just may not understand this. In terms of differential diagnosis and the challenges, autism and ADHD share symptoms such as attention difficulties, executive dysfunction, social challenges. That complicates a clear diagnostic separation. And that was the reason, I mean, why I think Sai and I are mentioning about having, you really got to see someone that has quite a level of expertise and knowledge of both and how they look together. High IQ and giftedness can mask neurodivergent traits, leading to under recognition or misattribution of symptoms to talent rather than a condition. Mood disorder confusion, emotional dysregulation, and internalizing symptoms look like other mood disorders or other anxiety disorders. And then that complicates the diagnosis. People get put onto potentially the wrong treatment. There's a concept of single diagnosis bias. It's clinicians. Some clinicians might focus on one diagnosis because it's easy just to put things in one box for people, but they miss the comorbid presentation, and the comorbid presentation can look a little bit different. So that results in incomplete treatment and support plans, and that's why at our clinic, Sai does the sort of comprehensive assessment, which is a combined assessment of ADHD and autism together to look at the traits when they're within the same individual.
Now, we're going to distinguish, all ADHD from autism alone, and then later on with ADHD alone, right? Autism characteristics. I was telling Shai about this, and Shai knows this very well. I wanted to give everyone here an example, of routines, repetition, behaviors, kind of a concept over here, right? Okay. Every day I wake up at 7 o'clock in the morning, not 7:01, not 6:59, right? I wake up at 7, walk into the toilet, brush my teeth from left to right, top to bottom, 2 minutes on top, 2 minutes on the bottom. I only use Oral-B toothbrush and toothpaste. As I said, I'm not here to actually do brand loyalty for Oral-B. No one is paying me any money in regards to this, but I just want to make sure that you guys understand, when we say routines, repetition, behaviors, and what we are looking into as well. That walking to the shower gels in my hands, divided into 4. Each segment of my hair has the shower gels, wash from top to bottom, left to right. Walk out, dry myself. My clothes are all aligned to an extent where short sleeves to long sleeve, left to right, lighter colors to darker colors, left to right. Right. I've already pre-planned what I'm wearing the night before. And Shai always tells me the same thing. Sai, your food, your food. What's wrong with your food? And I was like, but I know that I'm Asian. I know that I'm Asian. I know my mom tells me, son, you have to like curries, but no, I don't like curries. I love my Sunday roast. I love my Sunday roast, so I love my pork cracklings and everything of those. What happens over here is that I start with the least favorite food and then moving on to the most favorite food. I have a very specific order of things which I eat at this point of time as well. So basically meaning that, I start with my vegetables and then my stuffing, my Yorkshire, my meat, and then finally the pork cracklings as well. My books are all aligned to an extent with alphabetical orders, authors' surnames. Do you see kind of a criteria, kind of a thing moving on to your mind in terms of the autism part of it? Deep special focus. If you ask me anything about Pokemon cards, I can give it to you straight away over there. I've got collections of Pokemon cards still back in Malaysia with my mom as well. So a lots of things I have, hypersensitivity kind of a concept. The social withdrawal. A lot of people feel that social withdrawal basically means that, you withdraw yourself from every single individual. No. That's social isolation. That's the important part of it. You want to try to make friends. You want to try to do things with others, but you feel that I can't. It's best not to, because people misinterpret what I'm trying to say. People tend to do a lot of other things, and I don't want to end up in a fight. I don't want confrontation. It's best for me to be alone. That is the part which we get a little bit more worried about here, right? Now, the all ADHD unique features, the internal conflict, between us. I'm going to take you through something now, right? I have planned my routines. I want to do it, but I can't do it. But if I do it, I thrive really, really well. But I just can't do it. That mental exhaustion comes into the picture as well. And the paradoxical effect of, hyper focus. Once I sit down on something, I can complete the task. But after 3-4 days of my hobbies, I'm going to move to a different task and move to a different task. Your ADHD combination with your autism over there, hyper focus, go ahead. Spend quite a significant amount of money for the hobbies and everything. Alongside myself, spend a lot of money on Pokemon cards, Magic the Gatherings, all of those, Dungeons and Dragons as well. And then we move towards a lot of other things as well. That desire of social connection. I can rock up to Shai and say, Shai, hello there. And then I'm just stuck. Nothing is flowing out from my mouth. I'm hoping that Shai will say something, but he stood there alongside me as well, thinking not to say anything as well. So those are the things we tend to look very, very clearly in regards to this. And the emotional, rapid response in your mood changes. Very, very often, what this can happen is that they can mimic the mania depression kind of a concept. Your mood fluctuates very quickly at times as well. So you need to be very, very mindful. It's the way you present yourself, it's the way you speak on your symptoms will determine what's going to happen after this. So you need someone very, very focused on this to understand yourself as well here. So next thing, we move on to the all ADHD and ADHD alone, right? The marked hyperactivities, the motor restlessness. I used to remember, as I said, I'm able to bring cross-cultural things into the picture. I used to fidget quite a lot. And you can see now I'm standing with you guys, and Shai is very relaxed over there and having a conversation. I'm standing over here and I'm trying to have a conversation with lots of, hand gestures. I used to be younger, and mom used to say, son, why are you fidgeting? The ruler. No safeguarding against my mom. I love my mom. The ruler comes into the picture and snap on my hands. Okay, so now I learn I shouldn't be fidgeting. So I stop myself. And then I have this inner restlessness keep going on in regards to that. Those are the things which you tend to look to. The impulsive behavior, reckless driving, gambling, excessive drinking of alcohol, drugs, those kind of things takes into the picture. The attention span tends to stop at a picture. I want you to think this, if you have a pen, one tip pen, it's easy for you to write your whole thoughts of it. Just imagine you have 5 different colors, it works really well, but you struggle to actually click it one by one. You tend to move it all 5 together down. So you get stuck and your mind is just so muddled. It's like, no, I've got lots of things I want to explain, but I can't explain. So that's what we're talking about. You get stuck over here. Now, the presence of stimming behaviors, beyond just the simple fidgeting, it's more of the rocking behaviors, your hand tapping, your skin picking, your biting, your chewing, all of those comes into picture as well. As I said to you earlier as well, the internal conflicts of the routines and the novelty seeking kind of a concept over here. Strong pattern recognition. I don't know how many of you guys in the past when you were younger has done this. I know I've done it. I'm not sure Shai has done it before. I've never asked him, but when you have a pavement, you have the tiles, you should always think, oh, I should jump on the first tile to the next tile without crossing the cracks on the one. And someone will say, is this superstitious? What's going on here? Lots of pattern recognition, volumes, your pattern of volumes as well on the TV. You need to have even numbers or something on those lines, or even odd numbers kind of things. You see things in a very pattern organized manner as well. Those are the things we need to take into account as well, Shai. Next one, Shai.
Sorry, over to you.
Yeah. So what happens in this comprehensive assessment approach? spending time with the patient is very, very important. Spending time with the client, spending time with the service users, spending time with the patient, right? Very important. Developmental history plays a huge, crucial part of the assessment here. What happens is that we need to understand, because it's a childhood pervasive developmental disorder, so we need to understand more in regards to this. So if you can't get family members to help you in regards to that, developmental path when you were younger until your teen years, you would have had one best friend when you were younger. Try reaching out to them. Try reaching out to them and see, any possibility if you could recall a little bit more about myself when I was younger. You don't have to ask them to fill up the forms if they don't want to. It's going to be more taxing for them as well. But you can just ask them questions. This was what happened when I was younger. How do you resonate? What was going on there? As long as you have some kind of informant's report, someone who knows you long enough, kind of. If you ask me, I think more than 5 years is good enough, to be honest with you, right? To understand yourself. But I'm not going to say that we're going to make a cutoff point at the moment now. But what I'm saying that for me, for Shai, we understood 5 years, and a lot of other consultants, we appreciate 5 years kind of a process here. Then the cognitive testings, Shai mentioned this very, very clearly. The high intellectual, the highly functional individuals, right? The cognitive pathway processes. We need to understand that the ways for kind of a concept to assess your intellectual capacity to a point where we understand that you're extremely gifted. If you're talking about Einstein, you're talking about, people, Galileo, and every one of those, if you think about it, do they have autism or not? Do they have ADHD or not? They were so focused on their jobs. They could go over and over and over in regards to the same thing as well. So what we are trying to do now here is that, the entire public, the entire clinician society as well, what we're trying to do is that understand the capacity, understand the functional levels, understand the intellectual levels, and then guide through the entire assessment approach, which is very important. This is what we call individual assessment. We're not giving a generic assessment to everyone. And then we have the observational behaviors over here as well. The consultants and alongside yourself, discussing about, what's the struggles. We're looking into the similarity in what you have filled up in the report and what you're presenting at the moment now, picking up the mental states as well, understanding, because a lot of things can mimic physical health as well. We need to get those physical health pathways. I don't want everyone to start focusing that, if I'm running towards this, it's only going to be ADHD and ASD. We need to think about the physical health. It needs to have differential diagnosis very, very clearly over here as well. We use a specialized tool. As I said, earlier, I think Shai and I discussed a little bit more of the ADOS, ADIR concept. I know that it's a gold standard tool. I understand that. But you see, this was developed way, way long ago. There are lots of cultural differences was not taken into account. What about the gender pathways here as well? I'm not saying that it's not a gold standard. I'm saying it's still the gold standard, but adjustment needs to be made. Clinician base needs to take proceeds in this. Very, very important. We need to make sure that the clinician is able to make that judgment, make that decision, right? I'm not saying solely with the clinician's judgment, but I'm saying the additional help can be present, but the clinician needs to make the alternative kind of decision making over here, right? Then, next one.
So, medication considerations. So, obviously, stimulant medications, methylphenidate has been regarded as first line of treatment, showing about 70% favorable response. Amphetamine-based stimulants offer an alternative stimulant option, but they have varied effectiveness actually in ADHD. So that's an interesting difference. Non-stimulant options like atomoxetine, guanfacine, clonidine are used when stimulants are contraindicated or poorly tolerated. I will add one note to that bit of the slide that actually non-stimulants can be quite effective with emotional dysregulation as well, maybe even more so than stimulants actually. Stimulants may actually have reduced effectiveness in autism compared to ADHD only cases. We have to be careful for monitoring for side effects. People with sort of comorbid autism can be far more sensitive to side effects of these medications. So you have to do a very gradual titration. And then usual side effects of these meds are things like appetite loss, sleep disturbance, and mood changes. So you have to have really sort of quite expertise when you're managing that type of titration of medication. ASD traits can become more pronounced. If you're medicating someone who's got both autism and ADHD and you take away the ADHD, the ASD starts looking more prominent. Sensory sensitivity can increase with treatment. Hyperfocus can become more prominent. They may become more inflexible and more introverted. Executive function will improve. So, as I say, it does need senior expertise to titrate meds in such cases. Antidepressant considerations. So, SSRIs are common antidepressants that are used. They increase serotonin levels. So fluoxetine, or what was famously, manufacturer Prozac, was probably the most studied SSRI in autism, and it was often prescribed for anxiety and low mood. Sertraline is favored for fewer drug interactions, while citalopram and escitalopram are less commonly used. Hi, are you guys still there? Oh, okay, I think we're back. I hope everyone can still.
Yeah,
You're back. That was a problem
back.
this end. You're back. Apologies.
Right. That's all right. So there we are. Okay, so SSRIs show actually limited effectiveness for core repetitive behaviors or attention symptoms in ADHD. Their primary use is to manage co-occurring anxiety and depression. And a lot of the research suggests that there's minimal benefit for autism-specific repetitive behaviors. And actually, if your anxiety and depression is coming from your neurodivergence, that may also improve with ADHD or certain types of medication. Side effects of SSRIs, increased agitation in this type of patient. Suicidal ideation can increase, and that needs close monitoring. And SSRIs can also cause gut upset. So a careful risk-benefit analysis is essential. And you need a lot of expertise, especially when you're combining stimulants, for example, with antipsychotics or mood stabilizers. Polypharmacy challenges. So polypharmacy means when you have multiple medications on board, patients with ADHD often receive combinations, or they've been misdiagnosed, or maybe on lots of different treatments. So polypharmacy can increase the risk of drug interactions, additive side effects. So there's a constant need for regular review and ongoing assessment by a really experienced expert to manage the treatment of this type of patient. Sai, I think you want to do this one?
Yep. I'm doing the future research. As we start off the whole conversation today, we understood that, we are still in an infancy stage at the moment now, right? Like, just taking, for example, we are still like the pre-DSM kind of a concept in terms of the all ADHD component over here, right? So there's lots of things needs to be developed at the moment now. There's lots of comorbidities we need to think about as well, right? We can look into lots of comorbidities like, for example, dyspraxia, all of those needs to be, placed in a significant amount of research over here. You need to understand, hypermobility, lots of Ehlers-Danlos syndrome. There's all the comorbidity comes into place. So clinical treatment and research is very, very important here, especially in the pharmaceutical side of things, and alongside, the psychological support as well, the ADHD coaching, the psychotherapy, which, acceptance, commitment therapy, we're looking at the CBT kind of a focus all over here, right? Just more in regards to just a few more here. Diagnostic tools need to change. We can't be fixated with what we've had in the past and continue using them. We need to have more in-depth, adapted diagnostic tools as well. Most importantly, what we want to do here. We want a better outcome for everyone. We want to measure the quality of life. We want to make everyone progress, thrive. That's the most important thing we want to do at the moment now. It's creating awareness, validating your feelings. Those are the things which is extremely important. Signposting you to the right resources which is going to be provided. Those are the things everyone needs to share and understand. That's the main thing we want to do as clinician. Comparatively everywhere in the UK, the clinician in terms of ADHD, autism, combo, what we want to do is that we want to make sure that all of us thrive in this population, kind of a general concept, not having stigmatization between one and another over here. Shai?
So clinical assessment protocol that we use at the ADHD Health Clinic. Look, there's a lot on this slide and I am conscious of time, so I'm going to summarize a little bit here. The first step is screening. So, we want to we have developmental screening reports for children's, particularly we're talking here teacher and parent rating scales, medical and family history summary. We're just information gathering initially. The next step is evaluation. So particularly the combined assessment that Sai does is a very detailed assessment. It takes 2 to 2.5 hours. It's a full cognitive assessment, structured interview, but Sai will not just look at ADHD and autism, how it impacts you. Have you have any other potential mental health conditions going on? The next phase is data integration. So considering other differential diagnostics, looking at the person as an individual, looking at their strengths, and they're also their challenges, and tailoring intervention to that patient. And that's the important bit. And then the last stage, of course, is feedback and planning. So obviously providing a comprehensive report for a patient to look back on, but also collaborative treatment planning, which might involve even other healthcare professionals as well, and ongoing monitoring for you. So especially if you put on things like medication, the ongoing reviews of that as well is very important. So sort of the key sort of takeaways, ADHD is not currently in the diagnostic classification, but we in the industry certainly recognize this condition. So early identification and tailored support does lead to better outcomes, as you would expect. Complex presentations do require personalized approaches. We emphasize collaboration. Successful management depends on strong partnerships amongst families, healthcare providers, educators, other community organizations. Sharing knowledges and resources fosters understanding and it reduces stigma. And finally, I think senior expertise is needed with this, particularly this type of patient. And it does require skilled and senior expertise due to, well, first of all, to understand other comorbid conditions, so you can even recognize this, and due to the risk of adverse outcomes when prescribing medication, so having the knowledge of that and what to look out for. And just to end off, as mentioned earlier, we are the ADHD Health Clinic, so we provide online ADHD assessments, autism assessments, and Sai in particular does this combined online autism and ADHD assessments for adults. And in the next month, we'll be doing children's services as well. Thanks a lot.
Thank you, everyone. Hopefully you enjoyed it. Thank you.
Thank you. I did. Well, I've seen lots of comments in the chat from people who clearly
I saw that as well.
have enjoyed it and have found it very. We actually don't get all the comments. So some of the comments, for example, from Instagram don't come through, and I've seen some really interesting things said. So it's clearly resonating with people. It's clearly a big deal, and I can't thank you enough for doing it. And obviously, we lean on your expertise all the time, and shine the deep dives, and actually more than that, when we have people coming to us with additional problems or questions or needs, we go to him and he helps us, and it's actually an extremely big deal that he does that, and he gives that time all for free, and donating it to help people understand ADHD and Autism, and it's absolutely fantastic. And Sai, I can't thank you enough. You're both wonderful. I genuinely really love that and I always love the lived experience when you're talking about your setup, Sai, at home, and it's actually it'll be inspiration. It will be inspirational for many people. Going, he's a doctor, he's succeeding, and he's like also open about his autism and how it's impacting him. And that's actually a big deal. Like, and people don't hear that, so thank you. I've got to jump. I'd love to chit chat forever and ever. I've got to jump. Apologies for everyone, especially Science Shy on the ident suddenly appearing. No, it was a really powerful. Thank you very much. We'll say goodbye.
Thank you.
Goodbye. We've now got Siri coming in, and she is absolutely fantastic and an extraordinarily interesting person, and an inspiration, particularly to me. She is doing incredible work in Wales for neurodivergent people, and she's the founder of Parents' Voice in Wales. I see she's the co-chair of the Welsh Government's Developmental Ministerial Advisory Group. She's an ADHD trainer, and she undertakes co-production with the NHS Governmental Neurodevelopmental Services in Wales, and much more. She's kindly, generously brought her time in because to tell us more about what's happening in Wales as we look at the United Kingdom as a whole, and it's very important. Then after that, and waiting in the wings, we've got the absolutely extraordinary Bill Morgan, who's previously number 10 Downing Street advisor, and I'll talk more about all of his experience, but talking about what it's like on the inside and how to make change. And then we've got Ben Branson, celebrity guest inspiration, a guy with ADHD and autism, who created the Seedlip non-alcoholic sort of spirit style drink, sold it to Diageo, and he's that sort of inspirational entrepreneur figure, and has since founded a charity on neurodivergent. So very excited for him. Apologies for running a little bit late. That's it. And Seri, hi.
Hi there. Hi. How are you?
And just enjoying the conference. If I'm honest, like it's.
Yes, absolutely brilliant, Henry. Thoroughly enjoying it.
Got to get right into it. Like, well, it's you would when I first introduced you, and you told me all you've achieved. I was just gobsmacked. I thought it's so impressive, and the lessons we have to learn.
Wow.
It's a question we get asked a lot, and we get ambassadors, ADHD ambassadors. One of the things we want to help them do is get involved. So how did you get involved? Like, what is Parents' Voice, CIC? What's the Neurodivergence Ministerial Advisory Group? Like, it's sort of the how and the what. How do you get there? What do you do?
Well, thank you for that. And I'm absolutely delighted to be here. So in true Welsh style, Bore da pawb. Good morning, everybody. Just to say, we were established in 2018 through my own lived experience of the frustrations, I guess, of the medical model for my own neurodivergent children, and how we couldn't get access to support because they weren't failing enough. And of course, like many neurodivergent families, we found that emotional-based school avoidance, mental health crisis had to be kind of reached before you could access any support. And I was hugely frustrated by that because again, like many other parents, I had to give up my career. There was a loss of income because I had to stay at home, look after my child. So lots of frustration there, which I decided to make a change, not knowing, what I could do. I didn't even know where to start. But I decided that I was isolated as a family in terms of people understanding our needs. And so I wanted other parents to have that support and to have a kind of community where we could help each other accessing additional learning needs. We call it ALN in Wales now, ALN support. And that led to the setting of Parents' Voices in Wales. But I was also, it's an online community. We've got over 1,500, much more than that actually, families across Wales, the whole of Wales, that are online. And we also sponsor other parent groups for that face-to-face peer mentoring groups in Wales. So we want to empower other groups across Wales, not just kind of keep that seat for ourselves. In about 2018, when we first were established, I wanted to understand how many children were on the CAMHS waiting list in Wales, because I couldn't understand why my son had to hit a mental health crisis to get help from the primary school. And that showed that about over 50% of children on the CAMHS waiting list in Wales were neurodivergent, either seeking assessment or just identifying as ND. Now, Dr. Tony Lloyd of the ADHD Foundation said to me, look, let's do that again, and let's do it on a much more kind of glossy, bigger scale. So we did it again, and the percentages that we had, I think it was at 1,200 families participated, 900 were viable, and which showed that 65% of children in Wales were on the ND waiting list. So I took that to the Lynn Neagle, who's our education minister now, but I took that to the Senedd Committee of Children and Young People in Wales and said, look at this data, why we don't have an early help model. And Lynn Neagle, who was the chair of that committee, then said, well, have you heard of the Mind Over Matter report? This is about children, the missing middle children. And she said it's about children who don't meet the threshold for either ND assessment or for children that don't meet the threshold who aren't severe enough, if you like, in that medical model to access CAMHS. And that Mind Over Matter report was the start of the whole school approach in Wales. Simultaneously, I went to the Children's Commissioner for Wales, and who was then Professor Sally Holland, and I said, look at this data, why are we not don't have an early help needs-led approach in Wales? Why are we have thresholds and people have to hit crisis? And she said, well, funnily enough, I'm writing a report called the No Wrong Door approach. And that No Wrong Door approach is about families not hunting down services, where services come around the families and provide holistic needs for those children. That report was fundamental to the whole system approach in Wales, which is the NEST framework. And Parents' Voices in Wales was invited, because of our understanding of that need of early help, was invited to co-produce that framework. So that put us on that stage of collaboration, of understanding the direction of travel in Wales for that early help needs-led approach. And it allowed us to build our network across sector. So not only from communities, but also to specialist services and into the school communities. And that's become fundamental to success of us, really, in our ability to bring everybody together so that we can have that whole system direction of travel. And it's been fundamental for the Neurodivergence Improvement Programme, which is the NEST framework, whole system approach, but focusing on ND families and how we can meet the needs of children and young people early in our schools.
Thank you. And that sort of core point of we have data to prove the point. So it's not just anecdotal stories.
Yeah.
I think one of the challenges we can sometimes find is people know it. We see it as a charity, as an individual. It's very clear to us. But when you're going to talk to a politician, they're hearing stories all the time, and actually they can't quite work out what's a story and something that's important to an individual, and what's a systemic issue that they need to grasp in a different way, and that gets conflated with effective campaigns. You know, you've got a good campaign going, like, so the parliamentarians, the Senate, they're seeing these things, but they still don't know, like, is it a campaign or is it a truth of numbers? And so you going with that idea of data and collaboration. So here's the data, it proves the point, and then working to collaborate with people is an incredibly effective and important.
Thank you. Thank you, Henry. And I think it is a fresh approach, because historically we've always looked retrospectively and complained about what's wrong and what doesn't work. We all know, everybody who's attending this conference knows what doesn't work. What we need to be doing is flipping that narrative and saying, this is the evidence now. This is what works well. We've got evidence for what works well. This is the benchmark that we want you to reach. And that is why the NEST framework and the ND improvement programme in Wales is so important, because it's about health boards mentoring each other. It's about, instead of working, competitively, it's about that shared culture across that whole system. And that comes from forward thinking, innovation and development, and being community led. So the voices of these parents and families with lived experience of what doesn't work, but also what does work, to come and have a seat at the table so that we can together collaboratively support that
And do you
cultural
have
shift.
measures of success? Like something I'm worried about right now, and we've got a big discussion around SEND in England, is that the interventions going on actually do work, but what's going to get replaced, we don't know, but there's a good chance it doesn't have an evidence base.
I think the key is that everybody in the room, first of all, is willing to build relationships across that system and doesn't want to work in a silo. Because if you're going to work in a silo, you're not going to meet the holistic needs of a child, social, emotional, and educational needs. So that requires a whole system approach. Because when a child is failing and a family is struggling, it's a whole system crisis, right? So it needs everybody to build those and be willing to build those relationships and to offer seats to that whole system in their communities. It starts in the community. It starts with an understanding about neurodiversity. We must not make assumptions that we know. We don't know what we don't know. And that goes for everybody working in every discipline. We don't know what we don't know. And in the training that I do, the response is always, everybody needs to hear this. Everybody needs to hear this. And so it's about sharing that knowledge base, coming from a lived experience as a woman with ADHD as well. My story is very similar to a lot of children and families that I deal with. So it is about educating the educators, but also...
And it's a testament to you that you're having those conversations and making them
Thank you.
happen. I'm mindful of time. What are your, when you look to the future, what are your fears? What are your aspirations?
My aspirations, I'm not going to go with fears because I think that that's a barrier and it can hold us back. My aspirations are that we are able to work, but address the power imbalance as parents and carers, as experts in our children, that we are able to have a seat at the table and work more cohesively with schools and services, which we are. We've got a great model happening across Wales, and I'm going to give a shout out to an Iron Bevan Health Board right now and Powys Teaching Health Board, where we're doing some co-production and some fantastic models of community-led approaches and designing services to meet the needs of local families. And that comes from a shared language, a shared understanding and a shared vision. And it means that everyone has to be brave and to have conversations and self-reflection. But ultimately, it comes down to relationships, because without relationships, you can't have a dialogue. And without a dialogue, we can't meet the needs of children and young people.
I'm bowled over by you, Sarah. I think you're amazing. I think what you've achieved is extraordinary. If you look at what's happening in Wales around neurodiversity, it's in many cases it's ahead of England and the other developed nations, and is leading that way. So I think that's one of the reasons that Anita Tarpar was appointed head of the NHS task force for NHS England, was actually on the back of the success that the changes she pushed through in Wales. Obviously, England very different, some very significant differences, and but it does show, what has been done in Wales. I have to say goodbye to you. I'm very sorry.
No,
thank you so much. I look forward to our ongoing conversations. I think you're an extraordinary person. I think what you've achieved and put together, which you make it sound very simple, and I know how hard you've worked at it and how many people you've got involved, and it's very special. So thank you very much. I must bid you adieu. Thank you, Siri. And right. One of the reasons we're out of time is squeezing in Bill, and we changed the schedule to include him. So anyone who was good at spotting and looking at the schedule will notice it changed, and that's because we very kindly Bill is here to speak to us, and then followed by our sort of celebrity and inspiration, Ben Branson, and we're just extraordinarily excited, and then following that by seeing ourselves clearly, and the transformative power of community with Kay Hayes. Very, very exciting indeed. This is the section I have been hugely looking forward to. I'm going to say lots of nice things about you, Bill. Welcome, Bill.
Hi, Henry. Hi, everyone.
Right, look, together we are campaigning for positive change for neurodivergent people, and that's across the ADHD community. Bill Morgan's involved and is working with NHS Right to Choose provider Paloma Health, who supported him being here, so thank you. We know that we have to get, we're making noise for change, but you need to make noise that actually gets noticed by those in power. And something that's a huge campaign for us. The biggest thing, we've worked on it for months, maybe built it from years. Its research was commissioned a long time ago, and we're coming to this enormous volcanic crescendo in our own world. And in number 10 Downing Street, it's just a normal Tuesday, and it's just the thing that one of many that have just landed and is going to get dealt with. And it's a completely different perspective. And if we don't understand it, we're not going to be able to get change. And this session is about looking at that. He's going to be talking about the current political situation around ADHD and ASD, what the government's thinking, what happens next, how can patients and providers shape what happens next. He has advised prime ministers, health ministers, policymakers, world-leading life science people, now you and me. And prior to that, he's worked at the highest level of the Department of Health and Social Care. He was a special advisor at number 10 Downing Street there, and to Rishi Sunak. He's also a lecturer in health policy. There's obviously a lot more on his achievement list. I think we can just all agree Bill's serious. Over to you, Bill.
Hopefully, yes. Well, I feel like I'm sandwiched between two very inspirational speakers, so I'll do my best to be as useful. But yeah, I guess just by way of some opening reflections. Number 10 is an interesting place to work because you tend to be firefighting most of the time. So you tend to go into work, and the first sort of 75% of your day is spent dealing with whatever's in the newspapers that morning in your area. So in my case, it was health, and you don't really have much time to do long-term sort of strategic thinking in number 10. You leave a lot of that to the government departments. And what I'd say about ADHD, autism services is it's an area which is very visible to number 10. So half your battle is already won because it appears in the education sector, it appears in welfare, it appears in health. So there's lots of people in number 10 who all cover different areas who are worried about ADHD and autism and meeting demand. So that's half the battle won. But what people in number 10 don't have, and they can't push departments on, is how to solve the problems that they're facing. These huge increases in demand, these constraints in supply. And in a way, the job of campaigners is not just to raise the visibility of the issues, because it's already very visible in number 10. And Henry, you and your colleagues have been doing great work in Parliament as well to raise the visibility of the challenge. It's about coming up with some solutions that policymakers can implement, because trust me, in number 10 you're hit with problems all the time, and what you really need is solutions. So that's what I'd implore everyone to be thinking about.
When I've met with political individuals before, and I got a piece of advice which said solutions are only part of the key. He said, like, the basic thing that happens from charities and pressure groups is they just say, here's the problem, which exactly as you say, you go, well, like, I'm very rushed for probably like I don't have this, what am I going to do with this? Better charities come with the problem and the solution, and the really good charities and pressure groups come with the problem and a clear problem, clear solution, and they understand the blocks in the way, and then they go after the blocks as well as advocating for their solution. What do you think are the blocks in the way for ADHD and ASD, and particularly around waiting times right now?
Yeah, okay. I mean, just to add a few thoughts on that point about the best charities are those who propose for solutions and understand the
That'd be
block. So,
great.
when you're in number 10, you're quite often in not conflict, but you're in a challenging relationship with other government departments. And the default setting that you have in number 10 is this is a problem which the media, the Prime Minister, other people here are worried about. And your job is to go to the department, the relevant department, in this case, NHS, Department of Health, and say, why aren't you solving this problem? And then the department plays back to you like the ways in which they're solving the problem. And why it's so important for charities to offer solutions as well as just, raise issues is because people in number 10, the Prime Minister, for example, can challenge the Secretary of State for Health on, well, you're doing X, Y, and Z, but this charity is saying you can also do A, B, and C. So why aren't you doing that? And that's why it's so important to make sure you're presenting solutions that can be used inside government to have these arguments and to test the approaches the government's the government's pursuing. So that's why it's so important. In relation to the barriers and the challenges you mentioned, I think if I was going to characterize the big challenge the government faces with ADHD and autism, it's that I think everyone in government feels that they've been caught on the hop over the last 10 years as awareness has increased and as sort of pressures on the system have increased. And when you're facing a situation where there's so much increase in demand, you're always running to not even stand still. You're running as fast as you can, but you're going backwards because the demand is loading more and more pressure onto the system. So the first thing you really need to do in government is this is in respect of any issue where you're facing this tidal wave of this rising tide of demand. You just need to make the demand go away. You need to take that step first, because that's what allows you the space to think about longer term challenges. But of course, in respect of this area, this is very hard because demand equals need, and you need to meet the need. So that's a sort of very big first order problem that you've got to deal with. So there's the demand side of things. The thing which really frustrated me in government is the supply of services to meet demand. And there's obviously a need for autism assessments and ADHD assessments, and then ADHD and autism care. And there are loads of providers, out there, not just the NHS, but other innovative providers. And they came to me in number 10 and said, we need to be able to provide services. So there's enough people out there who are able to help the government, to help the government meet the demand that's there. But the government isn't using it properly. And I think in respect of the barriers that the government really needs to be helped to overcome, it's understanding how they've got this big demand that they're facing, this really high level of need, which is growing. And they've got people willing to supply services. They've got people out there who are willing to provide support to the government to help meet that demand. But the two aren't in sync, which is a problem. And that's the big policy problem that I think the government faces. And it's a problem we faced in my day as well, which we sort of tried to fix by facilitating the right to choose. But then that creates another problem, which is that your budgets come under pressure. So you're sort of constantly facing these big barriers, and then the solution that you tried to put in place often creates another problem that you need to fix. It's a bit like painting the fourth bridge, really.
You talk directly onto right to choose. So how did you facilitate right to choose?
It was an interesting, almost by accident. In fact, it was by accident. So me and Maria Caulfield, especially, who was the minister at the time who covered this area, we were very eager to help new providers of care to come into to provide NHS services to patients. And then in parallel, there was this process we were following, not in respect of ADHD or autism. This was for NHS services in general, to set up an independent panel to decide when patients ability to choose between different providers as being frustrated. So there were these two sort of totally separate things going on. There was Maria and Maria's focus on trying to bring new providers in, and then there was this independent panel being set up. And we were working on this for both tracks for like for many months. But then the first we set up the independent panel in early 2024, and then its first ruling was on ADHD assessment, and it said that patients do have a right to choose between different providers for this service. And at a stroke, that solved the problem which Maria was trying to overcome, which is, you know, bringing new providers of services, and sort of really helped open up the sector. And there was a good write-up in the Times, and I remember one of the providers was quoted in the Times piece at the time. This is about March, probably last year. And of course it worked. It brought in, you know, it helped patients choose, brought in more sort of supply into the market, into the NHS sector. But then of course it creates a budget pressure, which is what I think the current government's grappling with. And they, you know, we have to find a sustainable way to meet demand. You know, it's the previous situation where there weren't enough suppliers couldn't continue. The current situation where there's suppliers but not enough funding can't continue. So we've got to find a way through. So again, that's sort of where people in government really need solutions.
What do you think that looks like?
It's tricky. Because there's not much money and solutions tend to cost money. I think the good thing is, from the campaigning perspective, is the first thing, as well as awareness, which you've got, you need a process that the government's pursuing to dock into. You need a government plan. The government needs to be working on a plan to solve the problem. And you have that going on now. You know, the government is working on a autism and ADHD improvement plan. It was reported to the NHS England board last week. So there's a process that they're working through to understand how to solve the problems that they're facing. So, you know, for campaigners, trying to understand what that process is doing, trying to understand what solutions policymakers are considering and how to inform the work that they're doing is important. I mean, in respect of the solutions that I'd be thinking about if I was still in number 10, I think you can probably give more certainty to suppliers over a multi-year period and say, look, over the next 5 years, this is the budget we have available. What level of service can you provide for this budget, and use as almost a negotiating pressure to lever in more supply into the NHS sector to provide support. So that's the kind of thing I'd be thinking of, I think, right now.
And which is significant, because for what people who watching may not recognise is that for suppliers to the NHS, there's huge volatility and potential volatility. And we're certainly seeing that potentially within ADHD and autism assessments and right to choose. And you're looking at that going, I've got contracts with people with, you know, rented buildings, I'm giving people jobs. I can, like, for me to unravel that, it's a huge issue. And so it's very hard to build up a service if suddenly the rug might get whipped away from under me. So that kind of like long-term contracting thinking is a big deal.
Yeah, and just to add to that, I mean, it's not just an issue facing ADHD and autism assessment sort of providers. There are other providers who deliver NHS services whose demand from the NHS isn't predictable, because you have managers in the NHS who lose control of their budgets and then have to stop using services. So the demand is very lumpy. It goes off and on. And to your point, Henry, this really militates against investment in new services and investment in innovation, which can help.
Yeah.
And it's a real problem. And this is why I think that the core of the solution has to be providing more certainty to suppliers, because suppliers need certainty, because once they've got certainty, they have the confidence to invest in building their services up and things like that. So I think that's got to be the foundation of what happens next. I should say as well, in respect of the government's got something which I never had when I was working for Rishi, which is that it's given the NHS a multi-year settlement. We were giving the NHS annual settlements, which meant that its budget was very unpredictable, but the government's given the NHS a multi-year settlement running through to 2028. So it does have there are the conditions to offer that certainty now.
I hear you, but obviously there's big industrial disputes going on with various medic groups, and so whilst the income part might have a fix, the cost part doesn't. We have a weird thing within ADHD, and I'd be just interested in your take on it, because I just don't understand it. So ADHD and autism are specifically carved out of the mental health care budget, so it's not included. So when we see mental health care needing to move relatively in lockstep with increases in physical health budget, we're not on that side of the ledger. So what we're seeing now is a big push into the priority areas for the government, and particularly around certain wait lists, which we're not in, and we're sort of caught in the middle in a zone where they're looking to cut. Like, do you have any idea why we're not part of that budget, like, and how that even happened?
No, and I have to say it's the first I've heard of that, because I thought you would be covered by it's called the Mental Health Investment Standard, but it sounds like you're not. So
we're not.
Yeah, I'd
specifically carved out. We get our own little segment saying you're not in this. Which
right. Well, here's an idea. So there's the health bill, which is about to go through Parliament next year, and the Mental Health Investment Standard is anchored in legislation from 2022. So if you were so inclined, you could table a probing amendment to that health bill and say, why isn't autism and ADHD covered as part of the Mental Health Investment Standard? And then you get an answer from the minister. So there you are.
This is the sort of stuff you get from an insider. That sounds like a cracking idea. And actually, one of the things we found very useful was working with parliamentarians to table questions to get them answered, and we've had a lot of support from that. And we do have support across parties. Like it's, I was looking at Marie Caulfield to see what's happening with her now, and I saw she's defected to Reform.
She has,
and it was interesting, our dialogues at that time, which were like, if I politely call them difficult.
Well, it's hard being a minister, because you try and internally you try and improve. Like all ministers, I've worked with a lot of ministers. They are all inside trying to improve things inside the machine, but of course publicly you have to. There are always trade-offs with every decision you take. You know, there are people who win and people who lose in every decision you take. That's why we have ministers, and of course they have to front up those decisions then to the public. But they're always trying to do as well as they can. I think that's, I mean, politicians get a bad rap nowadays, but I think of any party, they're all fundamentally trying to do the right thing, even if they don't actually do it.
I've certainly met a large number of politicians who are very clearly trying to help make a difference. I mean, that's why they're there. I've also met some who I really do not like, and
There's certainly some I don't like, but they're all, I do have.
And I say I think of a certain politician who then is now potentially with Reform, and they just said people are getting ADHD assessments to beat the benefit cap, and the children benefit cap, and that's why they do it. You're looking at them going, like, the wait times are years. Like, it's not even a practical solution, let alone. And the idea that you devalue the medical community so much that you think they just have the wool over their eyes. I met with them, and I said, you've said this, and they said, oh, it's like it's always been. I was misquoted, and I as people who've been watching this for now 20 hours will know, I'm rarely short for words. At that moment, I genuinely was silenced until I could stutter out, I watched the video, you're not misquoted. And they said, oh, well, it's because it's all true. I back it to the hilt. And I was like, oh my goodness, lied to my face. So that one I don't like. I don't like it. It is.
I mean, there is. I'm sorry to say, there is an interaction with the welfare debate on this area, and it's just important.
So talk to that. I wanted us to talk to. So
yeah, it's important, and this is where the work of campaigners can really be brought to bear to really inform decisions. That the numbers are, from that side of the ledger, the welfare side, the numbers don't lie. There is a lot more sort of welfare claimants associated with ADHD and autism. But of course, what people need to understand is that's not evidence of people trying to cheat the system. Because as you say, like, you wait years, you have to, all of this, there's too much friction in the welfare system to just sort of access it that easily. And of course, what the welfare bill is showing up is the lack of support. So if you want to cut the welfare bill, and that's sort of perfectly fine, particularly for sort of mental health conditions, that's a perfectly noble aspiration to have. It needs to go hand in hand with additional support for the health services, or you need to be able to help people come off welfare by giving them support. So I think that's and that's of course something which gets a bit lost in the debate, as you correctly highlighted. So making sure, because I think the government's about to have another crack at welfare as we go through this debate, that the support you provide people is as important policy goal.
We're seeing that, like, I mean, access to work, we're now seeing waits over a year, like, as a critical support piece. Obviously, one of the main supports is medical support. We're seeing huge waits. We see economic damage in that you can't move. So if you're receiving ADHD medication, want to move area, and you've been locally assessed, you have to be reassessed when you move. So you can't benefit from economic opportunities outside of your own area. Kids don't get support in schools to the extent that they need. We see a huge amount of people drop with ADHD disproportionately in youth offending institutions. They're more likely to be a victim of crime as well as being involved in the justice system. We see kids when they reach 18 getting dropped by CAMs if they're receiving medication, then they go back to the back of the adult queue. We snatch, and one of the great we snatch defeat from the jaws of victory. Like we take that support away. There is we're hearing from the top of people talking to the top of government that ADHD is being thought as just a path to to benefits, that you get an assessment, you go on benefits. One of obviously our frustrations is we see the exact opposite in the conversations we're having. And there's also a problem that we've been so underdiagnosed for so long. Yeah, we're appearing in all the statistics now. It's because we couldn't before. There was no way to add us because we weren't getting identified or assessed. And so the idea that our sudden appearance is therefore shows some calamity is just wrong. But how would you? Obviously, there's not good data. So how would you argue the point against that fundamental saying that we're just a whole load of wasters trying to get on benefits and never work another day in our lives, which is what's sort of being presented, that not only is the cost of an ADHD assessment a direct cost, but then there's a cost of ongoing benefit support. And it's very clear that I meet so many people, and it's just not the case. People are trying to turn their lives around. They're trying to understand themselves. They're trying to thrive, and they're finding all these barriers in their place, notably huge waits and access to support. Right, over to you. How would you challenge that?
Yeah, narrative? I mean, fundamentally, the welfare bill is a symptom of health service failure in this area, and there's a lot of examples along those lines. So I'd approach it from that angle. It's not like you as campaigners, as charities, you don't want people to just be claiming welfare either, because that's not good for health either. You as a charity want people receive the support. So reducing the numbers on welfare is a shared ambition, but it's got to be done in the right way. So I think that's how I'd approach it in respect of adults. I would as well highlight this, you know, the children and young people waiting, because they're not on waiting lists because they're trying to claim welfare benefits. They're on lists waiting to be assessed because they have a need and their parents think they have a need. And even if you are, you know, you've got somewhat dinosaur-esque views on adults and welfare and ADHD and autism, you should at least recognise that there is a massive level of need in respect of children and young people's services as well, which I think politicians would find hard to challenge. So, I mean, if you encounter problem people coming at it from that angle.
But it's a kind of a sad position where you're like, okay, we have to focus on the kids. We can't focus on the adults. I mean, and that's literally just happened, right? So in Warwickshire, the ICB there has said we will not see anyone over the age of 25, full stop.
Yeah.
And the press release that went out said it's so we can focus on child services. And we're being asked to make a decision and sacrifice people who were themselves failed as children, trying to get their lives back. And being told, well, we've failed you, we're going to continue to fail you so that we can try and fail less people in the future. It's not a great answer. And
no.
And in Wales, Seri, who was on before, when she talked to me previously, said that's a lot of the direction of travel. There's a focus on child services and not on adults. So, you know, there was a battle in 2008 because at that point ADHD hadn't been recognised in adults at all. And I believe part of it was a legal push where a kid was 17 3/4 turning 18 and told, well, at the moment you turn 18, the medication magically makes no difference to you at all. You're cured and you don't need any support. Obviously, that's not true.
Yeah, no. And, you know, I agree. It is tricky focusing on sort of children, young, when obviously there's adult need as well. I think in some cases it makes for political, if you're trying to win a political argument, it makes it easier. And I've worked in health policy now for sort of 23 years, and it's not just ADHD and autism. It's not just that therapy. It's not just that sort of area which gets where this dynamic plays out. 20 years ago, I was working on cancer services for in health policy, and it's a rule of rescue. You know, you tend to provide more priority and support to children than adults. So I mean, that's just a sort of quite important dynamic always in politics and funding decisions as well, to be blunt.
And it was interesting. One of the things was get round to going at Warwickshire, it was interesting seeing their mental health services had green buttons on their NHS dashboard for child services, green buttons for elderly services, and red and orange buttons for working age people. And I thought that sucked to be us, if I'm honest. And it's how to have those. It is the toughness of healthcare where you are making choices.
Yeah, and it's very. I mean, the allocation of resources in healthcare is a very, very hard. Very hard.
I would not want that job. I mean, when you are actually looking at numbers, going, if we do this, that many people will pass. If we do that, that many people will pass. Versus saved, versus consideration on age, and I mean, I know it's done with good heart and from people I've spoken to, but crikey, what a job. And obviously I know you've been party to that in terms of the decisions as you look at healthcare. It's an extraordinarily difficult thing, and I really do emphasize. Okay, we have to go to final words. Like, what do you take, like, final words to the audience on making political change?
Okay, I think I'm sort of very glass half full on this area, because you've got a high level of awareness, which is, sort of foundation one for doing something. People in number 10 are concerned about this area. They're concerned about patients and people living with ADHD and autism. So that's good. I mean, it might be for good or bad reasons, but fundamentally, you've got a high level of interest in government in this area, which is great. That's the first thing. The second thing, which makes me encouraged, is there's a live policy process going on which you can work with. The NHS England is developing its autism and ADHD improvement plan, so that's great. So you don't need to campaign as I remember the cancer campaigners were doing sort of 12 to 18 months ago. They were campaigning for a national plan to be committed to, and now they've got that commitment and the plan's underway. But you've already got a plan, which is in development, so that's great. So you've got that work. You've got a lot of people offering solutions and a lot of energy in the sector as well. And it's just about making sure that those solutions are conveyed to policymakers. So that's a really, really important task for the sector now, I think. And then, as I say, there's a health bill coming up next year. So if all goes wrong and you don't feel that you're being listened to by government, then you can kick up a big old fuss in Parliament. So for all of those reasons, I think I'd be encouraged if I was in your place.
Well, thank you, and thank you for your time now. It's a big deal. You are an extraordinary person with extraordinary experiences, and it's very valuable being able to listen to you. And I know for everyone watching and looking to be part of making change, it's insights and we couldn't otherwise get, and it gives so much food for thought and will help inform the future. I would honestly be like interview you all day, but it's a delight. Thank you for your time.
No, my pleasure.
Very sadly have to say goodbye. Thank you, Bill.
Good to
really,
join you.
Really
Yeah.
appreciate
See you soon.
it. Thank you. Yeah, insights from the top table, and absolutely wonderful and inspiring person who has extraordinary knowledge and insight that just otherwise inaccessible to have that conversation. It's really wonderful, and very grateful for his time, and thank you. I don't want to say that I can't belie how I was very, very excited to talk to Bill. I'm ridiculously excited to talk to Ben. So that's next up. Ben Branson, celebrity interview, honestly, just massive inspiration, right? Going through extraordinary challenges we can talk about and creating something wonderful that he's successfully sold, and I think an inspiration tool, and then is putting some of his extraordinary efforts and intellect and abilities into creating a charity called Missing 20%, or Hidden 20%, specifically talking around neurodivergence and making a difference, and talking directly about the invisibility of diagnosis, the shame many carry, and how society frequently misunderstands people who think differently. He has ADHD and autism. He's a British entrepreneur, creative, innovator, best-known founder of Seedlip, the world's first distilled non-alcoholic spirit, launched in 2015 in the children's, but he turned a simple curiosity into 17th century herbal remedies into drinks revolution. Seedlip stocked in top bars, Michelin-style restaurants, retailers in over 30 countries. Just like extraordinary. Right. Bringing him on now. Hello, Ben.
Hey, Henry, how you doing?
I
still
am
going.
Yeah, we're only an hour 22. Wait till I get to 27. I think that's when I start to flag and look tired. It's fortunately ADHD Australia take over our night, so I do get to have a very sort of fitful sleep where I keep waking up with, because I have received calls where in the middle of the night going, "We've got a problem."
Yeah,
and
tech is not working.
Yeah, a year ago, and this is public knowledge because it happened live. We got a call going, right. We hadn't realized we got our time difference wrong. we have a senator and we need to start an hour earlier. Like, like, oh my goodness. And then fortunately, we had a pre-record in that slot, so it's a really simple swapperoonie.
Swap it in.
But I said, like, but surely we have a problem in the morning as well. And they're like, no, we don't. You just like bring Henry's alarm at 5:30. Like, you know your way your phone. If someone rings 3 times, it's like must be important. It's gonna ring. Yeah, 5:30. I get this call going. Okay, yeah. You know when we said no problems about the morning, we do. So this has been easy, right? Come on, we know I'm wasting time of your valuable time.
Get into it, Henry.
I'm so excited to talk to you. Like, so excited. Look, let's get on to questions so I just stop being an excited person. You were diagnosed. So we're going straight into about neurodivergence.
Yep.
And the reason is that, like, we'll obviously talk around Seedlit, but I'm passionate about the path. And I think people talk too often about later stage stuff where a lot of stuff's already been set in motion. And actually for us, and particularly people diagnosed late, it's like, this is tough as, and we're trying to work it out. And you are an absolute inspiration. So look, you were diagnosed at 41, beat me by a year. I was diagnosed at 42. Not that it's like, 42, Douglas Adams, Meaning of Life, just saying.
There you go.
Why'd you go? Why'd you get the diagnosis?
It was a very slow, gradual process, actually. And I guess the important piece of context is that I'd never heard the word neurodiversity. And if I had, it definitely had passed me by. And my belief system around ADHD, autism, Tourette's, dyslexia, etc., was actually incredibly narrow, incredibly outdated, and just full of all the myths and the stereotypes and the stigma. And so it was, where were we? Probably 2022. Guy I know in the drinks industry who I've always got on well with was diagnosed autistic and ADHD. Kind of related to how his brain worked, always got on with him, admired him for kind of speaking up about it. And yeah, that was fine. And then I was listening to a podcast with a neurodivergent founder, started to relate a bit. This is probably a few months later. It was all very gradual. And I was kind of like, maybe. And, I kind of remember Googling. I was really only sort of thinking about autism at this time. So I sort of Googling, autism test, and did the NHS one, just the sort of quick 10 questions, scored pretty highly. And then went straight back into kind of no chance, denial. I can't be autistic, can I? And then I rang up this guy, Ian, who was in the drinks industry, who'd been public about his ADHD and autism, and just said, fuck, man, I like, what do you do? What do you do if you think you are? How do you know? I've done some tests, and what should I do? And he said, go and talk to this clinic. Don't bother with, if you want to get on with it and you can afford it, don't go anywhere near the NHS. And so this was at a time when my wife was probably 8 months pregnant with our third daughter. Not the most ideal timing to then be rallying off to kind of go and pursue some potentially self-indulgent process to understand, how my brain works. Anyway, I went for the assessment. I didn't tell my wife. I didn't actually tell anybody.
Wow.
And so I was like,
I don't think I did.
I'm not sure this is true. I don't know if I am, but I'm sort of down the lane now. So let's go and find out. And yeah, only an autism assessment to begin with. Was told at the end of a 12-week process, congratulations, Ben, you're autistic. I believed it. It did change everything and nothing.
Oh, nice phrasing. Yeah.
Yeah, it really did change everything and nothing. but it gave me the answers to my life's questions about myself, I guess. And that was just massively empowering when somebody, it's a bit like in a I'm not talking in a medicalized way from an autism perspective, but you go to the doctor, you go to the vet, you go to a lawyer, you go to an accountant, you have a challenge, something's wrong, somebody tells you what that is, and we know it so well of like, oh, I'm just really glad I know, just really glad I found out. And then it was probably 6 months later, so we're into 2023, and I went for the ADHD assessment. And again, that was just the sort of missing piece of the puzzle. But I can categorically say that I am the kindest I've ever been to myself, and I am the most myself that I've ever been. And I fucking want that for every single person possible.
So I obviously agree. And that being able to be the most yourself, how do you explain to people who go, but surely you were you before? Like, as we say, like a diagnosis doesn't change you because it's just the same information. It's just information about you, but actually it does make a huge difference.
Yeah.
How do you answer that?
Well, my wife said that after I was assessed, and then I obviously shared the news with my wife, and by the way, nobody was surprised. And so there was that sort of last to know kind of feeling, which was doubly magnified because I had next to no understanding or up-to-date information on what autism or ADHD are. So it was this double, like, wow, I really have been in the shadows. I really have been under some rock somewhere, to not have any self-awareness, and also to then not have any societal consciousness of what's going on. And my wife said that I started to, and these were words with love, but they came out slightly wrong, of like, I started to just be more autistic and act more autistic. And obviously that was part of me kind of, I guess, unmasking and just sort of allowing myself to be myself more. But I look back and I kind of go, well, my brain has always operated in the same way that it's operated, but externally and how I've presented has definitely been different. And I definitely grew up kind of understanding social etiquette, i.e. you look somebody in the eye when you talk to them, for example. It's a pithy, simple thing, but you make eye contact. That is what you do. And that is how you show someone respect and that you're listening. And now I don't feel like I have to do that. And nobody has ever said to me since not doing that, sorry, are you listening to me? Or can you look me in the eye? Or, God, it's a bit disrespectful when you kind of can't look me in the eye. So yeah, I would say that my brain has always been the best and worst thing about me, but just how I've probably portrayed that externally has massively shifted, and I feel massively empowered now to just be myself, and not have to. Of course, I still mask, and I still have to, I pull my big boy pants on and do things that I don't want to do. But yeah, I feel far more comfortable or far more aware of when I am at my best and what is not going to serve me best.
And that's a big deal, right? Knowing when you can play to your strengths, like knowing your strengths or not, and actually knowing the costs of the weaknesses of the masking, of doing things different, going like this is, yeah, you were talking about eye contact, and I was thinking I struggle with it. In particular, what I struggle with is I get wildly distracted. So I like to try and look in a corner just so I can remember what the hell it is I'm trying to say. Otherwise, I just forget. I fall into the pools of your eyes. It's not true. I just literally there's too much going on. I forget. Like it's. You mentioned your wife. And in an amazing podcast, your podcast is amazing, The Hidden 20%. You've won awards, including for, I think, the interview I'm about to quote. It's a spectacular thing. Obviously, highly recommended to all. She said, "This sounds strange, but you being autistic really saved us." It really did, because I couldn't have done this on my own. What did she mean for that? What was?
Yeah, you're gonna get me with comments like that, Henry. I have a brain that is really, really good at taking in lots and lots and lots and lots of information and untangling it and distilling it, no sort of pun intended, and making it really, really simple. And
yeah,
my brain, I've learned, is, it can be incredibly strategic, logical. I see lots of blueprints. I can join lots of seemingly disparate dots or concepts together, make sense of them. And we had a very big legal case, very big personal legal case for my wife. And I just absolutely bossed it. Oh, Henry's gone.
Oh no, I'm still here. I was bringing up a quote. Bastard. I just was trying not to be distracted. Whilst I clearly like.
Don't worry. And I absolutely, it was, analyzing huge amounts of data and figuring out plans and strategies and arguments and I was made to do that kind of stuff. And it's the same with, I do love massive, complex, complicated challenges and breaking them down and working them through. And, case in point, the whole neurodiversity aspect, of course, I didn't pick just autism or just ADHD. We're going for the whole thing, and I want to figure it out. And I've built some of that muscle from taking on a $2.5 trillion industry with CLIP and non-alc, and changing perception and lighting a fire to spread a kind of global movement, that's now a sort of multi-billion dollar category. And I feel if I hadn't been diagnosed and I didn't know how my brain worked, I wouldn't have started the charity and the podcast, but I wouldn't have lent into like trying to really harness what my brain's best at.
You built the story starts obviously before your diagnosis. So you actually wait, I'm just scroll back. The quote from your wife saying being autistic really saved us. Is she talking about the legal case, or is she talking? She's talking about legal.
Yeah.
Thank you. The story starts before your diagnosis, right? Okay. And I mean, it's very clear it was tough being Ben. Could you, and that your exact story isn't the same for every neurodivergent person, but it being tough is very common. Could you talk to people, share with people that journey up, like what school was like then, what happened? And
I mean, I think we say this on the sort of front page of the In 20% website that after I was diagnosed, I went straight into kind of research mode and wanted to know everything there was to know about autism and about ADHD specifically. And of course, I found the two sides of the coin, the dreadful, horrific statistics, of which, addiction, abuse, trauma, homelessness, prison, I'm in all of those, right? I've ticked all of those. Suicide attempts, I was there in the statistics of what happens when you don't diagnose and support, right? And then I found the flip side of all the kind of my heroes and the amazing contributions that brains like ours have made to the world, and ultimately started the charity to try and close that gap and tell the truth. But yeah, I mean, I saw my first psychiatrist when I was 8. Lots of what I would now be able to describe as meltdowns and self-harming meltdowns, always involving windows for some reason and smashing them, which landed me in a lot of trouble, both with police and exclusion and hospital. And then I ultimately didn't get my first proper job until I was 25. And I've had a very colorful, kind of dreadful, colorful period between leaving school and actually turning my life around. And I've met lots of, I've been around the world. I've met lots of people from lots of different walks of life. I've been in and out of rehab section twice. Lots of real, like, resilient building, character building, worldview kind of experiences, and ultimately between the sort of age of 25 and now, I've just channeled that destructive energy into trying to improve my life. And it's literally like, it's not as simplistic as changing tracks on a train, but I think we know, as certainly as ADHDers, like, there is a lot of fight, drive, energy, and that can be good and bad. And I'm now trying to put that energy towards good instead of trying to destroy myself. So I guess I went to boarding school when I was 7, and I wouldn't probably wish that on anybody. And school, I was very fortunate because I was very good at sport and I was very good academically. And so whilst I didn't have best friends and because I was in sport teams, I was sort of quote unquote popular. And because I was good academically, I could kind of get away with being naughty, but I was that naughty little white boy that is the absolute ADHD, completely outdated stereotype. And yet, of all the psychiatrists, counselors, therapists, psychologists, rehab, sectioning, hospitals, etc., that I've been to in the first 25 years of my life, never, ever, ever, ever did anyone ever say anything about ADHD. And of course, this was all happening pre-adults being able to be assessed for ADHD, ADHD and autism coming in, but never. And so I can kind of really clearly see how just missed so many people have been, so missed. And I don't regret anything, and I don't wish it was different in my experience. Because again, that's just, I don't know, not logical. But we have to break the cycle. And I've got 3 daughters, and their generation and generations to come, it's going to be different.
We talked to, and obviously we're campaigning like you through your work and us in ADHD UK. That's the goal, right? To change, improve the future. We talk to a lot of people who have addiction issues. There's a high likelihood for people with ADHD. There's a high probability. But actually, when we look at some of the limited addiction and research that's been done, what you find, and so this is some research from gambling, is that in gambling, the propensity to gamble is the same. The likelihood to be in the category of disaster is much, much higher. And a lot of people with ADHD finding themselves either the root causes, I don't think that, some with life being very difficult and some self-medicating, some caught in awful circumstances, but many different routes to addiction. So what's your advice to, how did you I know that's wrong phrasing, no longer become dependent on drugs, and what's your advice to people who are in that situation?
Yeah,
to get people with ADHD and autism.
Yeah, it's an interesting one, because I'm right at the beginning of this sort of thinking, Henry, and it's backed up by absolutely nothing currently. So that is my big qualifier here. But my hunch, my gut, deep down in my gut feel is that addiction is a symptom of unrecognized neurodivergence. That's my big thought. And I would love to be proven right, wrong, etc. Because I guess I've got my own experience, but it doesn't matter. It's not about what's the drug, is it gambling, sex, alcohol, they also are symptomatic, right? I could be addicted to anything that was going to change the way I feel, and that was going to allow me to escape from sitting with myself and being in my own head. And so drugs are not the problem, alcohol's not the problem, gambling's not the problem. It's within our psyche. Not that that's a problem, but it feels like it's common sense to kind of go, but it's something within our psyche. And and again, Henry, I haven't done the research on this. I don't have the data. I've got zero evidence, no proof. But I got a feeling.
I think we know from the data that there is this high propensity. I think that we've got a problem that there's so many undiagnosed. So when you're trying to segment across, it's very hard to go, this is the non-ADHD audience versus the ADHD, or this is the neurodivergent audience versus non. And it's one of the things obviously we want.
But for example, Henry, and I'm
but the evidence is very clear. Like,
trying to get into like solution mode here, but the rehabilitation centres that are focused around helping people around addiction. I don't know whether there's neurodivergent screening, etc. I don't know, but I do know.
No, they're there is not on the NHS, because they just go, oh well, we'll give you a referral, and they're like, oh, see you in 5 years. Like, it's just, And actually, I was speaking to an addiction service provider to the NHS, and they said, look, the current structure is awful, and it's particularly awful for ADHD. So if you do not turn up to your addiction session, you are automatically and immediately dropped. And, you know, with people with ADHD, commonly struggling with time and organization, and this assumption that it's because we therefore don't care about the treatment and therefore should be dropped. It's just wrong.
Yep.
But it's systemic. Like it's actually part of the, as I understood it from them, part of the NHS guidance, and so it is actually almost worse than not having the screening, the review. It's actually creating rehabilitation and support systems that are actively more awful and difficult for neurodivergent people.
Yep. I mean, there's some amazing work going on around eating disorders and autism. People like Francesca Happe and Alison Ledlix that getting stuck into that. I'm not saying eating disorders don't exist, but there was
some research, and this was certainly that I've seen. I'm trying to remember the person who made it more public, did a TV program on it, but where the research showed that 50% of the people hospitalized due to anorexia had autism.
Yeah,
and
it's really
they then created a diet. They found the problem was not eating. The problem was what was being asked to eat, and making it more compatible changed everything. I don't want to oversimplify, but I'm going to quote the professor. So she said, we made the orange diet, like the beige diet, she said, and it made a huge difference for a large group of people, and they didn't actually have an eating disorder. Well, they did, but they didn't, because the real issue was autism. And you know, you feel like those moments. You read the story of the person who first discovered insulin, and they injected the patients, and they just literally came alive again. And that sort of fundamental change. And you've got this fundamental knowledge change happening, where suddenly a whole lot of people who are extraordinarily ill just actually aren't ill. And
but look, addiction that I've grown up being educated, I guess, on addiction being genetic, for example, right? And there being a genetic component. And so, that it's a little...
And I presume there's the underlying bit that, in fact, is the genetic components, neurodivergence.
Anyone listening that works in this space, or I really feel like that's, and I don't have the numbers on cost to the NHS of addiction, et cetera, but I can tell you, I can imagine there's a huge economic kind of impact and potential opportunity on the flip side.
I mean, this is an argument we're trying to make, but the lack of data being a massive problem. And, you know, at the moment, I know you were listening in on the earlier session, this problem that we see elements of government thinking of neurodivergent assessments as solely as a cost, and not seeing that economic benefit, that you change people's lives, they can then thrive, they become, improve their careers, they pay more tax, it changes everything. And so it's not only a moral argument to do it, because it's the right thing to do, but it's an economic argument. And
it's a win-win.
It is a win-win. Do you think the hardships in your life have some root in your neurodivergence? I think you've touched to this, but specifically.
Yeah, I do. I don't know that. Would it have been the things that have happened in my life where they've been very traumatic or bad? There is definitely a link with actually on both sides of sort of being more vulnerable or easily manipulated from an autism perspective, and being incredibly risk averse and impulsive from an ADHD perspective. Both of both aspects have absolutely caused some trouble. Would it, and I don't even bother with the and what if I'd known? I haven't really even entertained that. That seems inefficient to do that.
The when people, now I hear you in that ability to look forward, I think is a wonderful thing. Certainly when people are first diagnosed, they tend to talk about having three core emotions. One is anger for how hard it's been, and the other is peace. It's like, that makes sense. That explains so much.
Yep.
And the third is joy, for like how the future can now be. How I can like be more me, but achieve, because I know myself so much better. The advice to every entrepreneur is know yourself, and if you don't have that understanding of that you're neurodivergent, you struggle to know yourself. It's just sometimes when you ask people like, would you do things differently, you get a different question answered. So they'll say no, and the question they're really answering is, are you happy now?
Exactly.
And my journey has been hard, but I have a wonderful wife and 2 kids, and I would do all of that again to make sure I get this.
Yeah.
But it's not to say that if I did do it all again, I haven't learned some shortcuts. There aren't a lot of dead alleys that I went down that I wouldn't go down again. Because I've learned so much about myself and my life.
Yeah, and I wouldn't, it is literally and specifically because of Seedlip. So I don't think I wouldn't have done Seedlip if I wasn't autistic and ADHD. Is my very strong belief, because it's part of how my brain works. And specifically because of Seedlip, I had a girlfriend when I was 20, and she was the one that got away, and we lost touch, and she moved to China, and I was amidst the chaos anyway. And then because of Seedlip, we re-met, and she's now my wife and the mother of our 3 children. And so, yeah, it's just how it's meant to have been. I wouldn't change any of that. For anything.
This question sounds a little trite, but but isn't, I think, follows on from that. No, so I think I know the answer to the first one, but I don't know the answer to the second. So the first one is, are you happy now?
Yes.
And the second is, when have you been happy in your life outside of now?
It's funny. I just had a thought, and I did do this a lot at the beginning of kind of going, oh, what's autism and what's ADHD? And is that being autistic? And is that being, constantly analyzing everything. And so you telling me, am I happy now? I take very literally of like, right here, right now at 12:38, I am happy. Thank you, Henry. On Monday or last Monday, most Mondays, I just want to close the whole fucking business down, the charity down, everything's rubbish. Can't deal with the transition between the weekend and the start of the working week. Anyway.
Oh, wow, that's interesting.
Yeah, I find that.
Yeah, I'm going for overall average over a sort of if we're doing a moving average. But like, I love that. Thank you for sharing that. Great.
Somebody said to me about 20 years ago, if you put half the effort into bettering your life as you have into destroying your life, you will be absolutely amazed, and I am absolutely amazed. I feel very, very lucky.
And in that sort of overall happiness, like when else have you been happy in your life?
I'm always happy outside. So if I think back to sort of, you know, childhood and growing up, all my memories are outside. And usually those memories are moving, right? So it's, I don't know, running in a field, it's climbing a tree, it's building a football goal, it's building a skateboard ramp, it's riding a pony, it's kind of a lot of, or it's on the rugby field, on the cricket field, on the hockey field. And yeah, that freedom, I think, is that sort of freedom and fresh air. Yeah, I think was and still is like when I sort of feel most at peace.
Thank you. And do you do like? I know you're also an advocate for farming. So, do you spend much time outside now?
I do. I mean, I don't know if you can see, Henry. There's my view.
Oh my goodness, that is a very nice view.
So yeah, I'm sat in our distillery at the moment, and yeah, when you've got children and the outdoors and nature, yeah, that's immensely powerful. And so yeah, I do as much as I can to kind of get the kids outside, be outside. Yeah, we've got a fair few animals here. Yeah, I do kind of love animals and plants and trees, probably more than humans most of the time, if I'm honest.
If I look, you should not tell the story, but I'm going to. If I look up, there's a ceiling lamp, and it has a very odd pattern on, which is made of parakeet shit.
Okay.
And it's because we had some parakeets get abandoned in our attic, and we then adopted and were abandoned, so we fed them up, and we also have a cat, so the parakeets lived in here, and they have flown the nest, but there was a period where they were flapping around here, including a really delightful meeting that I hadn't been able to get them. They got better and better at not getting caught and getting put back in their cage. I couldn't get them back in, so I had to meet with someone quite senior, and about 2/3 of the way through, a parakeet landed on my head. I just had to explain.
They're so noisy though, Henry. How do you deal with the noise?
They well, in that environment, they only were noisy when I started talking.
Okay.
Which was extremely. They had to go. At that stage they had to go and live temporarily outside. Then they were outside in a net, and after a couple of weeks, and we still see them, so we feed them still.
Brilliant.
Just to help them along their way. Right, story along. We've got to talk about Seedlip.
Yep.
Odd reasons. I've been really kind of obsessed about neurodivergence in you. Who'd have thought it? For those that don't know, so I'm going to do a quick summary, and correct me if I go wrong. Seedlip is a non-alcoholic botanical spirit style of drink, founded in 2015, inspired by a 300-year-old family heritage and a family design background. Your discovery of the 17th century book on herbal distillation, and born out of frustration of sugary mocktails when not drinking alcohol. You'd experimented with copper pot stills and botanicals from your own garden, launching Seedlip Spice 94 at Selfridges. First 1,000 bottles sold out in 3 weeks, and in a few weeks, and proving demand and then got traction in top bars and restaurants, selling it to Diageo for a majority stake in 2019. And it's the global leader in premium alcohol-free spirits or drinks. It is an enormous achievement. Absolutely. You'll obviously get told this a lot. Like, it's amazing and just very special, and actually very important to a lot of neurodivergent people do not drink because of struggles. It may be struggles with addiction, maybe just struggles with generally interests, and so having something that you can drink that isn't a silly sugary mocktail is a big deal. Questions? Yeah, straight back into the neurodivergence. Do you think your neurodivergence has helped or hindered you in this in your CDIP journey? And I have a very specific question, which I have to say, I hate doing this when people add two together and then I forget one. I properly hate it, but I'm still doing it. I think something that can be a massive problem is a neurodivergent issue based in neurodivergence that's a proper block that you struggle with, and that can actually see you. Actually, you can see founders defounded, because they're like, you can't do this thing. I just can't do this specific thing, and I don't know why, but I'm having a massive problem. Then people just going, well, if you can't do that, you must be useless, or reducing your value in self and self-withdrawing. So I'd be interested if you had some specific issues. So like neurodivergence, help or hinder, and the specific issue. God, there's 3. It's even worse than I thought.
So we'll take them one at a time, Henry, so you can remind me.
And look, I love, you see him writing them down. It's exactly like I have things here. It's right strategy.
So help or hinder, an interesting one, because CLIP, I started mucking around in my kitchen in 2013. It took 2 years to launch.
Yeah, it's one of those overnight successes that took a long time.
Yeah, and then throughout no point in that CLIP journey did I know that I was autistic or ADHD. But interestingly, I managed to, I think I used my brain to figure out production process and blend of ingredients and a strategy for how to make non-alc options credible and interesting and delicious and adult, and then with the help of an amazing team take that to 35 countries in like 3 years, and change. And this is where I think it's most important to neurodiversity, is I feel like there is a lot of similarities in terms of stigma and social norms and all the rest of it between non-alcoholic drinks and neurodiversity. There are parallels, and that, I think, for us as a charity stands us in hopefully good stead. They also both begin with N as well, which I like. So yeah, I do. I think it, I didn't come from the drinks industry. So doing it differently, coming at it from a different kind of angle, was definitely help, and definitely part of my brain. I seem to attract now, on reflection, actually quite a neurodivergent led team of people, which is interesting. And we did things differently. We didn't do any internal email. I haven't done any internal email for nearly 10 years now. We don't with our current drinks businesses, with the charity. No internal email, no WhatsApp groups, which is amazingly efficient when we run everything on Slack, and email is there for the outside world, our customers.
Okay, yeah, that was definitely part of what I was thinking. Wait, I emailed you.
Yeah, yeah. Emails for the outside world.
Wow.
But I did everything like looking into
everyone who's CC'd on all those emails with like 50 people that they don't need to read is currently looking at this going, oh my God.
So inefficient. Least meetings possible, and lots of good, like 5-sentence golden rule for emails, and doing a lot of work with the team around How do you win the inbox? Inboxes and emails are competitions. How are you going to get read first, answered first, and make it so clear, simple, and easy for somebody to respond to your email? Because we all know the paragraph emails where you kind of go, oh, fuck it, I'll look at that later, because someone's just made a really simple request that I can easily email back. So like sweating like all the little details, and I kind of feel like being autistic, I want to get into the minutiae, and I love a spreadsheet and I love the numbers. And then being ADHD, I want to kind of just make things efficient and get on with them and take action and hustle and make stuff happen. So yeah, definitely a help. Definitely also on reflection, Henry, a massive hinder. You know, I did a lot of traveling, and I'm a very anxious traveler, and I would get on a plane and start crying. I'd get back on the plane and start crying. I had to do a lot of socializing. I had to do a lot of what I would call, in the nicest possible way, performing. And yeah, that was a lot. That definitely, you know, burnt me out a number of times. And I'd go on these, you know, big trips that would only be 10 days, but I'd do 7 countries. You know, it was madness. But
that makes sense. I can see how that makes sense, because you're like, this is going to be horrible.
Yeah.
So I'm just going to go, I'm doing like, let me enter the pit.
Exactly. Let me do it for the shortest amount of time. So I've got, you know, I'm off to New York next week, and I've got a sort of 5-day trip, and like I know how to do these. I've done so many of these kinds of trips before, and this is for our new drinks projects. But I'm also standing on a stage at a conference talking about Seedlip, and I know it's all just high anxiety. And so before, I would have come back and gone straight into meetings. Now I have a rest day when I come back, and I have a quieter day before I go. And so it's just, you know, those little things that can be done, I think, to help. I feel like now, you know, the charity is a fully neurodivergent team. My drinks business is a mixture. But I, definitely have carried on the same vein of, I 100% start from trust with anyone that I work with. That might be it's not always served me well, but I treat you like an adult. I believe I've made the right decision hiring you or working with you. Why wouldn't I start from 100% trust? And then I also I don't care where and when you work and how you do it. Whatever works for you, as long as the results are good. That's the other kind of contract, I guess. What was the second question, Henry?
Where you found yourself hitting a block.
Yeah, I mean, the traveling and the socializing, you know, I do not really socialize in my personal life. I do not have friends. I don't have a kind of non-professional. I've got lots of people that I know, lots of people that I like, but not people that I would kind of call friends per se, and definitely not in my personal life. And so, yeah, the kind of public bit and, you know, press and talking and all that kind of, you know, bars, restaurants, hotels, buyers. That's pretty exhausting. And when you do that 10 days in a row, now, if you ask me to do that for 3 days in a row, I'd say no way. And so, yeah, I was doing like over 200 days out of the UK a year, 3 years in a row. And
wow,
by the time Seedlip got to its majority exit in 2019, you know, I'd kind of done 5.5 years in total right from the beginning. And it had been obviously really relentless. We had 3 offices around the world and big team. And it had been, I was not in a good way. You know, I was really burnt out. I was really grateful that, you know, we did the deal with Diageo on the 7th of August 2019, and on the 16th of August, big things seemed to happen basically around my daughter's being born, because 9 days after the deal was done, our second daughter was born. And then I took 7 months paternity leave, and actually just 7 months healing, really, and sort of time away from the business. And then I joined beginning of March 2020, and then 3 weeks later, COVID. So it really wild time. But yeah, I think the biggest challenge has been energy levels and socializing.
And I only imagine, like, drinks events being, and drink selling, like being in bars, like,
yeah,
like just all the time.
It's a very sociable industry, and I love the industry, and I love hospitality, and there's nothing better than an amazing hotel bar or a fantastic restaurant. But yeah, it's a lot.
It's also made me think about how COVID, and obviously what we're doing now, video, has really opened up doors for neurodivergent entrepreneurs, and because it's often talked about in the just general workspace, but like actually thinking about entrepreneurs. And
yeah, because it's not just this bit, right? It's the traveling, it's the finding the place, the before, the after, the getting home, the sensory side. It's
100, like I can't tell you how, like, the cost of me doing a meeting anywhere is basically the whole day. I hate it, and I will do almost everything I can to avoid it, because frankly, because it's pragmatic, the cost is ridiculous. Like it just it takes, you know, I meet someone for an hour and a half and takes my day. When you were talking earlier, and annoyingly we have to wrap up. There's a guy called David Neilman. He has ADHD.
Okay.
He has founded not one but 5 airlines. It's like classic neurodivergent overachiever. He's actually someone I'm quite jealous of, in terms of that he always knew he was different. Like he always knew he'd have to do it differently. His parents kind of instilled that with him. And he said, I knew I had strengths that other people didn't have. My parents reminded me of them when my teachers didn't see it. God, you know, we wish that for our children, right? Like, we want our teachers to see it. Let them be brilliant. I can distill this quote from him, I can distill complicated facts and come up with simple solutions. This is why I was looking it up, because you said such a similar thing. I can look out at an industry with all kind of problems and say, how can I do this better? My brain naturally searches for better ways to do things. But it's hard for me to do the mundane things in life. I have an easier time planning a 20 aircraft fleet, all that involves, than I do paying the electricity bill.
Love that.
Yeah,
there's a brilliant book, Henry, actually, for people listening and watching, called Brutal Simplicity of Thought. It's by M.C. Saatchi, and it's a book that I gave to anyone that joined Seedlit. They were given 3 books when they joined Seedlit.
Oh, go on. I've got my
On Purpose by David Hyatt, who is probably like my top 3 word idea heroes. He's an amazing man. I met him and couldn't really talk because I was in such awe. But yeah, he's David Hyatt, On Purpose. And that's all about purpose-led brands, organizations. Very short, very simple, really nice. Brutal Simplicity of Thought by M.C. Saatchi. And the concept is really simple. It's not a big book to read. It's really, really difficult to make things simple. We hear a lot about keep it simple, but actually to make something simple requires actually a lot of work. And so most people don't do that. Most brands, most organizations, most missions, most movements don't do that.
Shock sidebar, I meet a lot of ADHDers who are amazing project planners. Their life can be a disaster, but they're extraordinary project planners.
Yeah.
And I see it I see it so often, and it's because we're great, and many of us are great at simplifying, solving problems. We're also very aware of the frailness of humanity, that people make mistakes. So we structure that in, and that makes for great projects. Anyway, back to you.
And the third one, so it's a great sort of mantra. And the third one is The Third Plate by Dan Barber. Dan Barber, top chef in the US. And this is the simple concept of, guess what? We used to grow food for flavor and nutrition. And we lost that idea as agriculture was industrialized. And now our food is not as nutritious as it once was. And with only 46, 47 harvests left, according to the UN, which is a very scary thought. There is a big argument to grow for flavor. And that's what Dan does with his restaurant and with his seed company. And that's looking back at heirloom seeds and heirloom varieties. I'm actually visiting there next week, which is going to be a treat. Those three books are, they were great. I mean, we ended up having to buy a lot of them, but absolutely, brilliant books that sort of set the stage for people who join Seedlip.
And this video will be on YouTube, people. So if people want to catch up on that, but. The summaries on purpose, Hyatt, brutal simplicity, such. Third Plate, Dan Barber. Someone had a few comments in the text, like, wait, I would like to know. I wish I could talk to you forever. But time marches on. I've enjoyed that so much. I've learned a lot. I think your insights are spectacular. What you've achieved is an inspiration to all. It's an inspiration to me, and it has been genuinely an absolute wonderful thing. And thank you for being a headline in the conference. As you know, this was supposed to be the end of the conference. We were signing out, but we found that we had a number of people that was just so interesting that we wanted to share with people that we ended up. I was like, I'm the boss here. I know I said it was a 24-hour conference, but I literally make the rules. So now it's 28 hours.
Just change the fucking day. 24.
Honestly, I'm not quite as bold as Sam Thompson. So Sam Thompson did he says his podcast, and now 1 million downloads each one.
Wow.
I know there's someone who's big in podcasts yourself. You can go. Sold out. Did a show in Manchester, I think, or please don't look up whoever. We do not look up that. I know that I'm just making it up. But small show somewhere that was not London. At the end of it said, we're going next year, 02. 16,000 bums on seats. We're doing that. And I've the pleasure of being there a couple of weeks ago where he did do that. And at the end. He said, of that, he said, next year, Wembley.
Why not?
Yeah, why not? I, however, am not so confident or foolish, and that line between foolishness and bravery. I think I think we are tentatively hoping maybe to do 2 days, 2 nights next year. Okay. But let's see where we go.
Double. I mean, that's double. That's already a step up.
Well, this is our 4th year. We'll do it with ADHD Australia, New Zealand, Hong Kong, Singapore, and it gets better each year. And so thank you for doing it,
Henry.
It's I'm live the whole time. I get tired. No, you never know. I'll get.
Yeah, well done, Henry. Because
no,
this is a shift, and thank you for bringing this together. Because I don't know how you do it, but
well, we're both in this fight together, right? Positive change for neurodivergence, and actually something that was very depressing, which was a couple of sessions before you, was at the start of today, was talking with other charities around the world and comparing notes, and in every single one, they have significant forward progress, and except us, where we are very clearly having to play a defense game, right? Where we're seeing ADHD services get cut. We have seen them cut in Scotland. We've seen them reduced in England, in Wales. There's we're seeing cuts particularly around adult services, and we saw absolute terrible response to the issues around ADHD medication and the stock issues. And in government, we're getting you see people blaming us for benefit rises.
Yeah,
and
look at what's going on with SEN. And I mean, we sort of jump 2 steps forward societally and 3 steps back in terms of infrastructure, support, government policy.
And we're obviously in a time of massive governmental change and the potential for big changes in there. And Wales, obviously, with elections next year. And
we need more neurodivergent politicians, and things might.
We do, and we had one on earlier who said, like, it's not only about the big initiatives; it's about making sure we're considered in the small things where we're putting through a law or a change, and we think about neurodivergent people and how it's going to impact. And that takes you being at the table. And so, absolutely, we do. I agree. Okay, you've got to go. Thank you so much. You're amazing.
Thanks,
it has been an inspiration talking to you. Have a great rest of your day. And,
thank you very much.
Thank you. Goodbye, Ben. He is amazing, like properly amazing. And you can see the deep thought that has gone into him and what he's doing now, and the consideration that clear, huge intellect, focus on understanding himself and understanding how to get what he wants to achieve done. And it's just wonderful, and genuinely inspirational. And I totally, honestly, could have just kept on going. I totally would have. Right, let's get back on track, and we overran slightly. We've got Kay Hayes talking, and she's I'll introduce her properly in a second, but she is absolutely fantastic and someone that I've talked to over many years, and really excited for her session. It's we've just been talking to Ben about seeing yourself properly, and talking about how he builds his companies, the community within them. We are nothing as a charity without the ADHD community, and that we try and put together our groups, our support groups. With that in mind, then we've got How to Select and Work with an ADHD Coach by the absolutely amazing Esther Barrett, and after that's NeuroChicks, Catherine McGarden and Lex Harvey-Bryn. So very, very excited for all of that. Right, I need to bring in Kay. She is, and I think she's going to introduce some people as well. So first off, Kay, how are you doing?
Henry. Hi.
Well,
Hi.
Absolutely great to have you. I'm sorry we ran a little bit late.
I was so loving listening to Ben. I mean, what a true inspiration. And I love seed-lit drinks. I mean, they've totally changed my life in a way, because like you, I always used to hate those sickly drinks, and lime and soda tended to be my go-to. But yeah, the seed-lit drinks just changed the way I work. And I think I always want to be self-employed now, but if I ever go into employment, I think I'll be knocking on Ben's door, because the company sounds amazing.
It sounds like you can perform as you want to perform. Like you can do it the way you want to do it, and achieve those results. Like it's right. I got to do the proper introduction.
Okay.
Seeing. So this segment with Kay is seeing ourselves clearly, the transformative power of community with adults with ADHD. And as I started to talk, and then I realised I should talk with you, that in our support groups, like this is something we look to do. So we've taken the positive side of that. We're meeting virtually so much more now, and we create groups based on community. Those vary from ADHD in women, which are some of our biggest groups. We have ADHD in men, but we have ADHD in learning a musical instrument. We have ADHD in the Polish language, ADHD in the Romanian language. We're looking to bring people together on commonality to help foster that community and make a difference. And so we are in this. So But as you talked about, feeling like an outsider is a common thread for us, for neurodivergent people, right? It's difficult. We find ourselves like tripping, like find ourselves like, and Ben talked earlier about eye contact, like that, you know, you discover that you're not doing something that's essentially can lead to you being ostracized and cause massive problems. You just don't know what it is. You don't, like, and no one, I find often people won't tell you. And I've definitely had conversations. I'm like, right, I'm neurodivergent. You need to, like, this was a political, slightly difficult situation. I was like, just please, can you just be clear? Just tell me what you want. Like, and I remember at the end of that meeting, they were nodding and smiling. And I was like, you think we've agreed something? You think we've, and like, I haven't, and I don't know what it is. And it was one of those, like, time was hard end, and I was like, and it went straight towards disaster.
Difficult.
Right, you've got slides, and
you've got slides, yeah.
And you've got people.
Because I always get a husky voice when I'm nervous, so I might keep pausing to have a sip of water, but yes, I have got something to say now.
Yeah, I'll drop them in. You can then control them, so they'll come in about 30 seconds.
Oh, okay.
So do you want to do an introduction to your to it, and the slides will arrive, and then when you over to you.
Okay. Thanks, Henry. Well, I'm really delighted to be asked, because this is the 4th time that I've spoken at the Global ADHD Conference, and this is probably the subject that's closest to my heart, because I've just spent my whole life not feeling like I belonged, really trying to fit in and never feeling like I fitted in. And even after all my training and knowledge in the coaching world, I still couldn't quite figure it out. So I'm going to be talking through my own story. And we originally had 2 people who were going to talk afterwards, after my slides, about how they found being part of my group. But we've got one in the videos now, and then one. So we've got Sarah in the videos, and then Lucy will be joining us live afterwards to talk about her experience, because I think it's always better to hear from other people, you know. And we're natural storytellers, aren't we? We like stories. So yeah, there we go. Are you ready to share, Henry, or shall I share my own screen?
Give us 2 seconds. They're processing.
Okay.
They will be with you. But we've had some issues because you're going to play some video. So that's the bit I'm nervous on, which might be the bit that's causing the processing issue. But if you're happy to talk to your first slide, it will appear. I say momentarily, but like it should be in just 1 second.
Okay. So I chose the title about mirrors and having true mirrors, because I really feel like for many of us who are neurodivergent, it's like we've been looking at funhouse mirrors all our lives. So we've not seen our true reflections. We've been reflected back and projected back as being too big or too small, or we have 2 heads, you know. And for me, finding real safeness and belonging in a group for the very first time really helped me to kind of understand that power of mirrors. So here we go. I'm going to have to take my glasses off, actually, because I have varifocals on it. It means I can't see the screen when it's that small, but we'll give it a go. Okay, so seeing ourselves clearly, the transformative power of communities. It's all about mirrors. So a little bit about me. Other people used to think that I was so confident, and I used to believe I was really confident as well. But actually, it turns out, a bit like Ben was saying earlier, that it was all a performance. And that performing all the time left me absolutely exhausted. It led to anxiety, to depression, to repeated cycles of burnout. But I felt like I was confident. I could never understand it. And I could also never feel like I fitted in anywhere, whether it was, you know, brownies and guides as a kid, or the dancing I used to do, or school, and I could never find the right career either. So wherever I was, at work or at home or in groups, I never quite felt like I fitted in or belonged. So that was a little bit about me. And then after this whole lifetime of not fitting in my 50s, whilst I was studying on a master's during lockdown, actually, I just had a massive breakdown and burnt out really badly during the COVID lockdown as I was homeschooling my kids. And I decided I wanted to look into positive psychology and coaching, I think really to sort of understand myself better. And then I thought if I get a job out of it, then that would also be good. And that's when I realised I was neurodivergent. You know, staying up to do my essays till 4 and 5 in the morning, and you know, in my 50s, which meant that I was then completely exhausted for the rest of the week. And that opened up so many other things. So I now work, after studying all this for several years now, I work as a neurodiversity coach, and I also supervise other neurodivergent coaches. And more I facilitate groups, because I really feel like that groups are the place of healing and connection and growth for us. I'm also a single parent of two neurodivergent teens who've both struggled to be in school at times. So I've really had to learn to not rely on my willpower and discover this thing that I call way power, which is really sort of tuning in and connecting to your purpose, your why, as Ben was saying about as well. And, you know, sort of not having to dig deep and push on and be exhausted all the time. So these are my coaching qualifications, and there's a lot there, right? I don't expect anyone to read them, and I'm not sharing them to tell you how brilliant I am at all. I'm sharing them because even with all that knowledge, I still couldn't figure out why I didn't feel like I belonged anywhere. It was never covered on any of the courses. And like what I learned in my positive psychology masters was that we are all wired for connection. Human beings have got this deep biological need for connection. And I know that I've always carried this longing to belong as well. But I know I've also carried an equally deep fear of rejection. You know, and every time I was in a group, or even with one other person, I'd be thinking, oh gosh, do people like me? Am I being too much? Am I taking over? Am I not saying enough? Am I interrupting people? Like all this stuff would go on in my head all the time, even with all that knowledge and studying and research that I'd done. And one of the things that I found really hard to capture is it's almost like it's a felt sense, really, that goes far beyond words. So it means it's difficult to articulate. And also this sense of what I used to call, and in fact I refer to it later, strained belonging. So it's like we belong, but we're almost kind of like on the edge and we can't quite let ourselves go, but it's underneath our conscious awareness. So we're not necessarily aware of it. So therefore we can't change it. So you probably can't see this, can you? I'm going to read it from my PowerPoint because the first time I ever was part of a group and felt like I belonged was such a massive, impactful experience for me. I actually wrote a letter of gratitude to the trainer, and it was back in September 2023. So I wrote, I wanted to express my deep gratitude for the space, community and energy you created during the training. I now realised that I'd felt truly seen by everyone there, and this is what made the experience so uncomfortable for me. When I was first introduced to coaching, it took me a while to get used to being heard, and I always used to cry immediately when someone heard and validated me. But being seen was next level. This is why I found it so hard to look into the eyes of everyone else, because everyone was seeing me. And I felt almost unbearingly vulnerable. Now, Lynn, who ran the training, she introduced me to this idea of a boundary rope, a psychological boundary rope. And so I had this around me in her training. And I've actually got it on the floor today because I know it's a global audience and I knew that I'd feel quite intimidated. So it's about having a psychological boundary. And this psychological boundary rope helped me feel less raw in my being seen in my wholeness by other people. It was your ability to create a level of psychological safety that I have never experienced before, where I felt almost physically held, that enabled me to show up in a group with no masking for the very first time in my life. So you can see it was absolutely huge for me. And finally, it was almost like having felt that, I could put it into words what that was like. And having put it into words, I also shared in my journal, I often write haikus when I'm journaling. I find that they're a really nice way of getting to the essence of something. So for me, being seen means I can stand in my truth in this vast expanse with no blurring at the edges. And also what I recognised was that when I was able to be more open and not mask, I was able to then connect to other people more. So I wrote an opening bud, tender, tentative, allows others to open. So there was something in me that was really moved by being in this group, and it was only a weekend's training, so it was really impactful to me. So I wanted to experiment, really. Was my experience unique? Could I create a space that offered other people the safety, that acceptance as I am that I'd experienced, that validation, and that hope as well? Because I just was left with this huge sense of hope that I could continue growing and flourishing from this experience. And beyond that, more than that, I wanted to get to sort of the beyond words stuff. Like, could I recreate that magic of truly belonging and the deep healing that can come from being seen in a group? So I ran an experimental beta program. This was earlier this year. It took me quite a while to kind of work my way up to it. And I invited 18 of my coaching clients or ex-coaching clients, 10 of whom signed up. So you'll hear from Sarah, and then you'll hear from Lucy live after this presentation. And it was only a 4-week group program. It was literally, I just wanted to test it for 4 weeks to see what would happen, you know, if I went in with that intention. And as part of that, we actually co-created a sailboat, which acted as a visual anchor for all of us to navigate the seas of life when you're late diagnosed, because as we know, the seas can be really rough and tumultuous when you're late diagnosed. And I called it Find Your Way Power, because for me, finding my way power as opposed to willpower had been really helpful in me steadying my ship. And it turns out, no, it wasn't just me who experienced this. So I just want to introduce Sarah, and Sarah will share a little bit about how she found the first program. Now, can I get this to play? That is the question. Henry, or is anyone there to see if we can get this to play? Because it'd be really good to hear from Sarah directly. She's got a lot of really good stuff to share.
Hello.
Hello.
Let's see what we can do. I'm not sure we can.
Oh no. Could I have a go?
Yes, absolutely.
On my laptop. See if that works. It would be really good to hear from Sarah. She's I'm unable to share the screen.
The excitement of I think I've got it actually. So I'll play it now. Okay, so give me 2 seconds.
Fantastic. Thanks.
We'll have to talk amongst ourselves very quickly. Get rid of that. My screen and do it in a specific way.
It's not, you know, I keep forgetting about that.
My childhood was really lonely, and I never felt like I belonged, but I didn't know why. It's not, having ADHD is not like having any other difference or disability, because, you know, if everyone else can run and you can't, and it's because you've only got one leg, you can see that. But when you can't do the things that all the other kids can do, and you can't see why, you don't know you're any different from them. You assume your mind is the same, but something just doesn't click. And I just never did click, you know, with only a little handful of people. And I never knew why those people I did click. I just knew that there were some people that I could relax with, even as a child, if I'm talking about 10, 11, 12, and be myself, completely be myself. There were only a handful of people. And then as I got older, life went off the rails quite badly, largely due to this undiagnosed ADHD and all the baggage that went with it. And I tried to feel that I belonged. I was desperate. I was so desperate. I felt like the odd one out in my family, in my own nuclear family as well, which didn't help. So it really felt that I was the one at fault here. That it was my fault that I wasn't fitting in anywhere, because if you don't even fit in with your nuclear family, you know, where do you belong?
Yeah. I think a lot of us feel like that. Really do. So what I'm going to cover today is about what we know about relationships and connection, why it's especially important for people with ADHD, and what those challenges are when we've got ADHD. And then what's useful for us to know as individuals with ADHD, what's good for us, that we can kind of like own it and sort of understand it. And then a little bit, I'm going to include a few tips for group facilitators as well to increase psychological safety if you're running a group with neurodivergent people. So why relationships matter? So one of the most watched TED Talks of all time, with over 50 million views, is Robert Waldinger's TED Talk, What Makes a Good Life? And he's the director of the Harvard study on adult development, which is the biggest, longest study of adults ever. It's been going for over 75 years now. And his key finding was that good relationships keep us happier and healthier, period. End of, nothing else. And he actually has 3 key findings. I can't get my slides to move now. There we go. So the first one is that social connections are better for our health and well-being, and loneliness kills. It's that simple. Loneliness kills. So we need social connections for our health and our well-being. The second one is that it's about quality. It's the quality of those connections. So having higher quality and closer connections is more important than having lots of connections, which of course very often we do these days in days of social media, right? So it's the high quality and deep close connections that are important. And the third one was that good relationships are as crucial for our brains as they are for our bodies. And this is true for everybody, whether you're neurodivergent or not. But for neurodivergent people, it's probably even more important. Oh, my slides keep getting stuck, Henry. There we go. So Dr. Ned Halliwell, who wrote ADHD 2.0, and I'm sure many people watching this will know really well, he talks about connection as the other vitamin C that we all need. It actually appears on his clinic's treatment page alongside medication and coaching as one of the treatments for ADHD. And he says that human connection is one of the most important components of us living well when we have ADHD. So why is it harder for us when we're neurodivergent? Because we are wired for connection, the same as everybody is. It's just that we're wired differently. So with my sailboat that I co-created with my 10 people who came on my first cohort, we're going to look at 3 of those parts that are really important. And the reason I'm focusing on these is because they're all under our conscious awareness. So we're going to look at the hull of the boat, which is our sense of safeness and belonging. And then we're also going to look at the deck of our boat, which is our sense of self. And we're going to look at masking and our lack of reflection for ourselves. So this is where the mirrors come in. So this is our deck of our boat. And then we're going to look at the buoyancy of our boat, which is our sensitive nervous and sensory systems, and specifically how this shows up with our persistent drive for autonomy, or PDA. So it's the nicer reframe of PDA, and also around rejection sensitivity. I'm not going to go into too much detail with this because I know somebody's covering RSD later. So one of the things I wanted to talk about was the difference between safety and safeness. Because very often groups focus on safety, but don't necessarily consider what safeness is. And the easiest way I can explain the difference is to sort of imagine an earthquake and thinking of a young child getting rescued. So when the rescue worker has pulled that child out of the rubble, he's safe. So that child is feeling safety. But it's only when he's handed to his mother that he starts to cry, and the kind of the full extent of his experience will hit him. And that is safeness. So it's really quite different. And this shows up in groups. So safety is very often like the measurable, contractual and procedural stuff. It's about rules, about clear group agreements. It's about things like confidentiality, maybe having a zero tolerance policy. And it asks the question, am I protected from harm? So when you're thinking about safety, it's how am I protected from harm in this group? Whereas safeness is like the beyond words stuff that I was talking about earlier. So the question here is, do I feel safe enough to be myself, rather than do I feel safe and protected? So it's almost, I almost feel of it like it's almost like a softness in the body. It's permission to be yourself. It's how our body and our nervous systems feel when we sense warmth and trust, and then we feel able to connect and be curious and play. So it's, again, it's quite difficult to articulate. It's the beyond the word stuff. And healthy groups and relationships need both. So we as humans need both. So the safety piece without the safeness can feel cold. So I don't know if you've ever been in a group or a setting where you know all the rules are in place, but you somehow still don't feel welcomed. And safeness without safety can feel warm, but it might feel a bit unstable. So one way to think about it is that safety is the scaffolding and safeness is the settling. And our bodies and nervous systems really know the difference between both of these as well. So I wanted to show you that from the very first session, group facilitators can sort of bring this in right from the very beginning. So this is a copy of the slide, one of the slides I had in our first session. So you can see it was called Grounding and Gathering, and it was about, we had a settling practice where I got people to titrate being connected with themselves and also being connected with the group. Because very often after a meditation, the teacher will say, open your eyes now, and you're suddenly in the group, and it's kind of like I've lost that connection with myself. So there was a real titration process. And then we had, I went through what our 4 founding principles were, my suggested principles, and then we had discussions in pairs about what we wanted to create together and then fed back to the group. So that was like one of the main sections of our first group programme. I'm going to share the 4 principles now. So the first one, I'm sorry, this is very sticky, these slides, so it's taking longer than it would normally. So the first one is around radical acceptance. So this was one of our founding principles when I ran the group. And I said that it was on many levels. I wanted people to radically accept themselves and whatever emotions emerged in the moment. And also to accept all voices in the group, even if people didn't necessarily agree with them. And also to radically accept whatever emerged in the moment. So both me as a facilitator and the group, sometimes things would kind of want our attention, want attending to, and to radically accept that in the group as well. And I also talked about the second principle was about many mirrors. So this idea of having mirrors reflecting ourselves, because we've been used to funhouse mirrors, which I'll come on to. And this required honesty from us as well, and courage as well. And then the third one was about us as a group being all one. So a group is a concept in itself. It's greater than the sum of all of us put together. And the aim of the group is to accelerate and amplify our learning for all of us. And that when one of us has a realization and a learning moment, we all share it. The whole group learns. So that's the power of groups, really. And then another contribution we wanted to make was about the sort of the legacy of the group going out into the wider world and really sort of thinking about the ripples that would happen afterwards. So these were the 4 founding principles, and I'm going to let Sarah talk again about how she found those principles. So apologies, Henry.
And then I got a diagnosis, and then I found a group where I did belong, and I felt it right from the start, just sharing with other women the experience of being late diagnosed and the grief of it, and knowing that it wasn't me being an idiot all that time. And other people shared that and mirrored it, showed me that they felt the same. And that was amazing. And well, I can say it's you, can't I, Kay, at the group facilitator, you're the group facilitator, and right at the very start, you laid out principles for the group. And the most important one for me was hearing the words radical acceptance. I had never felt that I had that from anyone before. Radical acceptance, be exactly who you need to be. And to be able to do that in a community of other people also sharing that experience probably for the first time was really magical.
Oh, it still gives me goosebumps every time I listen to Sarah say that. Because this is real. People have carried this stuff for years and decades, you know, and then suddenly to feel seen for the first time is huge. And I just want to make the point that safeness doesn't need to be complicated, okay? It does need to be named and acknowledged. And there needs to be a discussion about how you're going to co-create that in a group. And also there's a place as well for the group facilitator to role model that out. I think that's also a really important part. So moving on to the next slide, if it wants to move. There we go. So we're onto our deck now. So this is the second point. So our deck of the boat is our sense of self. And I really want to explore masking because it comes up so much in groups. We're so used to performing. So what I thought was confidence at the start, if you remember my story, it wasn't that at all. I was performing to the point that I did not know that I was performing. So very often masking is kind of suppressing our autistic or ADHD traits to appear more neurotypical, so that would be accepted. It's learned over decades and decades. It starts from a really, really, really young age. And it might start off as conscious masking, but over time it becomes unconscious. And really crucially, it becomes a deeply embedded part of us and a part of our survival strategy. It's how we keep ourselves safe in the world, by masking, by not being ourselves. And that's so sad. Like, just saying that out loud is kind of just acknowledging how desperately sad that is. And yet it's true. So masking protects us and keeps us safe, and that's why we've used it in the past. And it also comes at a cost. So we can become really disconnected from our authentic self so that we don't know who we are. You know, Ben was talking earlier about how he finds socializing really exhausting. And this is one of the reasons why it can lead to deep exhaustion when we're constantly masking all the time. You know, the research shows us that masking is connected to increased rates of anxiety and depression. And another problem with it is, although we're longing for deep connection, what happens when we're masking is we make only superficial connections because people tend to connect to the mask of us rather than the real us, and then that causes difficulties for us again. And in terms of the impact on groups, what happens is when we're masking is that belonging to a group becomes conditional. And we have this kind of belief that we'll only fit in if we hide our true self. And that's where the exhaustion, the burnout, the shutdown comes in. And that's why many of us actually withdraw from groups, because we just find that they're too exhausting. And masking goes so deep that we don't necessarily know the extent of it. So I'm going to bring up Sarah again, because she talks about how she'd never even heard her own voice before.
Yeah, and do you know, I've only just realised, Jenny, it's all these layers when you start to unpick it, that when I'm in the group, the WAPAT group, I don't ever spend any time thinking or feeling like my voice, literally, it used to sound like other people's voices. My accent would change. The timbre of my voice would change. And I never really knew what I sounded like, for sure. And now I know, because that's the voice you all hear in the group.
It's just so desperately sad, isn't it? Somebody can live a successful life and not know actually what their true voice sounds like. I just want to make a point that obviously this stuff goes back decades and decades, especially if you're late diagnosed. This is really tender work. okay, because it goes deep. So it's really important that we're compassionate and gentle with ourselves, because masking has kept us safe up to this point. So just a real invitation to be mindful when you start to explore your true self and start to experiment with unmasking, that you know that you feel safe and supported. So it's just like a little caveat really about keeping yourself safe. Just some tips really for group facilitators. Masking is invisible usually, and people can appear confident like me, but actually they're deep in survival mode. And the cost to people is absolutely huge. And my one thing would be to say, don't ask people to unmask, because it is so tender and those masks have kept people safe for so long. I think our role as facilitators and peers as well is to help create that container of safeness and not just safety. And perhaps people from there can then start to explore their true selves, rather than kind of inviting people or asking people to unmask. So yeah, there we go. So I just want to move on to the other part of the deck, which is about our sense of self and mirrors. And a lot of this stuff comes from Donald Winnicott, who was a childhood development researcher and is like a real pioneer. And he talked about the true self and the false self when we grow up. And our true self comes from our caregivers' living emotional mirror, where they mirror back to us when we're very, very young, like a babe in arms, so that a child grows up knowing their authentic self. But for many of us who are neurodivergent, we might have had neurodivergent parents, we might have had trauma in the family, there's all sorts of issues that very often we might have had distorted mirroring from parents, or even absent mirroring altogether. And this creates what Winnicott calls a false self. And what happens with a false self is that then a child starts to obscure their needs, so that they don't know what they want, because they're being compliant, because they know that that will get them loved. And it creates a really strong sense of shame. And this is like the start of the journey to this lifetime of not being seen that many of us have. So I sometimes talk about funhouse mirrors, because even in adulthood and in our neuronormative society that we live in, which is not at all neuroaffirming, we get reflected back to us that we're too much, or we're too big, or we're not enough. And what happens then is it exaggerates our challenges, and it minimises our gifts. And our self-worth then becomes dependent on being externally validated. We don't have our own self-worth that we would have had if we knew what our true self was. So this disconnection from our authentic self also leads to a loss of agency, and even more difficulty then finding our community. So it's a really cumulative effect. So in a group with true mirrors, so we've got a neuroaffirming group that's got safeness and safety. And this group can then provide true mirroring, and that creates a really powerful container for people to discover and start to express their authentic selves, which is huge. And a group provides a multiplicity of mirrors. So there's Irvin Yalom is a group psychotherapist, and he's written lots of books on group psychotherapy. And he talks about groups being a hall of mirrors, where group members receive feedback from all the different sources. And that helps people distinguish between maybe distorted projections that they've internalized from their past and their genuine qualities. And this group gives us much more understanding of ourselves than a single relationship can ever provide, because it's multiple. So it kind of amplifies and resonates as more and more people are in the group. And then there's also the role of mirror neurons, which is really interesting. So this role of neurological mirroring. So when you're in a group and you're feeling that safeness and connection, we witness other people's authentic expressions. We witness their emotional experiences, those aha moments. And our mirror neurons in our brain create this empathic resonance that helps us understand our experience and our feelings and helps us validate those. And this process is a real gateway to opening us up to compassion I know I've read so many things around ADHD that say be more compassionate, but they don't necessarily say how. And this is a really good way of kind of increasing that compassion by seeing ourselves as others see us. And true mirrors can also correct what was missing in childhood. So if you've had a really, a traumatic childhood and your family of origin didn't provide that in the beginning, groups can provide a real opportunity to have that healthy mirroring that was missed in our childhood. And we can be seen and accepted and valued for who we really are. And they also create safety for authentic expression. So this is around neuro-affirming environments, okay? So neuro-affirming environments can normalise the different ways that we might have around, Henry, you were saying before about eye contact and things like that. So we might have different ways of processing, different ways of communicating, different ways of relating to other people. And it normalizes that's okay. We're neurodivergent, we have different ways of doing all of those things. And it helps prevent the re-traumatization that happens when sometimes people have to mask repeatedly and repeatedly. And they also, and this has been really key with the first group that I run, it enables us to challenge our internalized ableism. Because what happens is group members start to question all those negative messages that they've internalized about their neurodivergence. And they start to see their traits as differences rather than deficits. And it really is truly magic when you start to see it in a group, when we start to receive other people's acceptance and, what Carl Rogers called unconditional positive regard. It is pure magic. It's like, I can't describe it any other way, really. It is pure magic. So I just want to share Kelsey, who really wanted to be here today, but she has lots of chronic health issues and she's not well enough to be here. But what she shared was that she normally struggled so much being in a group and to be online as well for that amount of time. But because of the mirroring, because of that safeness, her chronic conditions didn't impact at all. She was able to be present. And as she said, my heart feels full with love and compassion and care that I've received. And that is huge for me. Getting a bit emotional reading that as well. And I just want to very quickly go through these because I know somebody is covering RSD later, the rejection sensitivity, but also this idea of the persistent drive for autonomy, or it's called pathological demand avoidance in the medical literature. But it's about our nervous systems and our sensory systems, again, totally under our conscious awareness usually. And they both often lead to an increased risk of withdrawal or avoidance of groups when the demands feel overwhelming. So rejection sensitivity, we all feel it very differently, but what can happen is that the situation can feel overwhelming to us, even if it seems small to other people. And it's very often accompanied by shame. So what you see from the outside very often, if I can get the slide to go, is a fear of rejection, that holding back. There might be more masking or sometimes sort of lurking. I'm a group lurker. I'm an edge dweller, and I quite often lurk in groups because I don't want to kind of, go in and be too much. So there's very often a holding back. There can also be overthinking or rumination after the group. Did I talk too much? Was I too big? Was I too loud? Did I interrupt people? All of those things that I shared at the very beginning. And then also, like I said, avoidance, this desperate wanting to be liked, the people pleasing, the fawn response in our nervous system as well. And also hypervigilance. So what often happens if we've got high rejection sensitivity is where we're not fully present because we're kind of constantly scanning for any signs of criticism in tones of voice or people's behaviour, or even in the environment, even the way that the chairs are set out in an in-person meeting, for example. This can all trigger our rejection sensitivity. So just a few things to bear in mind as a group facilitator. So I think it's really helpful to name the rejection sensitivity so that it reduces the shame. Members know it's not just them, like to actually gently name it. To have clear group agreements around things like interrupting, which I know we do in the ADHD UK groups. And, we can come back if repairs needed. And I think also just to recognise that RSD can sometimes look like over politeness or compliance, because it's associated with this people-pleasing thing. So it doesn't necessarily look like people feel rejected. It kind of can come across as being over-polite or very compliant. And then I think it's really important that we role model our imperfections and how we own it. So we're not over apologetic. So if we forget things or our slides get stuck like they did earlier, you know, and, you know, the slide doesn't work, actually owning it rather than being over apologetic. So just offer reassurance, gently bring people back in. And I think as well, just making sure that the quieter voices are heard, even if it's not in the main group, then have, you know, breakout pairs or smaller check-ins. Just make sure that everybody feels included there as well. And then very quickly, PDA. So this is a profile where even small demands can trigger very high anxiety. So this idea of persistent desire for authority. So even when a person really wants to engage, it can lead to resistance, it can lead to shutdown, withdrawing, it can lead to anger. Because what happens is the person gets in a fight or flight with their nervous system. So in group settings, and I used to be, this is me, this fun activities, I used to hate the idea of forced fun at work. So fun activities used to spark my anxiety so bad before I knew anything about neurodivergence. So just being mindful of that some things can feel overwhelming to other people. There's often a fear of being controlled and then masking to cope so that we hide our distress with this, which then leads to burnout as well. And then this idea of strained belonging, which I mentioned before, that we want connection really badly, but we often struggle with the pressure that comes with it, this pressure of being in a group. So we want it and we don't want it. Like a lot of things with ADHD. So what you might see from the outside as a facilitator or as a peer might appear as rudeness or lack of interest or not caring or laziness, which again, all sound very similar to traits with ADHD, don't they? But it's almost like doubled. And then this judgment from others can cause even further disconnection. And it reinforces that outsider feeling that we already had to start with. So for group facilitators, I think it's really important that we use an invitational tone and we have very low demand structures. So whenever I'm sharing something in a group, it's always, I use words like perhaps, maybe, you might want to, would you like to, rather than saying this is what we're going to do. Doing self-paced sharing, so not expecting everybody to share, but doing it in a self-paced kind of way. And giving people options, emphasizing choice, so people don't have fixed instructions. And really a gentle facilitation is really helpful with this. And then also a flexibility in how people are able to participate. So doing nothing or stepping back, observing, and then with the option to rejoin later is always really helpful if people have got this. And I think as well, respecting when people don't want to join in. Not shaming people, not pushing people, but just respecting people's choices there. And I think really celebrating the different ways that people might show up. So belonging to a group doesn't mean that you're going to take part in absolutely every activity. You know, it's all down to the individual. So considering all these things takes time, and it's so worth it. As you've heard from Sarah and you'll hear from Lucy, just this courage to show up authentically then means that connection can turn into a resource and not a drain for our energy and resources. Oh, sorry, it keeps getting stuck. So key takeaways I want people to think about are things like safety and safeness, the fact that supportive groups can be true mirrors, so that people can see their genuine strengths and their gifts, not their perceived flaws and deficits that they've had their entire life. That authentic connection is a biological human need. We all have it. And when we're mirrored compassionately, we can move from masking in our own time to expressing our authentic selves. We don't heal or grow in isolation. We heal and grow in connection with other people. That's what humans are wired to do. And I just want people to leave with hope. So yes, yes, whatever age you are, we can find the clarity, acceptance and agency that years of masking may have hidden. You really can. I'm seeing it time and time and time again. So I really want to emphasize that. that even with the most difficult of lives, we can still find this clarity, acceptance, and agency. I want to leave with a couple of haikus from 2 women that were part of the initial programme. I said that I often use haikus when I journal, and I invited the women in the group to write haikus in our last week. And we've got Jo there. The drowning woman finds herself supported by her very own sea change. And Sarah, who said, meeting other women who have hidden their light in such a safe place is bliss, which is just amazing. Makes it all worthwhile, right? All this extra thinking that we might need to have to do. And I'm going to leave with Lucy. Oh, no, I'm not. I'm going to be running the programme again. We're running another cohort at the moment. This is week 4 of 10 weeks, and we'll be running another group programme in January. If you can't wait till then, I'm going to be doing a mini sort of winter way power community. And if you head to Positively ADHD /winter, you can download a free Winter Way Power companion, and also then receive emails about the Winter Way Power community. So that's the selling bit done. Never very comfortable with that. But yes, but if you want to be involved, if this has really resonated with you and you want to be involved in a group where that is really prioritised, that safeness and authenticity and belonging, then that might be a good fit for you. And I can't get the slides checked. Oh, I was going to finish with Lucy on the last slide, but maybe she wasn't on the ones that you received, Henry. But fortunately, we have Lucy in person. We have the privilege and joy of having Lucy in person. So I don't know whether Lucy can join us. There you are, Lucy.
Hello. Hello. Hi, Kay. Hi, Henry. Hi, out there.
Hello. I just wondered, did you want to share a few words about how you found the group process?
Yeah, absolutely. So I was part of the beta group, and I'm now part of the subsequent group. And my experience of it has been completely life-changing. That's not an exaggeration. I might cry just as I say it, as I often do now in our group, having a long history of not crying. Yeah, I was only diagnosed 3 weeks ago, maybe 4 weeks ago. But a few years ago, I had the last of a lifetime of major breakdowns or burnouts. I now understand it was a burnout when my child was quite small. And in the 4 years since that time, I discovered belatedly about neurodivergence and thought maybe this, in fact, I recognised immediately that it fitted my picture. So I've had about 3 years of exploring it. I've had about 3 weeks of knowing for sure, even though my instinct. And luckily I found you in the last year, first as an individual coach and then this group. And I can remember entering the very first session of your beta group, and I couldn't sit still. I was fidgeting around. I kept moving room. I kept standing up and sitting down. I was looking at myself on the screen, feeling like a complete loon. And I then, when the opportunity presented itself, said, I'm really sorry, I'm so wriggly. Look, I'm doing it now. I immediately said, that's not just accepted here or tolerated here. That is absolutely welcome. And so from the very first moment, I'll get choked again. I felt seen in a way that I had previously, even just that wriggly me has always felt unacceptable. And I suddenly was not just accepted, but seen and welcomed. And the whole thing proceeded from there. And it was a very quick experience to feel belonging, which struck me as remarkable. But there was a recognition, I think, amongst all of us, wasn't there? There was this openness and this willingness and this, frankly, delight to feel seen and be welcomed. And it manifested in lots of different ways. You know, lots of crying on my part. Me and Sarah cried quite often and recognised in each other that a welcomeness that you created around vulnerability, the invitational nature of how you operate really resonates with me. I've only discovered PDA in the last month, and that is another thing that has, like a penny has dropped. So for countless reasons, it felt like a homecoming. It feels like a homecoming. Every time I tune in, I've learned so much just from your PowerPoint. Like, some of it's stuff I've heard before and I haven't properly learned it. Other bits are new, and I'm like, oh my God, yes. So there's also this sense in which I think when you come to things like, I'm 51, I've never fitted in. always been a bit kooky. I think I probably found lots of different ways to articulate that kookiness as acceptable, even though it didn't feel acceptable. That was part of my mask. But when you come to things really late and you feel seen and recognised, there is a grief process. But there's also this sort of, it's like a drink after walking through a desert, you know? It's like, oh my God, give me more. I'll take this water, you know? It's like an elixir.
Wow. I've got goosebumps again, Lucy. That's so amazing. I just wondered if you'd be able to articulate what difference it's made to the rest of your life. Are you able to speak a little bit to that, perhaps?
Yeah, I mean, I do feel like a new learner in terms of seeing myself through this lens, the neurodivergent lens. I feel like I've got L plates on all the time, and I'll give you an example from this week. I did something this week that was big. I went to a big funeral. There was a big drive on the way. There was a big drive on the way back. There were a lot of emotions, a lot of feelings. And as I was driving back, feeling like I've overdone things, I was overstimulated, I was emotional, I was feeling lots of different things, both belonging and not belonging as part of that experience. I came back and I was able to say, it's okay. We've got the group on Wednesday. It's okay. I can check in with some of this. I've got like this life raft, this boat that we're building, and I do feel like it's a collective. For me, it's an ongoing boat building exercise. This wonderful extended metaphor of the boat, and I was like, so it's all right because I've got that now. And I think life without that is like, I've been thinking about a different analogy to explain what it's like when you don't have that. And it's like being on a tight wire, like a high wire, above either no safety net or a safety net that's really gappy. So you know that if you fall at any point, which you're very likely to do all the time, because the high wire is really the mask, right? It's really this kind of performative identity that you've created to sort of fit in. Everyone else seems or like pirouetting on their high wires, and you're like, Christ, I don't know why I can't. You know, I'm hanging off it, or I'm, you know, I've split my difference and one leg's either side, or whatever. I'm not managing it. Scrabbling to get back up, but I know also that the net underneath can't hold me, and so there's this terror really, and that was what my breakdown, my last burnout was like. I've got a little girl, I'm a mum, I'm a single mum too. I've got to be all right, and I could see that my safety net couldn't hold me. The infrastructure wasn't there, the mental health support system wasn't there adequately. I was misunderstood and misdiagnosed and misrepresented. I couldn't represent myself, and so now that I know this safety net is kind of weaving together. I've been thinking about this analogy a lot today and thinking it's more like a trampoline now. I can get rid of the or I can hop up and try again, but it's like it's more of a tight weave and I can continue weaving it. I know that this is an ongoing experience of community building that I feel so welcome. I feel so accepted. I know. Do you remember I said from the very beginning in those sessions, how can we keep this going? Because I was like, my God, I can see it already. And if you can knit that weave more tightly, look at me knitting it with my fingers, then it can hold me. Then it becomes like a trampoline. Then it becomes something that kind of you can bounce with and you can play on and you can experiment in and you can do a flip and see how you land. And I guess the difference between that gappy net beneath a very high wire and a tight woven trampoline is it's fundamental, I think, to a safe life, to a life, you know, where I can grow. And the other thing that I think is really extraordinary about my experience of being in the group with you and the others is that so much of my life has been about coping and scrabbling and pretending to be all right when I wasn't and performing, you know, a type of all rightness, or a huge amount of people pleasing, which is my big masking identity, is this sort of performative teacher mode, perky, is everyone okay, you know, that. And that takes all my energy. And now I have a kid, that takes all, you know, there isn't sufficient energy for all these things I've been having to do. And so it's all been about coping and enduring and kind of scrabbling. And I see my way now with this boat that we're building and to, you know, mix my metaphors, and this more secure sort of base. I can imagine a life that is sustainable, that isn't scrabbly and copy, but it's like rich. And so there's a huge amount of optimism that I've not experienced anywhere else in anything I've accessed before, never in any mental health therapies. I mean, I like a bit of therapy, but not those kinds of group environments, or those not in my working world, not anywhere have I felt that sense of recognition and belief, but also hope, genuine hope, because it's built on a completely different sort of foundation, isn't it? A truth that previously wasn't even available to me, let alone the people around me.
Yeah, the true mirrors.
Yeah, it's a game changer.
Oh, thank you, Lucy.
I've been blown away by this. Like, thank you, both of you. Just absolutely extraordinary. And apologies. And yeah, okay, clearly the work you're doing is something very, very special. And thank you for sharing it. Thank you for the work. I have to say, it hurt me in the heart a bit, like one of your insights, which was that people connect with the mask, that you're making these false connections, and that they're connecting with a non-true you, and like the cost that, like, that's just it's an amazing insight, and frankly quite tough to listen to. It's a testament to how good it is. Thank you, well done for fighting the slides, and I can tell you the issues with us trying to help because of the video play issue. So I'm sorry for that. For you, you did a very good job on it.
It was okay. We got there in the end. I think we did a little bit, didn't we? Because it was a bit of a delay, but we got there in the end. So, and thank you.
Well, it's all about
what
you're doing. I thought genuinely, thank you, Lucy, for sharing your candor, and wonderful.
I'm so glad.
But I have to say goodbye to you, so we've got to try and hit our schedule. Thank you, Lucy, Kate, absolutely amazing, and obviously there's a reason why you come and to be kind and generous enough, and obviously we're so pleased. I think it potentially is just you and I who've been in all four.
Yeah, thank you.
So it's actually maybe in Darren Bull from ADHD New Zealand. Because he's but
I'll see you next year then, Henry.
I would look forward to that. Absolutely. I would not want to break the streak, especially what you bring is just amazing. Thank you.
Thank you so much.
You're extraordinary. Thank you. Bye, Kay. Right, onward and upwards. It's really, really exciting. So next up, we've got Esther Barrett. I'm very, very excited for it. She's talking about how to select and work with an ADHD coach. It's a question that comes up all the time. And she she's not only an exceptional coach, but she runs and has developed the training for ADHD coaches. So it's one of the, we'll shortly be going to be announcing that we invite people into our coaching community, but they have to have one of 3 qualifications, and that is one of them. It's an absolute testament to her. And then we've got RSD and overwhelm. Really looking forward to that conversation. And then the beautiful contradictions talking around ADHD. And so we've ADHD and autism. That's about the lived experience, and we've had just earlier more about the clinical experience. So really, really wonderful. We're just going to have some ambassador videos because we've had some wonderful people. We have wonderful ADHD UK ambassadors, and we want to share them with you.
I'm Claire. I'm from Essex, and I'm an ADHD UK ambassador. I'm currently navigating my own journey with seeking diagnosis for ADHD and autism. I decided to become an ADHD UK ambassador because I'm passionate about raising understanding, awareness, and acceptance for ADHD, and I want to share my own experience of navigating diagnosis, which is why I created Navigating Neurodiversity, a social media page to help others who, like me, are awaiting assessment and understanding their own journeys. My plans as an ambassador are to raise awareness when competing in the Miss GB pageant in 2 weeks' time, which is Miss Great Britain, and I will be visiting schools and local youth clubs such as my old Girl Guides unit to discuss stereotypes in neurodiversity, to share my story, and to listen to theirs to learn more about what their experiences are and what I can do to support them as an ambassador. I also plan to grow my neurodiversity page to support those with experiences like my own, to fight stigma and stereotypes caused by misinformation.
My name's Sarah Lavelle, and I became an ambassador for ADHD UK when I launched my picture book, Piff and a Puffle, in 2022 at the first Global Conference for ADHD UK. The book is about a pufferfish who learns how to embrace her ADHD, and this is something that I've had to learn, having been misdiagnosed, misunderstood, and many mishaps when I was facing the challenges of undiagnosed ADHD. And this is what I want to share with the world, stories that can inspire people to learn to celebrate and embrace their ADHD despite the challenges.
I'm Holly, founder of Atlas and an ADHD UK ambassador. From pursuing a private diagnosis and being diagnosed in my 20s came relief, compassion for myself and clarity, but in that also a sense of grief for the childhood that I lost and the support that I never had, for those around me that didn't know that I had ADHD or even myself. As an ADHD UK ambassador, I hope to help turn the tides for helping those feel seen and heard, and help support women and girls that often fall through the cracks and diagnosed a lot later than boys. Through my work with Atlas and ADHD UK Advocacy, Atlas commits to contribute to the growing research around women with ADHD and comorbidities such as PMDD. Whilst we gather the parameters for a study around women with ADHD with both PMS and PMDD, we ask for your help. Whether you are a woman diagnosed with ADHD in the process of a diagnosis, or you know somebody that is diagnosed with ADHD within reproductive age, we are looking for women who can take part in our study. The blood draw will be conducted free of charge. If you're interested in contributing to ADHD research and helping the ones that come after us not feel like the ones that came before, you can contact us at contact@atlaslaboratories.co.uk.
Hi, I'm Tanya Gerard, and I'm so proud to be an ADHD UK ambassador. ADHD has shaped how I see and experience my world, and I became an ambassador to use that lived perspective to raise awareness, challenge stigma, and overall build inclusive spaces. Through my work as a speaker, trainer, and founder of Tanya Gerard Digital, I focus on creating inclusive environments and making marketing more accessible, so ADHDers and other neurodivergent people can really thrive. And it's about making marketing accessible for all abilities as well. As an ambassador, my focus is championing accessibility and raising that awareness for practical change. Over the next 12 months, I've got some very big plans to run fundraising workshops to support the brilliant work ADHD UK do. ADHD Awareness Month is such an important time to really amplify our voices, share those really significant stories, and also celebrate our strengths. I'm so excited to be part of the global conference and to stand alongside ADHD UK in driving that real lasting change. Thank you.
Just some extraordinary ADHD UK ambassadors, and it's our privilege that they are ambassadors for the charity, and thank them for those videos and talking to people about what they're doing. And they are all just spectacular individuals. I'm very excited. Talking of spectacular individuals who are very excited about, welcome Esther Barrett.
That was a lovely greeting. Thank you, Henry.
Well, it's true. Like, I think you well know, because I've told you a few times, like, I think you're just wonderful. I think what you've been building is great, and I'm excited, and particularly excited you're doing this segment for us. It's a question you know full well comes up a lot. It's ADHD coaching, what it is and how it helps, and how to optimize that, like how to make that difference. So absolutely, thank you. And I think you've sent us in some slides, so I'm going to hand over to you. It'll go, the slides themselves will follow in about 20 seconds.
No problem, thank you.
You should definitely talk about things, otherwise it's going to be an awkward silence for us all.
20 seconds is quite a long time to be waiting.
Okay, we can talk amongst ourselves. I'll just be like, you'll see my eyes just going elsewhere whilst I try and work out. Whilst I have to grab all the things. So, but no, I'm very, very excited to have you here. And we've been talking over a long, long time now, and
we have.
it's and
I can introduce myself if
like. If
That sounds
helps.
great. When that stops us processing, you're on. Well,
Good to go.
Okay, over to you. Introduce yourself.
Thank you so much. Thank you. So while that's loading, my name's Esther Barrett and I'm an ADHD coach. I'm also an ADHD coaching supervisor and I train ADHD coaches. I was diagnosed at the age of 53 with ADHD after my son had been telling me for about 10 years that, Mum, you clearly have ADHD. And I was completely oblivious to the whole thing until the pandemic, when I started delivering teaching training online and had to look at myself on a screen much more than usual. And I noticed how much I moved and how much I was like putting lip salve on and drinking water. And you'll see me doing that today as well. And when I realized how much I was moving, I realized that everything started to sort of fall into place in terms of hyperactivity, struggling with inattentive, but also hyperfocus, realizing what RSD was. And then suddenly I was like, oh yes, I see it now. So 5 years later, I've come along today to just talk a little bit generally about ADHD coaching. And perhaps we'll go on to slide 2 now, just to describe exactly what it is that I would like to do today, which is something around finding a coach, but also something around how we might work together as well. So I've got a question for you on slide 3, which says, what is ADHD coaching? My slides don't have very much information on them, do apologise. So next slide, please. Lovely. Next slide, please. The pandemic did so much, didn't it, Pete? I know. Thank you for the smile comment.
And just coming back to you have control of the slides, by the way, if you wish to. If you hover your mouse over, you've got it.
Hover my mouse over. Yeah, thank you. That's brilliant. I've got control over the slides. That's brilliant. What is ADHD coaching then? It's a good question. We know that traditional coaching is all around setting goals, working out what reality you're in right now, what options and obstacles you might have, and then working your way forward, your willingness and working your way forward. So it is about the future. And the big difference between coaching and counselling and therapy is that in coaching, we're looking to the future. And it's incredibly helpful to have counselling and therapy. Of course it is. Helps us to work through what's happened in the past. But coaching is very much focused on where we're going next. Where are we now? Where do we want to go? And how are we going to get there? So you can see on the screen there, we've got words like goals. We've got plans. We very much try and take a strengths-based approach to coaching because a lot of people with ADHD really don't feel their own strengths or maybe identify them or even can admit or to themselves that they even have any strengths. We can have a lot of struggles around low self-esteem and so on. So having a look at barriers and challenges and trying to work out how to strategize for those. And also a big part of my coaching is around unhelpful, limiting or negative thinking. So helping people to kind of identify what are they saying to themselves, sometimes very harshly, and how can we help them kind of reframe some of those words that they're saying to themselves. So there could be new habits being developed there, new strategies, new ways of doing things, new routines, new ways of talking to ourselves. And all of that is kind of developing resilience because when you go into coaching, you might have 6, 10, 12, probably at the most, maybe 20 sessions through Access to Work, for example. But actually the point of the coaching is it's getting you ready for after the coaching. So your resilience or your tools and your techniques and all the things that can help you thrive in life, not just survive. So how will you find an ADHD coach? What do you need to kind of ask and where do you need to go? So you might want to have a look on the ADHD UK marketplace. Of course, if you're in this conference today, you know all about the ADHD UK charity and you probably know about their marketplace. And there are many excellent coaches in the marketplace. There are 2 versions of the marketplace. There's the regular marketplace for more experienced coaches. And then there's the low cost marketplace. If you're struggling a little bit financially, you might be able to find a coach that can work better for you in the low cost marketplace.
We know that a lot of coaches sign up to the Life Coach Directory, which is not strictly around ADHD, but you can tag yourself as ADHD within the Life Coach Directory. So I think a lot of coaches find their clients coming through there. So it's another place to look. There are specialist companies out there, probably a bit too many. You're probably sitting there thinking to yourself, if you Google something like, I want an ADHD coach, there is many, probably thousands of hits that come up for you. So there are some specialist companies out there who might be useful for you to kind of tap into as well. And then social media and community recommendations. We were just talking about community a moment ago and how important that is. And word of mouth is still probably one of the best ways to access any kind of service, really. Be that word of mouth through social media or through community recommendations and the likes of Facebook forums, for example. So what you might want to ask a potential ADHD coach is around their experience and their qualifications. So some coaches are much newer to coaching. Obviously, we've had, 2.5 years ago, there were no accredited ADHD coaching training courses in the UK. And I know we're from all over the world in this meeting today. But it's only really recently, certainly from a UK perspective, that we've had those kind of qualifications for people to be able to do. So we've got many new coaches on the scene, and that's brilliant because we're all learning together as a community, I think, how we want that coaching to be. So it's not just, it's a collaborative effort between our coaches and our clients. So ask what their experience is, by all means, with knowing that it's a fairly new profession. Having said that, there have been many ADHD coaches already practicing for a very long time who are very experienced and excellent. You might want to ask them how they're qualified in terms of the courses that they've done. It's quite good to ask them if they've done a specialist ADHD or neurodiversity coach training course. That could be the difference between having somebody who is nothing wrong with life experience, completely understand that. But sometimes that specialist course that can give you those tools and techniques to work with your client can be incredibly useful. Ideally, the coaching training course will have been accredited by a professional body. So that might be the Association for Coaching, the Universal Coaching Alliance, the ICF, or the EMCC, or even an ILM accredited course. There aren't any specialist ones of those at the moment, but I'm sure that will come. So that's a really good bunch of questions to ask when you're looking for a coach. And you might also want to know that they are a member of a professional body. So we highly recommend that coaches become members of professional bodies. Again, those bodies that I just mentioned a moment ago, the Universal Coaching Alliance, the Association for Coaching, and so on, if they are a member of these professional bodies, you can be confident that they have they're working to a competency framework, that they've been trained, that they've committed to doing CPD, continuing professional development, and that they are receiving regular supervision, which is very important for a coach, any coach, but for ADHD coaches in particular, it's very important that we have supervision, because actually we need support as well. We've got ADHD, I've got ADHD, autism and dyscalculia. I need my supervisor to support me, because sometimes there can be emotional situations, there can be ethical dilemmas, there can just be learnings. We don't know everything straight away, and we're learning all the time. I can see that somebody in the chat pane there is saying that as a professional declutterer, you had no idea you were working as an ADHD coach for 17 years. Amazing, amazing. I love that. Thank you for sharing that. Okay, so in terms of working together then, there's a few things that you might want to ask, again, questions, having a think about things like what is going on their website, do their style, their marketing, their promotions, does that fit with your values? Are they telling you what they need to know on the website to make you feel like you're really getting to know the person, for example? I can see that Claire has put into the chat pane, what about the quality of providers if we want to get ourselves some accredited training? There are several accredited training providers in the UK.
Well, that's exciting. I didn't. We've got an. Hello.
Hello, what happened?
I don't know. You disappeared. Had
I'm
to
back.
suddenly. Well, welcome back.
Thank you.
Let's put you back.
I'll carry on regardless. So yes, so what I was saying, have a look at their online profile, have a look, get the vibe, get the feel. Do they feel like the right person for you? And likewise, somebody in the chat pane just asked about accredited courses. So have a feel for that as well. When you go onto the course provider's website, you know, are they saying things that you agree with? Is the ethos or the values the same? Is it accessible? Is it inclusive? Is it neuroaffirming? So you will definitely want to have, if you're looking for a coach, you're definitely going to want to have a discovery or a chemistry call. So that would be 20 minutes, half an hour, just having a chat with your potential coach, build your rapport, you know, get a feel for their values. Do you have a connection? Do you have empathy? Have you got some energy going between you? It really can be very, very helpful to have that uncommitted, 20 minutes, half an hour with that coach. And I would advise you also, have a chat with 2 or 3 people. If that works for you, you will then see a little bit of differences and what's similar and what's different between the different coaches that you're chatting with. And you might worry about their RSD, they might worry about your RSD. So as long as you're both kind of clear in your boundaries, that it's a chemistry call and that you're doing it, so that you can find out if it's going to work for you, that's absolutely fine. The coach will not be offended if you feel like they're not right for you. It's not a good fit. It's got to be a good fit. So you might want to ask them when you're having your discovery call around the duration of the coaching, the kind of work that they might do with you, and the kind of models and tools that they're using. And many thanks to Parul in the chat pane there for saying that I handled it like a champ. I have been in learning technologies for the last 20 years, so it's like expect the unexpected when it comes to tech, right? Yeah, and I'm really liking Henry's hosting capabilities as well. It's amazing. So you might want to have a chat with them about possibly you might even want to write a list of questions. A lot of people who chat with me both about my coaching and about my course kind of have a little list of questions that they might want to ask just to be prepared for that initial conversation. So how do you work with clients? I've come across coaches in my travels who have done things like really focused on journaling, for example, which probably wouldn't work for me because I'm not really a journaling person. There are approaches out there that are focused around worksheets, which probably wouldn't work for me very well, but might work for other people very well. Explorations, tasks, strategies, homework, suggestions, advice and guidance. I'll come on to that in a moment around the amount of support that we need and the amount of holding of the space that we need as a client working with an ADHD coach. And that might vary depending on our needs and what kind of support that we need. So good questions to ask there. I advocate for a directive, non-directive coaching model, which is very much most traditional coaching happens around the non-directive end of the scale. So most coaches would say, yeah, coaching is non-directive and we're going to ask them lots of questions and we're going to bring it out of them. For my practice, I find that my clients need a lot more structure, scaffolding and guidance. And not all the time. Lots of really wide open, lovely questions are always there. And I'll show you my little triangle now. So questioning, listening, reflecting, absolutely at the top of the triangle is what we do as coaches, but underpinned by advice and guidance and psychoeducational information, because that's often what people come wanting and needing and is the most helpful. I always say I'm not going to spend 6 weeks trying to help somebody come up with the Pomodoro technique when I know the Pomodoro technique already exists. And another thing I always say is, if you're working with somebody who's ADHD, autistic, neurodivergent in that with those neurotypes, then asking wide open questions can be quite panic inducing and not possibly the best approach for that particular neurotype or that combination of neurotypes. So I recommend, I'm not telling you what to do, obviously, but I recommend if you're going for ADHD coaching, that more structured and scaffolded approach we find, and I've been doing it for 5 years, that works best for our neurodivergent ADHD clients. Another thing that's happening in the industry at the moment is that we are finding, because we now have a cohort of ADHD coaches, not to mention all of you who have been doing it for a really long time before our accredited courses came into being, we're finding that our ADHD coaches and neurodiversity coaches as well are kind of splitting into specialisms now. So I've put a few of those on the screen for people I know, people I've trained, but also people I know. Parents, so there are people specializing in working with parents, working with couples, teenagers, people specializing in stuff around hormones, workplace and career coaching, specifically ADHD, burnout. I have quite a few clients at the moment who are coming out of burnout. Working in nature, walking coaching, I love that. LGBTQ plus specialisms of coaching, holistic therapies, where people are kind of bringing together and blending various different kinds of coaching. Hypnotherapy, I've had a few hypnotherapists on my course as well. Somatic, it being of the body, somatic coaching is very useful for ADHD clients, because a lot of what happens to us is not in our brain, is in our bodies, right? I know it's a brain thing, but actually it's all of us. And then I know somebody that works with horses as well. So there's all sorts of different ways in which people are spreading their wings and specializing and bringing in old age. Gosh, that's such a good one, John. Thank you for mentioning that. I'm getting on a bit myself, and I'm in my late 50s, but I 100% take your point. That's absolutely brilliant idea. So I hope somebody watching is going to, go into that field. Now I can see that I'm a minute over, but I started a few minutes late as well. So I'll just come to. I'm going quite quick, I know, but it is coaching, so it's more informational. I wanted to mention therapeutic coaching, because many people who are training as coaches at the moment are also therapists and counsellors, psychotherapists and counsellors, and it feels like there's an explosion of therapists and counsellors who want to also add coaching into their idea. I've just been looking at the chat pane there, into their practice. So that kind of combination or blend of coaching and counselling can be an amazing thing. I don't do that myself, but I know people who do. And there's this idea of kind of looking to the past and helping somebody come to terms with the past and process the past. But at the same time, with the same practitioner, you can think about where you are now and how to go into the future as well. So I think the field of therapeutic coaching is very exciting, and I would be very surprised if it didn't almost become the norm in the future. It's there's such a rich seam of help and support that can happen, I think, between that combination of counselling and therapy and coaching. So I've managed to squeeze in half an hour into 22 minutes, which I'm quite proud of.
You should be proud of yourself. It's excellent.
I was going to ask if there are any questions. I don't know if I've got time to do that though, Henry.
Oh, there's always time for you. We do have some catching up to do. I don't know how it happened, but the morning just 10 minutes late from the start. So I will gratefully take a little bit of catching up. I'd love that. I think you can see that Esther's knowledge is very, very deep, and provides an understanding that is very, very insightful indeed. I did like the talking about finding your coach. I think she mentioned walking coaches, like just coaching whilst you walk, because actually a lot of us, movement is critical to allow us to be able to, that really helps us process. And I think it belies that, like, finding your coach that's right for you. I also very much enjoyed the talk around directed and non-directed coaching. Like most of us, particularly late diagnosed, I mean, we've tried all the to-do systems. We've tried a bunch, right? We've tried a lot of different things. We're not going to have some kind of epiphany and suddenly become organized. We need some directing. Like, I mean, I've had at that point when I was first diagnosed, 4 decades of trying to have an epiphany on organization systems. Like, it's just not like, you know, I remember, I can't, you know, I can't remember if I was talking to my GP or a diagnosis, but it was like, you know, someone was like, do you struggle with organization? Have you tried any systems? And I still remember my answer, which was like, I've tried every system. Like I've tried every single one I can find. Like if you've got others, I will give them a go. And later on, I thought, you know, that was actually a very good question. It's like, that feels like a very common ADHD experience. So I think that recognizing, I often talk about it being ADHD coaching being very similar to like having more to do with sports, that you're getting, you expect a sports coach to teach you to be a better coach and give you absolute direction on how to do that. But as you talk to, like sport has that psychological aspect too. And it's like, I do know a bunch of counselors, people trained as counselors who now have trained to become an ADHD coach as well.
Yeah.
And one of the big reasons they've done it is because ADHD coaching is absolute joy. You help people in really meaningful ways. And it's just a delight to be part of and to watch. You watch someone transform. You watch huge weights drop away, and it's lovely. Whereas in counselling, obviously, you have to deal with many awful, difficult, challenging things, and it is an extraordinary thing to do. But we have more joy in the coaching part. and I definitely know people who now are like, they won't tell you they're a counsellor as well. They just do the coaching because that's what they want to do because they love it so much.
It gives me a lot of joy, that's for sure. And training coaches and being supervising coaches as well gives me a lot of joy because then you can help more people that way too. And the dopamine that we get from those light bulb moments, Henry, is worth it all.
No, I actually agree. Like, and I talk to people sort of time. Yeah, I think it's a wonderful thing, and obviously I know the impact you have, and but your impact is multiplied because you're also training coaches, and it will shortly be helping us. You've already kindly volunteered, so I'm hoping you're happy I say this, that to get involved with our marketplace and help us develop it, because we know that we want it to be a really useful place. Constantly, as a charity, we're relatively young, we're in our 5th year, and constantly always trying to be better and better and better, and marketplace is one of the areas we're going to target next. We got to move on. Esther, I'm so sorry. Thank you so much. You were amazing. I've loved it, and I think you are an extraordinary person doing extraordinary things. So thank you so much.
Likewise, thank you.
Thank you. And we have to say goodbye, Esther. We're going to be going over to Catherine and Lex very, very shortly. They are next up. We have it's an in-conversation around RSD and overwhelm, navigating the hidden struggle of ADHD. In conversation with me, lucky them. After 22 hours of being doing this, they are definitely going to be doing the conversational work. We're then doing the beautiful contradiction, more on ADHD and autism. Very, very important. So many people are both. And then finishing up is the NHS and ADHD, an update on the local provision of ADHD. That is a big, big deal. It is Dr. Tim Kendall, CBE, who was, until late 2023, the National Clinical Director for Mental Health in NHS England. So he is going to be very important. Right, we are going to do some videos and introducing to you some more ADHD UK ambassadors who are absolutely extraordinary people doing extraordinary things, and we are thrilled about them. Please may I introduce Natalie.
Hey, my name's Natalie, and I'm the author of the book The ADHD Fight. So a little bit about me. So I got a diagnosis at the age of 27. I was missed as a child due to mainly being a female. They miss the signs because, you know, we're not boisterous. I was very hyperactive, always getting myself into trouble. And it wasn't until the age of 27 when I had my daughter that I really struggled with it. I got diagnosed with postnatal depression, and then eventually I got my ADHD diagnosis. So, like I said, it was a long road. It was really hard. So I basically wrote this book to spread awareness and to put things back. So this book is being sold on Amazon, and every bit of profit of this book gets donated to ADHD UK. So this is basically to spread awareness. It's a really easy read. As you can see, there's pictures in it. And it just goes through the facts of having ADHD, that it's just a bit more than hyperactivity. So yeah, I am continuing to fundraise. I have done a zip line which raised £250 for charity, and I'm trying to get some at the minute some training funding for where I work. So yeah, literally it's an absolutely amazing cause, and yeah, it's about spreading that awareness.
My name is Kirsty Northam. I am an ambassador for ADHD UK. The reason why I wanted to join and be an ambassador is because I believe that there are many people in the armed forces community who have ADHD but are not supported, and so I was hoping that by becoming an ambassador I can help to raise awareness of this. We also have a lot of families within the armed forces community, such like myself, who are SEND families and are in desperate need of support, trying as best as I can to form partnerships for our armed forces families and community members. Include serving members, veterans, cadets, and anyone who is within the armed forces family.
Hello, my name's Anne Diamond and I'm founder of Resilience Rebel and proud to be an ADHD UK ambassador. I became an ambassador because I wanted to have a voice and also to help others with ADHD to have a voice too, to advocate for themselves and to get the support they needed and their families needed to help them thrive and not just survive with ADHD. I couldn't access that support from the services I turned to after my late diagnosis when I was 52. So I've made it my mission to find the places and people where I do feel safe to unmask and learn more about how I can navigate living and working with ADHD. To get the support I needed to process my diagnosis, I had to pay for my own counselling and train as an ADHD coach. My employer at the time had declined to give me the reasonable adjustments I'd requested, which included a workplace assessment to understand my needs better and some other minor adjustments, instead opting to force me through an occupational health process, which I declined and left the job. I set up my own coaching and consultancy business. I was already practicing as an EFT practitioner and NHS health coach trainer, and realised that I could combine my skills and experience to help with the emotional dysregulation and trauma we experience as ADHDers. I now blend ADHD coaching with EFT and other mind-body practices and creative practices, to including poetry and creative writing, in my one-to-one and group coaching and wellbeing workshops. And I also offer consultancy on inclusive wellbeing support and strategy. In the past year, since becoming an ADHD ambassador, I've set up a local support group for women with ADHD, and I'm proud to have been invited to speak on several podcasts, radio shows, speak at conferences and events about being neurodivergent and how to support people with ADHD to prevent and recover from burnout. And I've had some really fascinating and sometimes heartfelt conversations with people. I've also spoken about the inequalities in diagnosis and treatment of women and girls with ADHD, and how the contribution of our hormones in ADHD symptoms are not taken into account a lot of the time and are sometimes misdiagnosed, and how our symptoms can show up differently, particularly in menopause. I'm also proud to share that I've been invited to be an ambassador to the UK Parliament to advocate for better support for people with ADHD and better support in their pre and post diagnostic journeys, because I believe the NICE guidelines aren't being implemented effectively and fully, leaving people without the support they need. And I'd like to campaign for more research and education on the different ways ADHD shows up in women and girls, as this has caused huge inequalities in diagnosis and care. Thank you for listening.
Welcome, Catherine, and welcome, Lex. Wonderful to have you both here. Obviously, just listening to some wonderful ADHD UK ambassadors doing just extraordinary things. So yeah, just thrilled to have you both here. You're both extraordinary ADHD coaches. You're both extraordinary people. We've known each other for many years now, which is a wonderful thing. And you're leaders in the ADHD community without any doubt. As you know, I hold you in extraordinary high regard. And we're here to do a conversation about RSD. Do you want to both introduce yourselves and what you're doing as a starter? Catherine, do you want to go first?
I'll go first. Well, we're here as a pair. We're here as NeuroChicks. So we have our own. We met actually through coaching. Lex was coaching me, and we really hit it on. That was back to the point that Hester was making. Like sometimes you really want to find the person who's going to really work for you, and that was the case for me and Lex. And this has transformed into a partnership, really, as well as a friendship. So, as part of NeuroChicks, what we want to do is offer. We feel like sometimes in the ADHD community, there's a lot of very serious advice, and there's a lot of like the TikTok sort of quite jokey kind of thing. And where are we? Basically, like it always doesn't feel like we have somewhere in the middle. We feel like we sort of provide something which is quite straight talking, sometimes a little sweary. Apologies in advance, but actually also really deeply researched, because obviously, as we do in our community of ADHDers, we really care and we really hyper focus on stuff as well. So we really bring all of this passion that we have into this, but we try to make it very accessible as well. And so part of what we do with Tricks is offer group coaching and courses, but really cheap as well. So we're talking like £15 for anything that we do. And that's a way that we can sort of make some of this provision available to people outside of regular coaching, which is fantastic, but not always accessible financially.
Amazing. And Lex, you want to say a quick, obviously that was an introduction for the both of you for NeuroChicks. Say a bit about you.
Absolutely. Good afternoon. Say that again.
Just, do you want to say a bit about you?
Is there a bit of a delay? Absolutely. So I'm Lex Harvey-Bryn. I'm an ADHD coach and therapist. I've been working in this industry for many, many years, and I'm very grateful to be a strong advocate and supporter of ADHD UK. We're here today to talk about rejection sensitivity dysphoria, which is a subject that both Catherine and I are incredibly passionate about, and I'm really looking forward to sharing that with you today.
Fantastic, thank you. And we, for those watching on Facebook, LinkedIn, and Instagram, we've had to do that to refresh that we have to do every 4 hours for Instagram and LinkedIn, every 8 hours for Facebook. The world is not fully designed for our kind of like wonderful craziness of a 28-hour global conference. So we have to renew our streams every now and again. And that was what just happened. So if you dropped out and had to refresh, that's what just happened. We always have to try and do it whilst we're doing something else. It's a big deal, RSD, and I think it's, we did a section earlier in the conference talking around emotional response, which RSD firmly sits, and emotional response, RSD, is wildly underestimated in its impact. It is the thing that has you leaving your job because of what's happened, and even though you're great at it, like it's that it'll exit you from a friend group. Like it can cause your self worth huge costs, and it is a very, very big deal. Who's up for the challenge of describing what RSD is?
Go, Lex. Do it, Catherine.
Go for it.
Okay, so the one of the simplest way to explain rejection sensitivity dysphoria is it's the perception that we're failing to meet our own or other people's expectations like a rocket through the chest. It's visceral, it's all body. It's a real trip into complete mind and body overwhelm. Now, one of the key things in that is to recognise that it's often born in the perception. So it's the not knowing, it's the ambiguity. And that is a space that neurodivergent minds can really struggle in. So quite often when we're looking at how to navigate rejection sensitivity, the first thing to do is recognise the space of ambiguity.
What do you mean by the... Can you expand on the space of ambiguity?
Well, it's always in the unknown. Oh, sorry, Henry. It's always in the unknown. So it's things like someone looked at you funny, but you're not sure if you've upset them, not knowing if you've got something right at work, being in a position where you think someone's given you a funny look and you don't know if you've upset them. It's often when you look at the things that are behind rejection sensitivity, it's in the unknowns. It's the I'm not sure's, I don't know if, that causes essentially our amygdala goes on high alert and sends our body into a central nervous system response. So we're either going to sort of fight, flight, freeze, or fawn. So we're going to fight, our justice insensitivity will be raging, and we might want to, our response might be to fight, to get involved, to defend yourself. That's one of the things that when our amygdala fires off, our logical brain shuts down and our central nervous system takes over. So you can be aware that your logic's there and you're desperately trying to get hold of it. But in these moments when we're triggered, as I say, it feels like a rocket to the chest. We essentially go onto autopilot and then we have these reactions. So fight being one of those responses, or you can have a flight response. So I'm going to quit the job, I'm running away, I'm leaving the relationship, a real sort of need to get away from that situation. You might have a fawn response where you'll be this is often where it can look like people pleasing or sort of perfectionism, wanting to get it absolutely right, but writing very long emails justifying what you've done, having to be very, very apologetic and doing all you can because your brain's essentially sensing a danger and a threat, so it's trying to protect you from that. So so if a fawn response is what your brain's instructing you or guiding you to do, it will look very people pleasy, very perfectiony, very I'm going to do everything I can to make you like me, to not be a threat. I'm not a threat to you anymore. And then the other one is a freeze response, which is where you just go blank. Your mind goes blank and you don't know what to do next. You can't access any sort of logic or cognitive thoughts in your mind, and you just freeze, very unclear of what you need to do next. Now, when you're looking at your central nervous system responses, some of the things that are going on in that moment is our insular system goes into overdrive. So we feel everything. We're flooded with emotions. We're flooded with all the feelings. Our interoception, which we're going to have a chat on sensory stuff, but our interoception can go wild. So how we're feeling it in our body. Esther mentioned earlier that about how it's a brain and body connection, and it absolutely is. And if you look at the way that our body responds when it's when our amygdala sets off, a fight response, there's lots of body movement, there's lots of breathing, and when we're in a flight response, again, there's lots of body movement, there's lots of breathing. If we have a fawn response or a freeze response, quite often our body shakes afterwards, because it's getting rid of all that adrenaline and that cortisol. But the challenge that we have is often when we are hit by this RSD, it's quite all-consuming, and you can't separate your thoughts from the feelings, from the emotions. It's just overwhelm of a mental and emotional overwhelm of all of those feelings.
Catherine, why does it hit ADHD and autistic ADHD so hard?
Well, I think that's a really interesting is that when we speak about RSD, what I often hear in coaching is people say, oh, it's like a curse. It's like the RSD thing is almost like this monster, that's this virus that's infecting you. And really, I think it's really important to sort of understand that this is not what's happening, that RSD is something that kind of develops with us over time from what we call the drip, drip, drip effect of having negative sort of feedback loops from our environment or even from our own selves, which is literally, you know, if you're constantly as a neurodivergent person, which means that someone who doesn't really comply with expectations, you are always told that you are doing something that is not quite right. You're basically sort of getting this message, which is, I am not fitting in. And that's a form of rejection. And so that drip, drip, drip effect can turn into this big sort of like lifelong habit. Our nervous system gets basically primed for rejection. And so that's one of the things one thing I always say about ADHD brains is that we have really fundamental values in our things that we expect from the world. And this thing, which not many people seem to talk about, but to me, it's like we are so desperate for clarity, for efficiency, for logic. These are things that are just so, for us, it just feels like the world should be based like that. And when it's not, because actually the world is not based on these values, it's based on doing a lot of things in a compliant way so that people can sort of find their way through in a way that is not logical in itself, but more easy to manage. So we tend to hit the wall quite a lot from like going, but this is neither logic nor efficient nor clear. And this stuff can really also sort of really contribute to this feeling of we don't feel understood, and we feel like a sense of we're already sort of fitting, and why is nobody else sort of understanding what we're doing? So I think with ADHD, that's a massive thing for us, that we have this sort of feeling of never quite fitting in. And so anything that sort of our brain's job is partly to help us identify threats, and we're very, very good at identifying anything that feels like danger to our nervous system. And so that's what I call meerkat syndrome. It's literally like we're like looking around going, where is the next thing to hit me? And so anything that comes our way that might sort of get us into RSD, it's literally because we are primed for it. We are ready to sort of really get something. And our assumption is always going to be that something's going to go wrong. So if we are more regulated, we might be able to sort of let it slide. But if we are dysregulated, and for me, one of the Ds of ADHD should be dysregulation. So if we are dysregulated, it's also more likely to hit us harder and sort of be amplified, because this is what we're sort of expecting, effectively.
Thanks, Catherine. And you talked about that sort of hypervigilance, which is something we also see with trauma.
Yes.
So to Lex, how can trauma and past experience make RSD worse?
Well, I'm actually going to pass this to Catherine, because Catherine is it's one of her special areas of specialism. But some of the things when you're looking at the difference with ADHD and rejection sensitivity, and when the ADHD presents, is that it's the sort of quick to impulse. It's that need to react straight away as well. That sort of really links into what Catherine was saying, is that we feel this desperate need to resolve it now. We struggle with the not being able to sort of sit quietly and not resolve it. And that's often driven so much by, as Catherine said, years and years of negative messages, lots of times where we have had to have these really unbearable feelings and experiences. And one of the things about our brains is it's not designed to keep us happy. It's designed to keep us safe. It's designed to keep us alive. And it does it incredibly well, 99 times out of 100. But there is always that one time where it just switches into we're unsafe, and that's where things like trauma also come in, as well as RSD. So I'll hand over to Catherine.
Thank you. So the reason why I'm so interested in the place of trauma and ADHD is not that trauma causes ADHD or that ADHD causes trauma, but they do go hand in hand, in the sense that it's that what I was describing earlier about that experience of never fitting in. It's not. So when we think of trauma, we tend to think that trauma is an event that happens to someone. Trauma is not the event itself. Trauma is the reaction we have to an event. And my simplest definition of trauma is something that happens to you over which you feel powerless, over which you feel trapped. And it's that sort of, that's your lack of autonomy. It's when you feel like you literally have no options. And that feeling is something like it's the feeling of basically I'm stuck and I might die. This is sort of thing. So basically RSD is like really a massive way of doing that. But the way that when you were talking, Lex, earlier about all these reactions to RSD, so the fight, flight, fawn, etc., these are all trauma responses. And so what happens when we are hit by something that triggers us? The thing that's triggered is not our brain, it's our nervous system. And our nervous system goes into that sort of like, state of alert. The first thing that happens when your nervous system is triggered is that your prefrontal cortex, which is your calm reasoning brain, goes offline. Because that's not what's needed right now. When you're feeling like you're in danger, what's coming up is basically your survival brain. And it's all about, how do I survive this? And so Lex often said that, it's like, it's the cruel irony is that the moment where you need your calm reasoning brain is exactly the moment that it goes offline. And so this is why when this sort of RSD attacks, it feels a bit like that, isn't it? It's like a monster attack kind of thing. The first thing that we need to do is not necessarily try to reason through, which is, as ADHDers, we live in our heads. And the more we are into our state of survival, the more we go into problem solving, into all of this sort of stuff, because we're really good at it. The problem is that actually your brain is not working properly at that point. And the more we're trying to reason through it, the more we're sort of getting us entangled in reasoning, when actually we need to tend to is how we feel in our body. And once we do that, we're able to often sort of come back to it. And we'll sort of go through a couple of things that we can do with that. But that's basically the link between the two.
Isn't that the most frustrating thing? Isn't that the most frustrating thing, where you can, when you're in an RSD trigger, and feel your logic there, and you can feel it going problem solving, but you just can't connect with it because you're in your central nervous system is scream at you, and it can just feel like, you say, you feel powerless. You're aware that there's this thinking part and thinking, well, it's so reliable, but you just can't connect with it. You can't. It's not there for you at that moment because you are in autopilot. Essentially, your brain is gone. Don't worry, I'm gonna keep you safe. I'm gonna keep you alive. Whether it's a bear in the jungle or an email that's coming through from your manager, your brain doesn't understand that there's a difference. It just sees danger. It's triggered danger, but it's a hard space to be in.
And I just noticed a question on the chat from Taz about, is there a link between RSD and self-sabotage? And I think it's a really good time to address that, in the sense that, yes, there is a link. The link is it's all coping mechanisms, not conscious one, but unconscious one. When we go through self-sabotage, it's literally, I'm going to not try this thing because if I try that thing, it might feel like danger. So it's almost like, I often describe the fact that there's like a little dance that happens in our brain constantly between wanting to feel safe, but too much safety keeps us stuck, and wanting to sort of grow and explore things, but that can feel unsafe as well. And so self-sabotage is definitely, I'm going to retreat. I'm going to stop myself from doing the thing, because if I do the thing, I could be I might expose myself, I might feel vulnerable. And RSD is also a coping mechanism. I need to figure out everything that could go really wrong, the worst thing possible, and that could happen, so that I can sort of like remove myself from it as well.
Amazing. Like, to be honest, there's some lovely comments coming in. It slightly hurt me in the heart when you talked about your brain is to make you safe, not to make you happy. I think the idea that it's an important point that the original parts of our brain were exactly like, is that a tiger run or more mundane equivalents? But I think it's also a nice call to arms to say, you need to work on happiness. You need to work on your changing yourself to get to that place. It's not just automatic. It means that just doing nothing won't get you there. You've got to go out and do it. And I think that's a positive to think to.
Also, the other thing, Henry, is that emotions are clues trying to tell you things as well. So sorry, I think there's a bit of a delay my end, so I don't know if I'm overcutting. Sorry, Henry.
You're okay. It's ADHD,
I'm so sorry.
Like, overcutting sometimes comes with the territory. But there is definitely a delay. What does RSD look like day to day at work or school?
Oh my God! I mean, it can take as many forms as you can imagine. But we're doing our usual.
No, there's a delay.
I'm going to say names first. So Catherine was answering that. So Catherine, go for it.
So I think in work, you mentioned that as well. It could be like literally we're going to quit because someone sort of looked at us the wrong way, or we got like a piece of feedback that we thought we are completely misunderstood. I can't be here, and it sort of really escalates really quickly. It could be just it could be pure procrastination to the point of shutdown. It's like, I'm just not going to do this task. We won't do the task because if we try to tackle it, it might actually get us in that zone of feeling even more overwrought by things. At school, it might be also in kids being quite feeling judged, like the sort of stormy behavior, like the tantrum kind of thing as well, or like complete shutdown as well. That could be the sort of thing. In relationships, it's like literally my friend I asked them if they wanted to go to cinema and they said no. I think they hate me. And that's sort of like when actually the friend might have had a very good reason and didn't have time to sort of send something more in detail. But it's back to that perception as well. So it can take really all sorts of different forms, but it's really, it's interesting to think that it used to be much more part of the diagnosis process. There was something about emotional dysregulation, which this is. But actually, and I think let's talk about it coming back actually as part of it, because that's what you were saying. You were saying this thing, Henry, earlier about working actively towards happiness. I think for me, it's less about happiness because happiness can be quite a lot of pressure, but I think it's really about self-care and self-kindness and really putting the stick down, because we're really, really good at finding sticks to beat ourselves up with. And that's the one thing we've got to learn to do, because sometimes it feels easier to sort of go negative, because in a way we're confirming what we always sort of believe the worst of. Because if we can sort of put the stick down and go, actually, I'm okay, we can start tending to our nervous system. And that's the bit where we can start regulating ourselves. And when we regulate our nervous system, we can regulate our brain. And that's the big secret here in terms of how do we deal with that part of it. RSD is not a curse. It's something that we're not going to be able to necessarily get rid of completely, but we can learn to manage it so that this coping mechanism is something that we can bring it back to where it needs to be, not this sort of like over-amplified, over-efficient way of working for our brain.
Where's the line between RSD and a panic attack? I'll go over to Lex. So for Lex.
Did you say the link between RSD and a panic attack?
I did. Yes.
So I'm so sorry. This line's so bad. I'm terribly sorry. I mean, the key is that with all of these things, they're your central system detecting a threat or danger. It's all the same. It's in the same ballpark. Obviously, they're not the same. They're often triggered by a panic attack is often triggered by a past life experience or a trauma, whereas RSD is sort of sits in a different space. But quite often the reaction and the response that our brain has is very, very similar. So it's that, oh my gosh, there's a danger, there's a threat, and in that moment when, as we've mentioned before, your brain, the logic shuts down and your survival kicks in, and it's your body's way of trying to keep you safe from a threat that it's detected. And a panic attack is very visceral. It's very much that your brain, your body then responds to. So heart beating, and sort of a lack of awareness in those moments of what necessarily has triggered that, but it's because your brain has detected a micro event from your past that's sort of visiting you again because you've had a similar, you may have smelt the smell, you may have had an experience, you may have seen something that's triggered that sort of sends your brain and your body into this central nervous system response. So when you're looking at the two situations, they both can have similar ways in which to manage them. Would you agree, Catherine? Is there anything you'd add?
No, I think you've got it. You've got it.
I definitely had a moment of panic just then, where I thought we had moved into talking about past life regression, and people thinking they were Cleopatra, and it took me till the second time you said it to me, you just meant a past in your life of this life. Something's happened in your past, I had been happily scrolling to myself, how do I, in a really nice way, sort of try and say that's not our core message that we think everyone. Which isn't to say that I understand some people believe that, and
you'd make a fabulous Cleopatra, Henry.
Thank you. Well, and as we all know, if I was to get a diagnosis in Sheffield, where we have last data was is what, 2,000 years. I would need to know how to be Cleopatra, get myself mummified, and last the 200 years to get to the end of the wait queue to be seen. So useful skills built up. Right. I think we're going to be running out of time. So.
What maybe we could do is we'd love to share a couple of very small tricks in terms of the things that you can do to sort of help with dealing with RSD. And
perfect. I think you're starting.
Yes, I am. Well, I think that the first thing to know is that I think we always feel we've got this compulsion to always sort of make sure we have the perfect answer in the perfect moment. Like if something happens, we want to sort of solve things. The first thing we've got to do is really take a pause and really take a moment to go, what is going on here, and realize this is RSD. This is not necessarily the whole fact here. And I think that's such an important thing to do. But the other thing I wanted to show you is a really simple exercise, because I've been making the link so much about, yes, we think that ADHD is all about our brain, but actually we tend to forget about our body. And I want to show you a very simple exercise that you can do that is really about accessing your nervous system and really bringing it down from this sort of state of panic. And so I'm going to show it to you. It's going to take about a few seconds, and then you're very welcome to try it if you want to. But it's something that I do in all my sort of sessions. So what you do is that it's what I call optic nerve flossing, which is not the most or pillow time if I want to. But basically, what you do is that you put your hand behind your head like this, and already in this position, that's what you do if you're in a transat, if you're like in the sun having a really lovely time. So you're signaling to your body that it's safe. Like if you were not safe, you'd go like this. But if you're safe, you'll do this. And then you look up to the top right. And when you do this, we're going to stay like that for a few seconds until we find some form of release in the throat. It could be like a cough, a yawn, a swallow, a little scratch. It could even not happen at all. But basically what we're trying to do is we're using the optic nerve connected to our brainstem to then also connect to the vagus nerve. The vagus nerve is the mesh of nerve that connects our brain to the entirety of our organs. And what it does when we're doing this very simple thing, is that we're literally signaling to we're doing a little tug on the vagus nerve, and we're saying, hello, can you get into play here? And the vagus nerve only does one thing, it's put your body in rest and digest. So when we do this, we're literally saying, do that. And then we move the eyes to the right, and we stay like that until we have the same response. And something as simple as this, I've seen it time and time again. When people come out of it, they might feel a bit heavier, or a bit lighter, but a little bit sort of the shoulders drop a bit, the breath drops a little bit, and we almost sort of like feel like we're able to do things a little bit better. So it's a very, very simple exercise, which is all about reminding us we don't have to live in our heads. We are also grounded in the body. It's a tool of regulation. So I wanted to share that one. And there's a YouTube video link as well that you can find on that one. Lex?
Another one that's really helpful, Henry, if you don't mind me just adding in before we finish, is something to help sort of replicate. When we were talking earlier about our central nervous system responses, when you have a fight or a flight response, what you can guarantee is that your body's moving lots and you're breathing lots, which is expelling and processing all of that adrenaline and that. Some of the things that can be really, really helpful when you're in that and you get that sort of punch to the chest and you really feel that visceral response to your RSD, is kind of give yourself a bit of a reset. As Catherine just mentioned, the first thing is recognizing that this is rejection sensitivity, that you're triggered by your rejection sensitivity. And then it's about sort of getting yourself into that state where you can replicate some of the ways that we would process adrenaline and cortisol hitting your body like a train, to try and help with that, getting yourself out of your amygdala response, so your central nervous system response, and try and switch your logical brain back on. So things like breathing, simple box breathing to begin with is a great start. There's some really great breathwork specialists. Jax, who's on the marketplace, does phenomenal breathwork as well. But to start with, you can just do simple box breathing just to help start to calm down your central nervous system. So sometimes it's also helpful to move. So if you're feeling really full of it and you're feeling that that sort of fight or flight response, sometimes matching that with body movement as well in those moments can really help you. But just saying to yourself, right, this is an RSD reaction, taking the breaths, focusing on the fact that what you're trying to do in that moment is calm down that central nervous system response. So breathing, either box breathing and moving your body, just to help process all of that adrenaline that your brain's pumped you full of to get you ready to fight or fly or run away. Is a really good way. And also in that moment as well, saying to yourself, I'm not going to respond immediately. I'm going to, whatever works for you as far as sort of time frames, but just saying, I'm not going to react now. I'm going to give myself 20 minutes or give myself 24 hours, whatever works for you, and give yourself, this is a great thing to work with if you're receiving coaching or therapy, is things that help you in that moment to remind your brain and your body that you're safe. Even if it is just simple as getting outside, putting your feet in the ground and saying to yourself, I am safe. I have everything that I need right now. Because what you need to do in that moment is calm down that central nervous system response so that you can access that beautifully wonderful, logical thinking brain with all that problem solving skills that we have in that moment. Because when we're in that space, we're on autopilot. You aren't thinking with your logical mind. So so another really helpful tool is to breathe, body movement, and remind yourself that you're safe and get your central nervous system calmed down.
I would add one last thing to this, which is that it will pass. That's what you can know, is that this RSD is like literally, it's a moment. Even if it lasts 5 hours, it will stop. You're not going to be stuck in it. And often, because we are now or not now, and if it's not now, it's never, we forget that this feeling we have is not going to be forever. You're not going to feel like that forever. It's going to pass. And that's what we've got to sort of hold on to.
Lex, Catherine, you're amazing. You're both amazing people, amazing coaches, doing wonderful things. I've known you for many years. I also know people who've benefited from your coaching and how much positive impact that's had. So I can't thank you enough. Thank you so much for doing this segment, for talking on an important topic. Sadly, time is running away from us, so I have to say goodbye. Thank you very, very much. You're both amazing, and thank you. Bye, Catherine, and bye, Lex. Thank you so much. They are both extraordinary people, and a pleasure to know. Shortly, we've got Lisa Kerr up. Very, very excited for her. Before we come on, we're going to have what will be our sort of last ambassador video. So these are ADHD UK ambassadors. They're people who look to support the charity, and we look to help to amplify their voice. They're amazing people. I'm going to hand you over to Mira.
Hello everyone, my name is Maria and I'm a 23-year-old event consultant here in London, and I'm a proud ADHD UK ambassador. I was diagnosed with ADHD at the age of 18, just before starting university, and my life absolutely changed. I decided to become an ambassador to amplify voices and to show people that everything you put in your mind is possible. I did not think I could get 2 degrees, but I pushed through it and I did. I love being an ADHD UK ambassador. I found such a sense of community. I've spoken with so many like-minded people, and this is all about. It's all about unity and coming together to make a difference.
Hi, I'm Laura. I've worked with neurodivergent young people for most of my working life in specialist schools and later as a therapist. I was diagnosed with ADHD myself in April 2024, and it's changed everything for me. I was really struggling with my mental health significantly throughout the whole of my life. My diagnosis has helped me to make sense of my challenges and build self-compassion. I became an ADHD ambassador to raise awareness and understanding around ADHD after being misunderstood for most of my life. The effect of being undiagnosed and not understanding my differences has a profound impact on mental health, and I hope that by increasing awareness I can prevent others from going through the same. I really enjoy being an ambassador. It means I get the honour of making a difference. It gives me a platform to increase awareness and promote change, which means a lot to me. And I hope to continue and contribute to meaningful changes as an ADHD ambassador in the future.
Hi, I'm Himal Mandalia, and I was diagnosed with ADHD at the end of 2024. It made a lot of sense of my life. ADHD wasn't what I thought it was. It explained a lot of the ways I'd struggled. I'd had an unusual life, growing up to non-working parents, running away at the age of 7, no qualifications, and then turning my life around and becoming in quote marks, successful, but not really happy, heavily masking, unable to let go. And so I was working at senior levels of government as a contractor and then head of technology for Government UK. Huge burnout following the pandemic, travelling the world for 18 months and burning out on my career break. It's very ADHD. Getting diagnosed and finding answers, and also getting diagnosed with autism, and those were the remaining answers. Becoming an ambassador for ADHD UK, where I found a tremendous sense of community, being supported and able to support others. And I think that's a huge, huge thing for us in our own journeys and for those that we're able to help by representing and raising awareness about ADHD. And so I'm very proud to be an ADHD UK ambassador.
And we're extremely proud to have him as an ambassador, have everyone as ambassadors. It's a really, really big deal. It is a big deal, and we're very grateful for it all. Next up is Lisa Kerr. So the beautiful contradiction, talking about embracing your autistic ADHD brain. And then our last session, she's our penultimate session, is the NHS and ADHD with the Dr. Tim Kerr, which I'm enormously looking forward to. It's exciting. ADHD and autism is a very, very important. It's a very, very big deal. So many people are ADHD and autistic, and Lisa is an ADHD and autism coach. She's a keynote speaker, founder of the Think Exceptionally, 20 years senior leadership experience in finance and HR. She's going to be talking about the challenge of ADHD and autism, and it's my time to welcome Lisa to the stage. Welcome.
Hi, Henry. Thank you for having me, and well done on the conference so far.
No, well, thank you. Like only this and one more segment to go, and success for another year, I hope. So, but I honestly, I've enjoyed it so much. I get to listen to you and to others. I learn an enormous amount, and it's genuinely a privilege, and I'm very excited for your segment. Look, a huge percentage of people with autism have ADHD, despite it not being something that could even be diagnosed. You weren't allowed to have autism and ADHD. You were allowed to have autism or ADHD, but not both until not that long ago. And it is a big difference. It is a big group of people, and what I found oftentimes is where you see that suggestions and ways of understanding are either entirely for autistic people or entirely for ADHD people, and ADHD autistic people, and helping get understanding of the tools and information just isn't there. So I'm so thrilled you're doing this section. So thank you. I'm going to hand over to you. Time for me to stop talking and to hand over to you. Thank you. Yeah.
Great. Thanks, Henry. So while Henry's just sharing the slides there, he's given me a lovely introduction, but I will just say a little bit more about myself. There we go, got the slides. So I am Lisa Kerr. I am an ADHD coach, and I'm ADHD and autistic myself as well. So today I am going to talk to you about what it's like to be autistic and ADHD. So what's coming up today? I am going to share with you 2 stories. My lived experience with autism and ADHD, and then after the stories, I'll share some tools and strategies that I use myself and with my coaching clients. There are some free resources that you can access by scanning the QR code that I've put on every slide. So it's the same QR code throughout, because I hate it when you're scrabbling around trying to take photos of things. So I've put it on every page. That will take you to a page of my website where you can access some of the free downloads and resource links. So, story 1. the fight. In the red corner, the undefeated champion, standing tall, supremely confident, ready to get out there again and knock 'em down. And in the blue corner, the challenger, shoulders stooped, looking anxious, a little out of place. It doesn't sound like it's going to be a fair fight, does it? Would you pay to watch this entertainment? But I'm not talking about a boxing match. I'd like to introduce you to the inside of my mind. I'm autistic and ADHD, or DHD, two conditions with many overlapping traits, but also complete opposites in so many ways. Both come with stigma, stereotypes, misunderstanding. By sharing my experience, what it's like to be me, I'm hoping you'll understand ADHD a little more. And this is only my experience because we're all different. So I can't speak for all autistics, all ADHDers, in the same way that you shouldn't assume that because you've met one neurodivergent person, you know what we're all like. Let me tell you a little more about these. Autism is associated with the left side of the brain, the analytical side, rational, logical, controlling, often depicted as the black and white side of the brain. Things have to be fair. Rules have to be followed. Change is a scary thing. I have to be in control. Recently at a networking event, someone introduced me as, "This is Lisa, she's very talented." Sounds good. When I inquired what he meant by talented, he said that I'm creative and knowledgeable, but don't show any emotion. And this is a common misconception that autistic people have no empathy. But you couldn't be further from the truth. There are different types of empathy. Emotional empathy, feeling your emotions, taking them on as if they were my own, wanting to make things better for you. I have buckets full of this empathy. Cognitive empathy, recognizing and understanding what you're experiencing. That's a different thing entirely. Autistics can struggle to accurately recognize emotions. Eye contact can be difficult, so we're likely to look at the periphery of your face, not the eyes and mouth, and that's where emotions show up. So while I feel all the emotions very deeply, rational, pragmatic me wants to fix the problem. And what comes out of my mouth in the moment might sound blunt and uncaring. And what about if ADHD brain gets involved too? I've thought of 75 different ways I can help you and it's all bursting to get out. I need to do something right now. I'll give you a big hug. Oh, I've still got the boxing gloves on. That was a right hook. I've got it wrong again. The fight goes on. What about my own facial expressions? Autistic brain is working overtime, analysing everything that's going on around me, trying to document the unwritten rules and create clarity from confusion. So it's far too busy to worry about what my face is doing. My facial expressions don't always align with societal expectations of the emotion I'm feeling. In a previous role, my boss told me that I looked condescending in meetings with them, because that's how they interpreted my facial expressions. I was absolutely flawed. That wasn't how I was feeling at all. I'm a visual thinker and process information by looking up to my left, or appearing to look over your shoulder if we're in conversation. And I now realise that I furrow my brows and narrow my lips when I'm concentrating, which I guess came across as condescending. Lockdown happened and we all moved to Zoom working. So I could see myself on screen the whole time. I could see the faces I was pulling. I was so conscious of it that I started to hold a facial expression of a slight smile, my attempt at looking interested and engaged. I held this unnatural expression for meeting after meeting, week after week, month after month, so long that I caused a twitch above my eye. I caused myself physical harm trying to hold my face in a way that wouldn't cause offence to others. The fight goes on. In her book, Autism in Heels, Jennifer O'Toole, who you might recognise as the dating advisor on Love on the Spectrum, says, "What's it like to be us? Too much. What do you do when the trouble isn't one thing that you do, it's everything that you are? So much of the internal experience of autism is invisible to outsiders. No one else can see the struggle." I'm wearing a sunflower lanyard. Do you know what this means? Maybe type yes or no in the chat. I've been asked if I'm a member of the Green Party or if it's something I made myself. This is the Hidden Disabilities Sunflower Lanyard. The Sunflower scheme was set up at London Gatwick Airport in 2016 and has grown since then to be a globally recognised symbol of a less visible disability. The sunflower design was chosen deliberately because it's bright and colourful, so should be easy to spot. It's designed so people can let you know that they might be experiencing the world differently from you, might need some support, without needing to shout it from the rooftops. Because the times we most need support are often the times we're least able to ask for it. So I am shouting it from the rooftops because I want to make sure everyone recognises and understands the sunflower lanyard. Or it could be a bracelet, a keyring, a badge. Please look out for hidden disability sunflowers. You might be surprised how many you spot when you're looking. Back to Jennifer. I pull the rug right out from under myself when everybody is looking. Just trust that I didn't mean to make anyone fall. My version of normal does not look the same as most people's. This really resonates with me. My deepest belief has always been that I'm not good enough. My black and white view of the world has defined the way I ought to be. I've spent my life trying to fit in, trying to be normal, act the right way, say the right things. I'm too much. I overcompensate. I'm too intense in relationships, both work and personal. I need to feel needed. I do too much. And this results in people pushing me away through caring too much. The fight goes on. ADHD is associated with the right side of the brain, the creative side, often depicted in a rainbow of colours. Attention deficit hyperactivity disorder. Another misnomer. It's not a deficit of attention. It's a deficit in the ability to regulate my attention. Something has all my attention. I was a due diligence director, attention to detail an absolute must. So much attention, I forget to drink water, eat, or even blink. Or my attention is all over the place. Now, what was I saying? The fight goes on. And when you say hyperactive, people think of small boys unable to sit still in the classroom. But I barely move. I'm like a sloth. It's my mind that's hyperactive. I'm endlessly curious, a love of learning. Autism, because I have to know exactly how everything works to feel in control. ADHD, because each new thing becomes a hyper-focus, a fascinating new idea to explore, new possibilities, and I want to try them all right now. Well, maybe not right now, because autistic brain needs to know exactly how they'd work and carry out a full risk assessment before I start. the fight goes on. People pleasing can be a big thing for ADHDers too. We love to feel needed. If someone asks for our help, that gives us a dopamine rush and we're quick to say yes. Time perception and prioritization can be more of an issue. Is this the top priority for me to be working on right now? They asked for my help, so it must be important to them, which makes it important to me, which makes it my top priority. What about the other priorities I was working on? They've just faded into the background as my attention has been grabbed by this new endeavour. And it's okay because it will only take a few minutes to complete this new task. The sense of urgency created by the request spills over to my perception of how long I'll need to action it. I'm so busy putting my underpants on the outside to play the superhero that I forget to consider my actual capabilities and capacity. I'll find time to help anyone who asks for my help, leading to an ever-growing to-do list and sense of overwhelm. I work harder and harder, longer and longer, trying to deliver all of the things to all of the people, because rejection sensitivity means I'm terrified of letting anyone down and them thinking badly of me. Inevitably, something has to give, and it's usually my well-being. Burnout hits like an uppercut. I don't see it coming and suddenly find myself flat on my back in the ring. I'm out for the count. The fight goes on. I used to think that everyone's brain worked the same way as mine does, that everyone experiences the world the same way I do, because there's no benchmark. I wear glasses. You might have noticed. But how did I know I needed them? I learned to drive at 17, and part of the test was to read a number plate at a certain distance. While I could read it, it was a little blurred, so I went for an eye test and found that I needed glasses. The optician's chart was the benchmark. We don't have that benchmark for what goes on inside our minds. So I used to think that everyone's brain worked the same way as mine does, but now I know that's not true. I was only diagnosed with ADHD and autism in my 40s, and after the grief cycle that so many of us go through, I'm now learning to live with my neurodivergence, learning to manage the challenges and appreciate the strengths. Albert Einstein allegedly said, "Everybody is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid." What's the genius within that I can call on? I'm ADHD and autistic. I'm creative and methodical. I'm fiercely loyal and resilient. I'm great in a crisis, a problem solver and pragmatic. I have awesome attention to detail and endless curiosity. Harvey Bloom, an American journalist and advocate, says, "Neurodiversity may be every bit as crucial for the human race as biodiversity is for life in general. Who can say what form of wiring will be best at any given moment?" I love this quote. I've decided to call time on the fight. Take off those boxing gloves and appreciate my autistic ADHD brain for what it is. Let the two sides learn to work together. Take the rainbow and straighten it, just a little. Take the black and white and create shades of grey. I've decided to stop worrying so much about what people think of me, stop judging myself, and start doing things that I can be proud of, things I believe in. Start believing in me. So, while my autistic brain still struggles with the fact a boxing ring is square, in the red corner, I've started professional speaking about neurodiversity so I can help other people to understand, accept, and value neurodivergence. In the blue corner, I've trained as an ADHD and autism coach. In the yellow corner, I've started painting by numbers. And in the green corner, I've joined a samba drumming band. because ADHD brain is never going to be happy with just red and blue. I'm always going to create a rainbow. Story 2, the piano. Don't die with your music still in you. Dr. Wayne Dyer. I grew up in the middle of nowhere, a cluster of 3 dwellings, a cottage, a house and a farm on a country lane, and nothing else for miles. Our neighbours were pensioners, not obvious playmates for a 9-year-old girl, but they were all I had. And they had a dog, a mongrel named Butch, who was my only friend. So I made every excuse possible to head to their farm to see him. A low grey stone building with a blue front door leading directly into the living room. To the left, a door that was always closed. Straight ahead, an open doorway and 2 stone steps down into the tiniest kitchen you've ever seen, where they spent most of their time. I was drawn to that closed door, intrigued to know what was behind it. Each time I came to the farm, I looked to my left in the hope that door would be lying open. It never was. At school, we were learning to play the recorder. Everyone else had the standard black and cream instruments. I'd found a bright red one. I was a misfit even then. I took to it quickly and learned to read music. Those little black dots and sticks danced right off that page for me. I wanted more. I wanted to learn to play the piano. Just one slight problem, we didn't have a piano, and pianos were expensive. I lamented this fact as I sat in the tiny kitchen with Mr. and Mrs. Sutton. Slowly, Mr. Sutton got out of his chair, beckoning me to follow him as he shuffled across the wooden floor and opened that door. A secret piano standing against the wall of the dining room. Wow, it looked old. I learned to play the piano when I was 9. First, I used the neighbour's old piano hidden away in their little used dining room. A secret piano. Then I think my parents realised my constant presence at the farmhouse might be an imposition on the kind farmer and his wife. But they also thought I'd quickly get bored. And so they bought me the cheapest second-hand piano they could find. It cost £50. They promised that if I stuck with it, they'd buy a better one. My piano was so old, it couldn't even be tuned properly. The piano tuner told me that if he tightened the strings enough to hit the right notes, the strings would snap. So certain of the notes were always off key. No matter how much I practiced and how perfectly I played the piece, it would come out sounding different, not quite right. My piano stood in a corner of our living room, waiting patiently for me to get home from school each day. I'd lift up the creaking lid and let my mood dictate the piece I chose to play, the story I told with those notes. My piano stood in a corner of our living room. I loved it, and yet I couldn't wait for it to be gone, replaced by a better version. But life doesn't always go to plan. I realised there would be no better piano. The stories of my childhood would make themselves heard on these keys, always slightly out of tune. A metaphor for my ADHD brain. Everyone has a signature tune, a party piece, the song you've played over and over, fingers dancing over the keys again and again until it becomes second nature. You could play it in your sleep. My signature tune was Scott Joplin's The Entertainer. I loved the way my hands had to bounce around to play it. The Entertainer, my party piece, designed to entertain people. Except I didn't play it at parties. I didn't entertain anyone with it. I wanted to share the music bring joy to people through the bright melody. But rejection sensitivity meant I thought I'd ruin the joy if I didn't play every single note perfectly. People would judge me a failure. And with the ingrained knowledge that everything I'd played so far had been slightly off key, I decided it was safer to keep the music inside me, not share it with anyone. My secret piano. A quote I came across recently said, "You're not responsible for the version of you other people see." At first, I thought, heck yes, people can be so judgmental. But then I pondered it more deeply. You're not responsible for the version of you other people see. Is that true? People have a perception that I'm supremely confident. Even my mum and my oldest school friends, when asked for 3 words to describe me, all chose confident as the top one. That was the appearance I was giving. Outwardly successful. Senior roles in global professional services firms, flying off around the world, leading teams on high-pressure corporate finance transactions. Fearless, leading the way. It was all an illusion. A tune I was playing based on my perception of what a capable person would do and say. I'd bought this sheet music for Competent Adult, the musical, and I was playing it note perfectly. That was the version of me I was letting other people see. Behind this loud, confident persona, I've lived my life in relative silence. I've always struggled to share my creativity. My head is full of thoughts. I never stop thinking, but I struggle to get these thoughts out on paper, always feeling that what I have to say wouldn't be of interest to anyone else. Hours spent scrolling social media told me there are so many people out there already talking about the things I want to say and saying them so much better than I ever could. So I have a library of blog posts fully written in my mind, never making it onto anyone's screen. Fear of judgment, fear of failure, just like playing the piano in public. Earlier this year, I decided to try journaling as a way to build up my confidence with creative writing, but I didn't know how to journal. So I joined a journaling club, the Sunday morning journaling club. Bet you can't guess when it happens. The coach explained that a journal can be anything you want it to be. Long form text, bullet points, a drawing, a photograph, a poem, anything at all. When I saw the word poem, I had a visceral reaction. A poem? Don't be ridiculous. I'm autistic. I've never written a poem in my life. When it was time to write, she put on some background music. It was a solo pianist. The album name, The Secret Piano. This piano music touched my soul and freed up my creativity. Out of nowhere, I found myself writing a poem, and I've written several more since. People sometimes ask, are you musical? What does this really mean? As I'm autistic, I'd always taken this question very literally, telling people that, yes, I'm a little musical. I play the piano a bit. It's been 40 years since I started to play the piano. For much of that time, I didn't have access to a piano. But the secret piano has been with me throughout, without me recognizing it. I have music playing on repeat in my head. It calms me, it soothes me. And now it's granting me permission to explore my creative side. I've spent far too long worrying about the version of me other people see. And in doing so, I've been hiding within myself. Don't die with your music still in you. That quote really struck me. Now I share my thoughts and experiences of being ADHD through blog posts on my website, my social media profiles, and by speaking professionally for corporates and at events like this. I also run a monthly support group for ADHD UK called Ask an ADHD Coach. I'm finally giving people the opportunity to see the authentic me. What you choose to do with that, what version of me you create in your minds, that's not for me to say. Whether you feel my words land perfectly or what I say is slightly off key, I'm playing my signature tune the only way I know how, and that's enough for me. Perhaps one day I'll even play the piano for you. What strategies and tools have I put in place to support my ADHD challenges and enable me to live authentically? My sunflower lanyard. When I'm in public places, I wear my sunflower lanyard. I'm open about sharing with people that I might need extra support, advocating for myself. The resources QR code includes a link to the Hidden Disabilities Sunflower website, where you can buy lanyards and other sunflower products. I also have a keyring and a passport cover, for example. A feelings wheel. The feelings wheel is a visual tool that organises emotions in a circular diagram. At its centre are 6 core emotions, with each section branching outwards into more specific and nuanced feelings. This structure is particularly beneficial for autistic people, many of whom experience alexithymia, which is a condition where you have difficulty identifying and labelling your own emotions. In coaching sessions, I use the feelings wheel as a powerful tool for deepening client self-awareness and emotional intelligence. I might introduce the wheel when a client struggles to articulate how they feel about a situation, a relationship, or a decision. By guiding the client through the process of starting with a core emotion and progressively narrowing down to more specific feelings, I help them move beyond surface level responses like, I'm fine, or I feel rubbish. This precision is important because understanding exactly what we're feeling, whether it's overwhelmed rather than simply stressed, or disappointed rather than just sad, enables us to identify the root causes of our emotional states and develop targeted strategies for moving forward. The visual nature of the wheel also makes coaching conversations more concrete and accessible, particularly for clients who benefit from structured visual approaches to their inner experiences. And you can download the feelings wheel using that resource's QR code. Self-advocacy for online meetings. So I no longer try to hold a particular facial expression or to sit perfectly still staring directly at the camera because, frankly, it's completely exhausting. I'm sure you noticed during this talk that I moved quite a lot and I didn't make eye contact with you all of the time. I now explain to people that I'm ADHD and I need to be able to move around to feel comfortable. Similarly, I encourage my coaching clients to do whatever they need to do to feel comfortable on our calls. Executive function skills are the skills that we use every day to manage our life and achieve our goals. There are no profiles of strengths or weaknesses that are better or worse than others, and we all have strengths and weaknesses. But I use this quiz with my coaching clients, and I did it myself at the start, to help them understand where their strengths and challenges lie across the range of executive function skills. We do better with achieving our goals if we can identify ways to rely on our strengths and improve the areas that are a challenge for us. You can complete this free online quiz via the resources QR code, and I'll create a personalised report for you that shows your strengths and challenges across 12 areas of executive function skills. And finally, for the book lovers amongst you, Explaining ADHD, book by Dr. Karam Sadiq, is a straight talking guide for those who are trying to understand autism and ADHD as a combined diagnosis. Using real life stories of people living with ADHD, this book offers advice for those who are grappling with a diagnosis and provides a framework for readers to advocate for themselves and discuss it with loved ones. And you can find a link to this book and to Autism in Heels by Jennifer O'Toole that I mentioned earlier using that resources QR code. So that's it from me. Thank you for listening. And I think we've got a few minutes left for me to take any questions that you might have.
Thank you. That was honestly nearly cried. I genuinely, when you were talking about the piano and talking about another, recognizing yourself in it and recognizing that another one wasn't turning up. This was you. It's a really powerful metaphor and beautiful. I really thought something else. And I thought the story you're talking about, being in meetings and suddenly discovering everyone thinks you're condescending and not knowing, I think that talks very powerfully to something that we've all experienced, which is that something goes wrong, and particularly around personal relationships, and and you can't work out what's happened. Rarely do you get to actually find out. You're like, I just want to know, what did it what caused these problems, and it's so difficult.
And you feel like you're working so hard not to cause problems and to get things right, and there's that constant feeling of, how did I get it wrong again? I can't work any harder at getting it right, and yet I still seem to get it wrong.
Exactly, it being very difficult. And I thought it was actually lovely you talking about that we don't have guides to those things, that there's no, and that being one of the big challenges, just wanting to find out. I thought there was so much in your talk. I really did. I genuinely, absolutely genuinely considered recording myself for an hour so that I could play it out as if it was my video, so that mine, for slightly different reasons, that I'm always moving, so I always feel like I'm drawing attention to myself, and I'm also often looking away, and that makes people think I'm not paying attention when actually I am. And honestly, I only didn't because I thought I'd get caught. Otherwise I was game on. There's no doubt. It took me just for an hour.
We'd know it wasn't you though, wouldn't we, Henry? We'd be thinking that looks a bit like Henry, but it's not Henry because he's sitting really
It was
still.
what happened if someone asked me a question or asked something. I was like, that's where I won't get away with it. I'll have to suddenly jump across and it'll look really obvious. But honestly, maybe this is the time for AI me. I need to train an AI actor, and then I can just tap and answer questions via just typing. Then I could just sit here in my I don't know, bathrobe. Not worried at all. It's I thought that was spectacular. I can't tell you enough, and I can't obviously the depth which you've thought about that and presented it. I thought was extremely special. So thank you.
That's really kind.
Right, I've lost my questions. We have had questions, and you have to suffer one from me whilst we start. Once I go and dig them out. If you actually, I've got a different one. What would you say to young you, 10-year-old you?
Gosh, that's a a tricky one. You mean young me before, who didn't know the
Yeah, because
diagnosis? I think I would just say you'll figure it out eventually. I think kind of don't worry.
which I gave you a worrying moment just then.
Oh, cool. I thought he'll come back
gone?
when he's ready.
Well, that's interesting. You wouldn't tell. You wouldn't say. I feel like if I was put through a portal, I would say, "Hey, by the way, you've got ADHD." If I had like a very limited amount of time. I don't know why I've thought about this, but I definitely have.
Well, I think, I'm kind of showing my age here in that I'm very, very nearly 50 in a few weeks' time. And 10-year-old me, there was no knowledge, there was no awareness. So if I was going back 40 years and said you've got ADHD and autism, I don't think that would have helped me in the slightest. I think I probably would have felt worse, because what would I have done with that information? I think now, my son is also neurodivergent, and there's so much more understanding and awareness, and he goes to a specialist school, and they all just talk about it openly, and sometimes we'll do things and he'd say, well, that's the ADHD for you. And there's so much knowledge. But back then, there were other members of my family. I think one of my cousins was probably autistic ADHD as well, and it wasn't called that back then. It was called something really quite rude and unkind, and that was how people approached the difference. So I'm really glad that we live in the time that we do now, and that we're all kind of raising that awareness and making sure that the future 10-year-olds can be told that and know what that means, and know that the support is out there.
That is what we're doing together, which is try and make the world better, this part of the world, this understanding in terms of the neurodivergent part of the world, trying to change it for the better. Like, so I've set out my stall to do that, and I'm doing it with, you're doing it too. We're doing it collectively together, and it's it's a big deal. It's game changing. I think we're at the end of time. We're on perfect time. Conference is running to time, which is amazing, and very, very exciting. I genuinely found that an emotional talk, and I found it because of the amazing way you described the stories and the description, and the eloquence with which you spoke is something else. So thank you.
Oh, thank you very much. It's a pleasure.
Well, all mine, and thank you for doing this. Thank you for sharing. I have to say goodbye to you. So goodbye. Thank you very much. Thank you,
Henry. Bye.
Bye, Lisa. And it's, I always feel like I'm about to be my turn shortly at the end of this. We're about to enter our last session, but we're having done this. I think I've been live for, well, the whole thing's 28 hours. I think I've been live personally for 20 hours. At the end, you sort of just turn it off and walk off. And it's quite the juxtaposition from talking to everyone. Next up is an extraordinary person. I'm extremely excited about it. It's Tim Kendall, and he's Tim Kendall, CBE, Dr. Tim Kendall. He's a distinguished psychiatrist, leader in UK mental health. There's leaders and there's leaders. And Tim is in the latter. Until late 2023, he served as the National Clinical Director for Mental Health in NHS England, steering national policy and transformation around mental health services. One of the really serious big jobs. He founded and directs the National Collaborating Centre for Mental Health, NCCMH, through which he's developed over 30 NICE mental health guidelines, including chairing the NICE guidelines on ADHD, which was transformational for us and for individuals. It's how we get ADHD assessments. It's the process. It's extraordinarily important. He was awarded a CBE in 2024 for his services to mental health. He continues clinical practice as a consultant psychiatrist, working with homeless populations via Sheffield Health and the Social Health NHS Foundation Trust. He's the chairperson of Care ADHD, leading NHS right to choose provider of ADHD assessments. He's therefore uniquely placed to understand the NHS framework for ADHD assessments and the changes that are happening. Welcome, Tim.
Hi, and thank you very much for inviting me, Henry. I'm very pleased to be here.
I'm like crazy level thrilled. Like it's your yeah, I mean, you are an extraordinary person who's had an extraordinary career and continues to with insights into ADHD and the NHS that no one else has. And you're closing out our global conference, which is, as I think you just heard, kindly waiting in the wings. We've been live for 28 hours with ADHD Australia taking over for our night. We've had extraordinary speakers from Lisa just now, who talking from lived experience in the heart on ADHD and autism. We've had celebrities like Sam Thompson. We've had entrepreneurs like Ben Branson. The list goes on. So it's been wonderful, and you are signing us out, which I'm very, very excited. So this is an in conversation section. We are talking together, it's which is the point at which I'm supposed to find the questions very smoothly, and I'm getting slightly tripped up. Exciting. Do you want to tell me, like, what does it mean to be the National Clinical Director for Mental Health at NHS England? Because I know how serious the world is, but others might not.
Broadly, you've got two main jobs. One is that you run a program, that you're the clinical director for a program of work. So, for example, perinatal mental health or community mental health teams or whatever. And your job is to help roll those out across the country. And that sounds terribly easy, but actually scaling up is complicated, extremely complicated. And it's often very difficult to know whether you'll be able to actually reliably take an innovation and spread it around the country, and it's still doing the same thing that you started off doing. So that's one half. The other half is that you spend the time advising ministers, mainly in the Department of Health, but you are also expected to provide advice across different government departments. So that might include the Home Office around terrorism and mental health or whatever. It might be Number 10. It might be areas like the Foreign Office when you're running a global ministerial summit, or it could be housing and so on. So it's a job which basically don't do it unless you're willing to work 24/7. And I'm very relieved not to be working 24/7 anymore.
Although I think it's been a busy period because you've just come back from a global summit.
I have. I set up the Global Ministerial Summit on Mental Health in 2018, and we brought over about 50 odd countries from around the world came to the summit, including 25 ministerial delegations from all over. And we actually flew over 200 people with lived experience from all over the world. So it was really important that we had such a strong emphasis on bringing people with lived experience and the politicians there. And the whole thing culminated in a meeting which I sort of engineered, and in bringing all the people with lived experience to tell them the recommendations from the Global Summit, from all the work that happened in 2 days, to tell the politicians what they needed to do. And I can tell you, politicians listen far more to people with lived experience than they do to academics.
We sometimes feel like it's the other way around, but
no, I know. I think health services.
I think it's together. It's the combo deal that works. Like data and evidence, lived experience for heart, and you obviously brought those two together. You've stopped doing that. What are you doing now?
Well, I'm now national clinical lead for new models of mental health care. So I'm overseeing a set of pilots that will radically change the way that we deliver mental health care. And I think the bit that is really important for this summit, this conference, is that we are aiming for these pilots to be open 24/7 in the middle of their neighbourhood of about 40,000 people, and it wouldn't say no to people. So we've had questions. Would you treat people with ADHD? Well, the answer is yes, I would, and I do.
I think one of the hardest aspects right now in terms of mental health care provision is the lack of places to go when there's a crisis. And so we get people contacting us, and in crisis or actually pre-crisis, where there's just nowhere. Like you're just until and so to hear that kind of plan is coming is a genuinely wonderful thing.
Well,
it's a huge gap.
Fingers crossed that this will be scaled up. And that's always
fair enough.
At the moment the government don't appear to have a whole lot of money, and scaling up something that I think is important for everyone, because we're not going to say there'll be no wrong door. If you come to the centre from your neighbourhood, we will find some way of working with you, and it's working across with the voluntary sector and with social care, local communities, and the whole thing is co-produced with the local community. So it's always asking the local community, what do you want? What do you need? And each local community is different. So I'm doing that, but I'm also chairing, as I think Care ADHD, which is taking more time, and but as a chair, it's got a very circumscribed role, which is to make sure we deliver high quality, low cost services.
And it's a big deal, right? Like the high quality, low price, like is, and working out how to do that, and not being the, and I do want to talk to that, because actually we obviously run a lot of support groups. I talk to a lot of people, and actually a lot of the time people are like, my local options are closed to me, particularly if you're outside of England without right to choose. I absolutely do direct people to Care ADHD, and I'm going to say the price, because I think it's important, because one of the things that we see is some really high prices, and not only on the front door, it's when people are then, if they're opting for medication, what that looks like. And I've seen that up to £250 per month just in a consultation fee, plus prescription on top. So you're ending up looking at sort of £400 a month, and
which is
unaffordable.
A lot of people can't afford that kind of money. I totally agree.
No, and the Care ADHD prices, which I do believe are like one of the lowest, if not the lowest, is a £399 for the assessment, and medication initiation is £599. It's an important service, and then you're doing right to choose as well. But I think it shows the heart of what you're trying to do, what Care ADHD are doing, which is this focused quality service, but looking at price to make it as accessible to everyone, recognizing that we have a problem. Some people, the NHS is not there.
I mean, I should say that I mean, my reason for joining Care ADHD from the start was very strongly motivated by, apart from personal ones, I've got 2 of my kids have got ADHD, and it took them a long time to get any service or any help, really. And although I'm pretty sure, when they got diagnosed, and I have to say, I did probably what the usual parent thing is, but what do you mean they're just like me? You sort of think. So I've got personal reasons, but having done the guideline on it, and having had the chance to really look at what the evidence is. I don't know if you know, but I'm guessing you do know, that actually the evidence behind the treatment in ADHD is really remarkably good. So much so that actually the use of medication, so methylphenidate and lisdexamfetamine, in children, the effect size is about 3 to 4 times as big as almost all the other psychiatric drugs. So it is an incredibly effective intervention. And again, with children, we've got huge amount of evidence around parenting programs, around behavioral interventions, about enhancing those interventions by linking up with the school. So when I was approached by Care ADHD, I know both Mark Pattison and Bobby Pratt well. I've worked with Bobby before. I said I would be chair if for 2 key reasons. One, if we are going for really high quality, nice concordant care, and I can guarantee that, and I would hold them account to that, and that we could demonstrate that we were the lowest cost and a lower cost than the NHS. If we could do both of those, I would be chair. And they both agreed. And it's a great opportunity to do something that I think, I spent 16 years doing NICE guidelines. That's what they are all about. High quality, low cost care. And I think we're proving it can be done. They are a fantastic team, I have to say, but
I've certainly been obviously very impressed by them and got to know them as well. As I have, onto our questions. I was just struck. So were your children diagnosed before or after you did the ADHD guidelines for NICE?
Oh, after, yeah. No, after.
And did you? But when you looked at those, there was no epiphany about you. There was once it was brought home that you recognised.
When I did the guideline, I do remember one of the guideline group members, who's an expert in children. She did come up to me and tapped me on the shoulder and said, I mean, I won't say exactly what she said, but it was very funny. I think she said, "You're so fortunate to be very bright because ADHD doesn't work so well if you're not." And I was completely taken aback. It was she'd obviously been looking up close. I sort of guessed that it was quite likely. I share a lot of similarities with my children who have been diagnosed, so it's not a surprise.
Tell us about doing the guidelines, because it was a bigger deal than I think people know, and people know it was a big deal.
Okay, so when we came up to doing the guidelines, I had long conversations with NICE because it was a very contentious diagnosis, and there were a lot of people in the press and in the what I think of as a sort of anti-psychiatric lobby who are saying this was medicating children in particular who were basically naughty children, and there was nothing more to it. And so I spoke with NICE and said, I thought it was really important that we looked at the evidence behind the diagnosis. We've never done that in NICE guidance before or since.
Oh, wow.
So we had a whole work stream, which I personally oversaw. Now, I didn't chair the guideline. I did what I call facilitated the guideline. I chaired the very first NICE guideline and set out the methods, but we have an independent chair. My job is to lead a research team and to facilitate the guideline group. So I helped them work their way through everything. And I had a research team that did all the work for them. And then I'd help the guideline group understand what that research evidence meant, and then how to make recommendations out of it. So we had a work stream on diagnosis, and when we finally produced the guideline, I could stand up and perfectly happily talk about the reality of that diagnosis, and to the shock of some people, I remember in one interview with the press afterwards, where I was asked, well, is it really real? What do you mean? How do you know it's real? What blood test can you do? And I said, well, in diabetes, there is no blood test that proves that you have diabetes, but you can measure blood glucose. And if blood glucose goes above a certain level, we know that that's harmful to people. And in exactly the same way, we can measure people's behavior and experience. And we know that when hyperactivity and impulsivity and inattention reach a certain kind of level, it impairs their function. And they can't, I fail to see how that's different. And I do think that, it's one of the things that we can do is we can see what impairments come with those kind of behaviors and experiences. So to go back to your question, Henry, yes, it was a very big deal. It was the biggest deal of any guideline that we've done. So I after we launched it, I spent 3 days continuously in TV studios, radio studios, interviews with journalists from Tokyo all the way over to Los Angeles.
There was worldwide interest.
Absolutely worldwide interest. And we used to produce a hard copy of the full guideline, which is big. Yeah, I mean, it's 1,500 pages. But the guideline, without all the evidence, you could get links to the evidence. But the guideline, 200 and something pages, we had to go to a reprint. We were selling it all over the world. I mean, it was extraordinary. It was the biggest launch we ever had, biggest interests that we ever had. And as I say, the evidence in it is some of the strongest evidence in mental health.
And something to say to the guidelines, and as you just said, Tim, all of the information is there. Like, you can go to the NICE website, you can go and click into the research, you can go and see what was presented. It's there to be seen, and obviously you've talked about there to back up the recommendations that have been put in place and have changed many people's lives for the better, myself included.
Well, that's great to hear, Henry.
Well, I was actually going to say, yeah, thank you, because honestly, it's right. Must not cry. Most of those interviews weren't so friendly. And a lot of, and why you did all the research and evidenced it was because a lot of people are just like, it's naughty kids, or it's not real. We deal with newspaper articles saying it's just a fashion, it's a fad. Another one saying it's a social contagion. Another just going, it doesn't exist at all. It's just a made up thing. And right now we're in the midst of a big debate. To be honest, we're in the midst of what can only be classed as a culture war in terms of the characterization of ADHD, as we're just trying to lay about, trying to get on benefits, is the framing, pointing to unprecedented demand, linking it to COVID in terms of the demand. We're all at home suddenly navel gazing. What's your view? What's your view on the increased demand? What's your view on the debate?
I don't think there is increased demand, but I could be wrong about that. I know that there's some speculation that entering a world of social media and our connection to the internet, that this is changing us. And I do recognize myself that that when you're bombarded with emails, with messages from all different places, I know that from my point of view, my ability to concentrate goes down and down. Yeah. That
I know I've had this discussion with another, and one of their points was that the big difference is when you withdraw those things, then the situation for them changes. I worry I just took your point away.
No, not at all. What I was going to say...
Was the ADHD jumping in?
What I was going to say was that although I recognise that those being bombarded all the time isn't great for my ability to concentrate and focus my attention, and I'm sure it's not for anyone with ADHD. I'm not sure it's the cause. Yeah, I'm sure it makes things worse. Now, there was a study which no doubt you've seen, which is, I think King's College did it, which have made they've made the assertion that they think that about 5% of the population have ADHD, and that we're not seeing a sudden rise in ADHD. We're actually just seeing more people coming forward. And obviously, with the possibility that you can get help, it's more likely that people will come forward. So certainly I'm not sure. This has happened with a lot of different mental health problems, which is that anxiety and depression and so on, is that more people are on antidepressants than ever before, all this kind of thing. Are we over medicalizing, etc., etc.? I counter that by saying, when I started being National Clinical Director in 2016, our estimates were that we were actually seeing and helping only 1 in 4 children who had a mental health problem. And that we're seeing probably a little bit more than that, but not much more, in adults. And basically, what that meant was that we're saying, oh, we'll only see you if it's very severe. Or, and this is a slightly jokey way of putting it, which is, it's a bit like saying, you drink a quarter of a bottle of vodka a day. Oh, that's okay. Come back when it's 1. Yeah. And you think that's absurd, but that is what's been happening. So it was my job to try and increase the number of kids that we were seeing. And I'm thankful to say that we've nearly reached half of all children that need help are getting help in the NHS. Sadly, and unfortunately, kids with ADHD and autism, that has not happened for them in the same way at all. And equally, I think with adults with ADHD and autism, they are not getting that kind of help, which is what makes right to choose so important.
It does.
So just to summarize that, I don't think there is evidence that this is a bunch of people running around going, look, I don't fancy working, or no, I want some stimulants, or whatever else. I think this is absolutely real. when you meet people with ADHD, as you know just as well as I do, there are some tragic stories, and it leads to, untreated, leads to an awful lot of difficulty. And conversely, I remember doing a radio program when we launched it. It was a phone in, and this mother phoned in and said that her son, who was 5, who she thought was very bright but couldn't be sure. He didn't read, he didn't write, he couldn't really sit still in class or anything. They were thinking of excluding him. She got him help privately. He got an assessment. He was put on some medication, and within 6 months, he was reading, he was writing. Yeah, he was able to stay in the classroom.
Yeah.
And you just think, that is a kid who could have been excluded from school at the age of 5 or 6, and you think, this is perfectly real.
Yeah, and how many more? Like, the numbers we're missing. And in terms of overdiagnosis, it's like there's a big study done, and it looked at 9 million GP records. It was published in January of this year, and it showed 0.32% of those had a record of having ADHD, which is nudging 10%, if that, of the actual population of people with ADHD. And so we're wildly underdiagnosed. If we think about things like PTSD, PTSD was first recognized, like, you're going to correct me if I've got this wrong, first recognized, I think, in 1980, and formalized within the NHS in the 1990s. Like, we wouldn't be shocked if we saw PTSD rates increasing because we just didn't recognize it before. And that's exactly the situation we've got here. You're just like, it's a farcical piece of evidence. Say, oh, numbers are going up. You're like, well, of course they are. It's because we didn't count before.
Absolutely. I mean, it's a little bit like, I remember when we did work on children that following abuse and traumatic experiences, recognizing that many of those kids had PTSD and that you really had to ask about it. You shouldn't just leave it. And, since then, people have begun to recognize that that's, big surprise. Of course, they've got PTSD. I mean, that's what happens to most of us when you go through very, very traumatic experiences. I think that it's a similar problem across mental health, that we fail to recognize that experiences like anxiety and depression and post-traumatic stress and so on, ADHD and autism, that these things actually impair people's lives, that you fail to function, and it's associated with significant levels of distress, just as it is with physical health problems. And we recognize that little by little, more and more. And I think ADHD in particular and autism are behind the curve of the rest of mental health. It's being seriously under-recognized. And people, like you say, are resistant. They think,
When you have people saying it's not serious, like, what do you say to them?
Well, I usually give the example of diabetes. You can measure this perfectly easily, and there is no test for diabetes, so you're left to measurement, and you can measure the level of impairment. And when you reach a level of hyperactivity or inattention or impulsivity that causes impairment or distress, you know that it's perfectly reasonable to have treatment strategies that will help. And you do the same in any physical health problem as well.
There's immense frustration where we see and understand that the importance of a diagnosis, the enlightenment it gives through the knowledge it gives, the benefit many find from medication, and that's being stopped. We've see high suicide rates.
Absolutely, and yeah, which I agree. It's not just the ADHD that's helped; it's the corollaries. It's the, it's the I know a lot of people with ADHD who get quite anxious, who get quite depressed, who go out
particularly
and
undiagnosed, right? You're trying to work out life, and it's extraordinarily different and difficult.
Yeah.
We've seen the figures around life expectancy too. Again, that same study of 9 million GP records showing a significant reduction in life. I think between 4.5 and 11 years less for women. It's for men it's 7 years less. For women it's 9 years less on average. Like, it's a huge difference in that corollary to physical health that we are seeing. Absolutely seeing. I did to just compare. I went and looked up like what is the life reduction for smoking, and it's about, I think it's 11 years, isn't it? So it's not like we're nudging the same sort of numbers and getting absolutely none of the attention, and especially when obviously got these treatment options. We're seeing the government just sort of talk to ADHD as like it's a problem, seeing all of the expense of an assessment and intervention and none of the benefits. Like, what do you say to that?
I think it's up to us collectively, people with lived experience and professionals, to just push to one side all this negative stuff about, well, is it real, isn't it not real, etc., etc., and say, we have a sizable number of people who have significant impairment, significant levels of distress, significant negative impact on their lives, often getting worse the longer this goes on.
Yeah.
And we have some really good treatment strategies that can help them address that. And it's wrong to stop that happening, in exactly the same way as it's wrong to deny people anti-cancer treatments. And these work. That's the point, is that we've got really good evidence that these interventions work.
We do. Like, I obviously know in my own life, like, and when the people I talk to, and it's only a frustration for me that we're talking about millions of people. Like, I think the NHS task force came up with a number of around 3 million, and I think that's England alone. Like, and you're looking at things like increased exclusions from schools, likely to be in pupil referral units, increased percentage of victim of crime, in like being in crime, so a number of the big national problems. We did talking to an organisation working with NEETs, and their estimate, which is like, I have to caveat very carefully, not academic, very much sort of screening and one person trying to see, but the figures they came back from testing 100 people was 80% screened positive for ADHD, and so you're seeing some of the major challenges of the country around the criminal justice system, around education, around NEETs and young people's employment, and the intervention on ADHD being potentially one of the most significant interventions we could get. And instead, we're just being told, oh, you just go get a assessment and live a life of like on benefits and give up on life. And all the conversations I have with people, I genuinely can't think of one where it's been different, is like, I have ADHD and it's been a struggle and I want to change my life and I want to go for the positive through the assessment process. Let's talk about waiting times. What do you think about them?
I mean, waiting times shouldn't be happening. I mean, I say that slightly glibly. I know that they are there. So the NHS has not been able to train enough people to to be able to
Yeah.
diagnose and treat.
I think it's important to say the NHS, because within Right to Choose, we have seen the ability to scale and to train, and the NHS and the behemoth that it is does not have that kind of flexibility.
No, that's absolutely true. I have been. I mean, I don't want to shout too much about Care ADHD because I'm obviously biased, but the team have done a fantastic job of scaling up, exactly as you say. I mean,
yeah.
You know, my job is not actually to get them to scale up. My job is to hold them to account on those two key issues. I want it to be highest quality we can get, and I want it to be outstanding. And the second thing is I want it to be the lowest possible cost. But they have scaled up in a way I've never seen. I mean, it's extraordinarily, brilliantly done, training people, bringing people through, getting the right governance processes in place at the same time. I've been deeply impressed.
I have to probably I do say I have seen it in some other Right to Choose providers and some not, to be very clear. We've had some awful examples where wait times have become catastrophically long, and real mismanagement of waiting. But I think that ability for the private sector and supporting the NHS to scale up is clearly fundamentally different, and it's something the NHS should be using. I think that obviously have been teething problems with all, and I think people have been pretty honest about those. But it's nothing to do with the quality of the assessment service itself. It
is true in large parts of the country that the waiting times for the NHS are so long that it means no one's really bothering. Yeah.
Let's talk about Sheffield. I laugh. Why am I? You have some links with Sheffield. Like, what's going on there? Like, last figures we saw for people is the BBC figures. We were in sort of background providing some support and advice there. In particular, we were saying to the BBC, you must not accept the answer of when you ask how long do people wait, do not accept the answer of we're currently seeing people who were seen in X, because it hides a lie. It's a lie of omission in my view, because it hides how many people are waiting, how big the service is. And if the quantity of people have increased, then you might be saying, last saw we're seeing people who were put on our list in 2023, December 20, you assume 2 years, but actually double the number have joined, or the service is halved. And in fact, it's twice as long. And so we said to them very clearly, you should get the number of people waiting, and you find out the throughput, number of people were seen in the last year. And for Sheffield, that was over 6,000 people waiting and 3 assessments. So an effective wait time of over 2,000 years.
I mean, as you know, well, first off, I was born in Sheffield, and I've lived in Sheffield for all bar 10 years of my life when my parents moved us down south. But I came back to medical school and I trained here, and I've worked in mental health services in Sheffield for 41 years now. It wouldn't really be fair for me to comment on Sheffield directly.
Too tempting.
but let me say the general case. I know that when you have long waiting lists, it's almost impossible to fathom the real need in an area, because people don't bother coming forward. If they know that it's 4 years.
I hear you on that. I would push back, partly because I thought about doing a ranking, and worked out the maths, which is like, you've got a population, you've got an age estimate, which is quite easily available. You can do some pretty simple maths on roughly how many ADHDs are likely to be there. And you can work out, and you've got the medication numbers per area, so you can work out roughly, take a ratio assumption, and you can go, you've got this many people you've not seen, as well as your queue. So there are some things you can do.
Henry, I entirely agree with you. I think my point was that you can't use the waiting list as evidence of unmet need. It's going to be well,
because you've got, and we've seen that in areas. You've got shadow, like someone described it as a shadow waiting list where people are just put off. We've seen that amongst in some areas, like where GPs make it very hard to get put on the list. We've got triaging now in some areas which create multiple lists, so it becomes hard to get clarity. I have to say, NHS England, I know they're in their last throes, but actually you've done some quite good work on creating data points. So that can be seen more clearly. It's, I have to say, slightly boggled my mind that those things didn't exist before. I think that shows us my lack of understanding of those kind of big systems that have evolved. So we're seeing new providers emerge, Care ADHD being an example of that, supported by Right to Choose. What's happening?
I mean, okay, again, this is caveated by the fact that I'm chair of Care ADHD. I think that since Care ADHD arrived, which is now, it was April 2024, I think it's been a very positive influence on the service. I'm aware that some other companies, private companies, are following our example of enhancing quality, but some are not, and I genuinely worry about that. I think that I also think that
it's something that we struggle with, which is, and I think it's particularly hard in this country, which is there's a sort of understanding that you have to say everyone's perfect in the medical world, and trying to show the differences is very, very hard, because it either meets the medical standard or doesn't. Maybe a conversation for another time. So definitely would like to help steer people. If we put reviews on the site, which people have recommended, suggested, they'd just get manipulated. They wouldn't have the volume to be reliable. Okay, back to waiting times, and so what are we seeing happen in Right to Choose now? What is Care ADHD seeing happen?
Okay, so my understanding of Right to Choose, which is, I'm not a lawyer, I'm not a, sort of, it's basically that if somebody has a health problem of any kind, that they can go to their local NHS, and if their local NHS says we can't see you for well over 18 weeks, which is the standard that they should be seen with.
I think the 18 weeks, which we're going to go to, is different from Right to Choose. So Right to Choose is the ability to choose where you go. And to quote a commissioner, he said it's the National Health Service, not the Regional Health Service. And it was put in place, some legislation put in place to say, you as a person within the NHS and this NHS England, you have, if you don't want to be seen locally, you can choose to be seen elsewhere. It's your NHS. You're living in Brighton, want to be seen in Sheffield, or vice versa, then that is your right, and that's right to choose. 18 week is different.
I think given that it's the ICB that has to put up the money for healthcare, if there was a local place which had which you could be seen and treated relatively easily, they would probably be unwilling to fund anything outside of the area. But they have,
and it's unlikely people would want to.
I think they have an obligation to do it if someone can't get the service locally. And my understanding is that we now have a lot of people who recognise that they probably have got ADHD.
And
well,
we had the task force showed a wait, and this is only on the NHS lists of around 500,000.
Yeah.
Then there are additional people waiting with right to choose providers. So
Yeah.
it's a higher number than that.
So if you had that in any physical health problem, and there was no or very little service, or a service, as in some places you're waiting 2, 3, 4 years for being seen, then obviously you should have that right to go and get assessed and treated elsewhere where they can do it. And if that's in the private sector, then so be it. And that should apply for people with any condition. Now, I do understand that some ICBs want to cap that, but obviously that isn't it's not acceptable unless they're to do that across the board on everything. I entirely understand that if an ICB said we've run out of money, we're actually going to have to cap healthcare, then okay, that's a matter between them and central government, but they can't do it selectively. They can't say, oh, we're going to cap ADHD, but we're going to carry on with heart transplants.
Why can't they do that?
Because it discriminates against people because of their diagnosis. It's wrong to say we're not treating people with a mental health problem, but we are treating people with a physical health problem.
But doesn't healthcare just make those choices anyway? Isn't that what commissioners isn't that what commissioners and ICBs do anyway? Which is like, we're going to fund this and more, and that one less.
Okay, so an ICB's job is really to know what the needs are of their local population, and then to match their provision of healthcare according to that need. So if they're doing their job right, if they have an awful lot of unmet need around ADHD, they need to rejig their provision of services so they can meet those needs. Now, obviously they can't do that if they don't have the staff to do it, and that's where right to choose comes in.
Yeah. And very importantly, the 18-week promise of the NHS. So right to choose is the right to be seen in any part of the NHS. The 18-week promise of the NHS is probably a level above that in terms of surety. What are you able to tell us about that?
Just not quite sure what you're asking, Henry.
So the current wait list that the Labour government are focused on is people who have the promise of being seen within 18 weeks on the NHS.
Yeah.
And ADHD has been excluded from that. So the targets, the number that when the government says we've got X amount of people waiting, we're not included. And as such, we're deprioritised for dealing with the wait lists around ADHD. However, if you are and do have the 18-week promise within the NHS, which is for consultant-led work, then the right to choose rests with you to use your right. If you're not being seen within 18 weeks of something that should be seen within 18 weeks, the ICB actually has to offer you alternatives if they exist. And at the moment, we're seeing reductions being put in place for our individual activity plans. This would go over that. So are you able to talk to us around individual activity plans, around the wait times?
All I can say is that I personally believe it's wrong to pick ADHD or autism and say we're not going to do it for them, but we are going to do it for everyone else. I think that's fundamentally morally wrong. I also think it's probably illegal.
Yeah.
And it needs to be contested.
And I think we've seen some legal advice that says that.
I think that's probably true. I'm not an expert on this by any means. It's not really been something I've had to deal with very much.
But it's an extraordinary thing we're seeing, right? You've got
Yeah.
an area which is saying we won't see any adults with ADHD over the age of 25. A clear age discrimination.
Fundamentally wrong, in my view.
It is. I obviously completely agree. How important do you think right to choose and choices in the NHS for ADHD?
Well, at the moment, it's very important. It would be less important if the NHS itself got to grips with providing high quality services for ADHD. I don't think they're going to do that anytime soon. As you say, to do this effectively and to scale it up to a national level, I think it would be difficult for the NHS to do that. So right to choose at the moment is probably the best way in which that can be addressed. That unmet need can be addressed.
And ICBs have an obligation, right, to people. If not, people aren't being seen in 18 weeks, have an obligation to create a plan. At least that's my understanding. And I think you've talked about you disagreeing with it, and like in your view, is it a matter of patient safety? Like, why do you think it's so important?
Why is it
do people get a timely ADHD assessment?
For the same reason that they should when they're depressed. I mean, it's there are consequences for the people who have ADHD who go untreated. If it's kids, we're talking about failing at school, losing friendships, often end up being bullied, and by the time they're 16, 17, 18, they're using drugs, they've got high rates of self-harm, they've got increased risks of suicide, they don't get jobs. You sort of think it becomes a conveyor belt in which failure is always around the corner. Yeah. I mean, interesting. I was talking to at the Global Ministerial Summit that I've just come back from, and I was talking to the chap who's effectively the National Clinical Director for mental health in France, and he was saying, that he failed all his exams at school, and he says in retrospect he's now pretty sure that all of that failure is because he had ADHD that was untreated. And you sort of think, with help, he's now risen to the top. He runs a very prestigious department of psychiatry. He's got a big research program, and he's the equivalent of a national clinical director for mental health in Paris. And you sort of think, well, he's a bright guy. He's lucky. He got some help, and things have worked out. But I know that en route, he had to go through a great deal of suffering and failure and the like. Me, I failed all my exams at school. I ended up with 3 O levels.
Wow.
It's
How did you turn that around, though?
Well, what I discovered was that I can also, if I get into the right frame of mind, I can hyper focus, and it basically means pressure does it. Yeah. Now, pressure doesn't always do that for people. I'm quite lucky. Yeah. But it's a bit like I get my own version of methylphenidate or lisdexamfetamine, And it is true that when I hyperfocus, I think my wife would tell you, you know, she can't get through to me. It's just there's nothing else. There's just that. And I've noticed that in my son as well. That he looked like he was heading for failing all his exams and that kind of stuff. And we got him help, and he turned it around, and it's all worked out incredibly well. He's he's done very well, gone to medical school and all this kind of stuff. So with the right help, there is absolutely no doubt that people can turn their lives around. But the longer someone doesn't have that help, the more problems arise. And as I said, with that mother who got onto a phone in, her son would never have learned to read or write or do well at school if he hadn't had that help at that time.
And yet we have the people saying like, oh, it's an ADHD intervention, is just laughter benefits, whereas like in that case, almost certainly the exact opposite. How have
I just want to reiterate there that the medication interventions in ADHD have the best evidence for benefit of any mental health intervention we've got. It's the strongest evidence we have.
Extremely important. How have you dodged the you talked to me about using pressure to get stuff done. Like, I suppose I've got two questions. Like, how have you dodged the anxiety bullet? So, which is that people use pressure as anxiety, use anxiety to get stuff done, and they live a very anxious life, and that can be catastrophic. And then the other is, how do you get the small stuff done?
No, I agree. The small stuff is, yeah, I agree with you. It's the small stuff is always difficult. If it comes to doing six nice guidelines all at the same time, where I'm moving, so for each one you're ultra focused on just that thing. So I can do that, but then get home and remember to do all the things that you need to do at home. That can be more of a challenge.
You're amazing. It's been wonderful talking to you. Thank you. And I'd say thank you for all you've done for people with ADHD. I'm excited for your work with Care ADHD and what's happening overall in Right to Choose. The accessibility through good price is important, and I think we're going to, as a charity, going to be trying to make a bit more noise about that. We've talked for a long time about listing organisations and price, because we're worried about some people finding themselves caught, and that is something we'll do. It's important stuff you've been talking around the right on 18 weeks and what I think we should be doing. It's obviously a conversation that's going to continue. Thank you. And thank you for being a part of our conference after your global summit, coming to our global conference. They're slightly different, but only a little bit.
No, I mean, I think this is probably much, much bigger and got probably a bigger reach, even though mine was a ministerial summit or whatever else, and it sounds very, very important. But I also think, having a conference like this where you've got a huge reach to people out there in different parts of the world, fantastic. And I'm very pleased to have been asked to join you.
Well, I'm thrilled that you said yes, and it's been absolutely wonderful. And it's a delight, and I think just important that people know that there are people in serious positions of power and who are trying to make a difference for ADHD. A lot of the time, particularly now, it feels like a big fight, and knowing that people like you there is a big deal. So thank you.
Thank you.
I have to say goodbye. We're out of time. Tim, thank you very, very much. Have a great rest of your day and evening. Thank you.
Thanks.
Goodbye, Tim. Thank you. that's it. We've done the conference. I think it's 28 hours, which I was live for 20, or 21, and I need to say thank you to some people, and the first one I need to say thank you to is Lauren. Lauren Jennings is our lead ADHD ambassador. She's the one responsible for helping other ambassadors put and asking for those videos, which have been just wonderful. But she has been in the background this entire time. So when people come on, she welcomes them. She helps organize and solve a lot of things. But she's been here the whole time as a shadow. So I need to just welcome her. But there are then many more I need to say thank you to. She sent me a message. I need to do something, but I can't do it right now because I have to refresh my screen. So I'm going to bring her on because I know she's got some words to say, and hand over to her. But you obviously, as ever, backstage, hearing me say thank you to you, like this is only one of many, many things you do in terms of making a difference within the charity, and you are extraordinary. Thank you. You've got some words. I'm going to hand over to you.
Yes, I also have a video that I'd like to play, but I just want to say thank you to you, Henry. You know, this conference has been absolutely incredible. It is every year. It's been really, really fantastic, and thank you so much to all of the speakers, and obviously to our incredible ambassadors. You know, they put so much dedication and heart into every single thing that they do. They really do, and I'm just so grateful to be a part of this team and to be a part of ADHD UK. And I just want to say a massive thank you to everyone, and hopefully we'll be able to play the video in a moment.
We will. I think I just jumped out and in again, which I'll let, we're at the end of the conference. We can let people behind the curtain somewhat. So if we have videos come on, well, one, we can only in this platform, which is pretty good. We can only have a certain number of videos. But we have to, for us to be able to see them and play them, we have to refresh the broadcast screen, which is absolutely terrifying. And for fear that everything will be stopped. We actually have other people logged in. Lauren's one. I have a laptop over here with others, so that the stream continues. But I have to refresh to be able to play, which is what just happened. So I should have the videos to play. Oh, amazing.
This is why making Newport City neurodivergent friendly is so important.
Wow. Oh, wow. That is absolutely amazing.
I know, I feel really, really emotional just watching it. You know, ambassadors really put their absolute all into every single thing that they do, and it's usually because of our own lived experience in hopes to help others. And it really is utilising lived experience as a catalyst for change. And I'm just so grateful to be a part of this team. And thank you so much to everyone for everything they do.
It is, we as a charity are so much smaller than people realise. In terms of staff, it's myself and it's Anna, and I need to do a shout out to Anna, who's an extraordinary person and runs. We talk about some of the challenges of ADHD and parts of the admin, and Anna is everything on that. And she has been organising, rallying, and putting things together, and conference folders, and all of the things. And she's been fantastic. And so we are a small charity that does a lot, and that's because we're a lot less small than people. The reality is we've people like Lauren, the ADHD UK ambassadors. We've got people like Jodie, I have a list that I'm supposed to read out, which I need to read out, but we have an amazing number of people who get stuck in and get involved, and that's how we do stuff. And that was testimony to that was when we had the big MP campaign, 14,000 people writing to their MP in 14 days. And that was something that was brought together with volunteers like our tech volunteers, put the code together, created the structure for that. Message went out, it's amplified by ambassadors, and more than just messaging, amplified, shouted about, screamed about, talked about, and we got that U-turn, and it's something we're going to need to do again and again and again for us to get these changed. So it is. So thank you, Lauren. Thank you, everyone. Do you have any other further words you want to say, Lauren?
Just fantastic speakers, absolutely incredible. It's been such a
again, all volunteers giving their time, like or donators. Absolutely brilliant. We are going to watch this video once more. Then I'll do my last thank you to you. Then I'll do my official thank yous.
This is why making Newport City neurodivergent friendly is so important.
Genuinely, like, again, like, obviously been doing this too long, you know, edge of tears. And I have to say, with the ambassador videos, the same. Like, I was so moved by them, and seeing all the people getting involved to make a difference, it's wonderful. Lauren, you're amazing. You've been extraordinary. Your support during the conference has been absolutely wonderful, and you know, I cannot thank you enough. So thank you. I need to say goodbye to you and do my all my thank yous. Thank you, Lauren, and say goodbye to that lovely video which Lauren has, I think, just created. So a delight. I've got to do my thank yous, and then I've got to sign us out. So the conference is 28 hours live long. I've compared for an epic 21. We do conferences differently, you may have noticed. We don't rent a ballroom in, say, Birmingham or elsewhere. We do them online for free. Donate if you can. We do that to get the information out to everyone, to help as many people as we possibly can. We try so hard as a charity not to put financial barriers between people with ADHD, people affected by ADHD, and information that can help them. All our support groups are free, but donate if you can. But a big part of that is because all of them are run by people volunteering to do it, and they are amazing. All of our speakers today have donated their time, and it is an effort we all do together as a community, and it's something very, very special. I can't tell you enough. It is ruinous financially as a charity to do what we do in terms of not having a paid for conference, not getting people to pay for those different things. Every month is hard. We are the reason we're so few people is that we can't afford any more, and it is it's tough. We receive 1/600th of the income of the National Autistic Society. It's not to begrudge them their income, it's just to show how different it is. And ADHD is a stigmatized condition. People find it hard to go out and say, I have ADHD, I'm rattling a tin for it and fundraise. And it's one of the reasons ADHD UK ambassadors are so special and important, because they are going out saying, I have ADHD, I'm here to make a difference. And it's a wonderful, amazing thing. and want to make it so everyone can feel comfortable, but there is serious prejudice that people have to deal with, and we all have to decide sometimes if we are in a place to do that. I need to do some thank you for the people behind the scenes, and my apologies for all those I'm about to miss. I need to thank our partners in this, ADHD Australia, the co-organisers of the conference. In terms of thanking Anna, everything keeps us running, and she has also been alongside virtually for this conference. We have Chris on social media. She's been promoting the conference and pushing to get the epic support that we get. I've talked to Lauren directly, conference live support, conference support, talking with the ambassadors, helping they're in extraordinary action. She's been welcoming our guests, getting them set up, ready to be in front of you. She's the person dealing with the last minute panics and situations. We have Jodie and her team and all the volunteers on Facebook. They are the unsung heroes. Managing Facebook and is a hugely difficult thing. You're talking, there are lots of people, many are really in challenging circumstances, and they do an awesome thing. And I know people love to rail against a moderator, but like, it is tough, and we have an extraordinarily large community on it. It's very hard to do. Most other charities shy away, and we don't, because we know how powerful community is. We've had a segment in the conference for that. We have our tech volunteers, Danny, Dom, Ian and Seraphin. They together launched our MP campaign, and they're creating the Discovery platform, which is a platform to help people find customized strategies, products and ideas that make a difference. And that is a project of years long length, and they are wonderful, and I thank them. We have the trustees, Max and Neil, and a big special thanks to Neil. For hard yards of maintaining, he's chairperson, hard yards of maintaining a structure and organisation at top level. Leadership and support that he's been doing is hard and very special. And Max, who's been alongside the whole time, who I'm in both awe of and grateful for. To all our speakers, they volunteered their time, and to the community that I am privileged to be a part of. Together, we are doing this. We are making positive change for people with ADHD. We can only achieve it together, and we are. Thank you all for being part of this community. Thank you for being part of this conference. Thank you for being you. Thank you, and that's it. Good night.